mRNA injection and hid that fact from the public. Our second hearing allowed witnesses who have been impacted by vaccine injuries and fatal infectious diseases to tell their stories. The news media is all too willing to highlight a new outbreak of an infectious disease, but is loath to broadcast what they generally describe as, quote, rare and mild, unquote, vaccine injuries. As a result, the vaccine injured have been ignored and abandoned. In September 2024, I held a public roundtable discussion titled American Health and Nutrition, A Second Opinion, that highlighted America's alarming rate of chronic illness. Dr. Chris Palmer, a psychiatrist who studies the impact of nutrition on mental health, testified that when it comes to chronic illness, quote, they do not want root causes to be discovered, unquote. By they, I assume Dr. Palmer was referring to the powerful entities and individuals whose multi-billion-dollar businesses and organizational interests would be disrupted by the knowledge that the products they produce or promote could cause harm. They certainly don't want the public to know the root cause if it's one of their products, and they're willing to go to great lengths by spending billions of dollars on advertising and lobbyists to keep the public from even asking the question, much less finding the answer. The purpose of these hearings is to force the acknowledgement of reality. Exactly what all the realities and truths are, I cannot say. What I can say for sure is that we have been lied to repeatedly, and that in order to restore public faith in federal agencies, integrity must return to science. We must also have open minds and be willing to face the truth. It's been interesting to see the media's reaction to our previous hearings. Except for a few highly biased attack pieces, the legacy media has largely ignored what I consider to be highly informative hearings. Perhaps they are taking advice from Senator Blumenthal, who hours before our last hearing, Voices of the Vaccine Injured held a press conference and was reported to have stated, quote, I hope nothing comes of this hearing. I hope people don't pay attention because it isn't deserving of credibility and attention. However, during that hearing, Senator Blumenthal stated, quote, I am heartbroken to hear these stories. It makes me want to do something, unquote. So maybe hearing true, incredible stories of vaccine injuries actually did deserve attention. I certainly believe today's testimony deserves attention and hope it will prompt us to do something to restore credibility and integrity to science and our federal health agencies. Senator Blumenthal.
Thank you, Mr. Chairman. Welcome to everyone. Whether you agree or disagree, this hearing is not personal between Senator Johnson or myself, between any of you and the witnesses. This hearing is about, quote unquote, the corruption of science. And I agree. We are witnessing the corruption of science. It's happening before our eyes in real time. Maybe more accurately, it should be entitled the denial and degrading of science. When the Senate confirmed director of the CDC is fired because she refuses to fire officials or approve unscientific vaccine guidance without evidence, that is corruption of science. When the indisputable determination that greenhouse gases pose a threat to human health is rescinded and clean energy projects are canceled in favor of pollution-heavy coal, that is corruption of science. When the CDC's measles risk forecast is suppressed in the middle of the worst measles outbreak in decades, that is corruption of science. Overriding ongoing corruption of science is to deny or spawn doubt about safe and effective vaccines that discourages people from making use of them to save lives and keep our kids healthy. The Trump administration's corruption of science is unprecedented in our country's history. Our committee has analyzed the ways in which the Trump administration has interfered with science in just the first 8 months and found 57 separate, discrete instances of corruption of science. And if there's no objection, I'd like this staff memorandum to be entered into the record, Mr. Chairman.
Without objection.
Since President Trump took office in January, Secretary Kennedy and other administration officials have silenced scientists, halted research, crippled our public health infrastructure, and politicized institutions that were once renowned around the world for adherence to nonpartisan, science-based recommendations. And they've also demonized vaccines and taken steps that will make it harder for Americans to access them, depriving Americans of basic public health tools. Less than 2 weeks ago, President Trump fired CDC Director Susan Myers, barely a month after she was confirmed by this body, the United States Senate, because she refused to go along with Secretary Kennedy's demands about changing vaccination policy. This administration not only wants to consult people who will tell it what it wants to hear, but it denies others who have accurate, fact-based words that should be heard. That is not science. It is zealotry. It is an obsessive distortion of facts and a adherence to conspiracy theories over science. Secretary Kennedy is creating a public health system that puts allegiance to his dogma over health and safety. Just last week, more than 1,000 present and former HHS employees wrote an open letter calling for him to step down, stating that he is, quote, endangering the nation's health by spreading inaccurate health information, end quote. Without objection, Mr. Chairman, I'd like to enter that letter into the record.
Without objection.
I certainly concur with their conclusion. A charlatan like RFK Jr. has no place in the government or anywhere else near public health. I am deeply fearful of the consequences for our country if he remains in charge, and unscientific rhetoric, corruption of science, continue to rule the day and perpetuated by people in leadership positions. So I have some questions. How many preventable diseases will become out of control because people cannot or will be discouraged from getting vaccines? How many advances in science and medicine will we miss out on because the NIH is cut in funding and research is impeded? How many public health workers will lose their jobs? Public health workers who could save lives and health. I deeply fear for the future of public health in this country because of the corruption of science. On August 8th, a gunman fired nearly 200 rounds of ammunition into the CDC's headquarters in Atlanta, allegedly over his anger about the COVID-19 vaccine. One heroic police officer tragically lost his life. Dr. Robert Malone, one of the new members of the Advisory Committee on Immunization, or ACIP, appointed by Secretary Kennedy after he fired all of the sitting members, made multiple statements that appear to threaten violence against scientists and public officials before and after that shooting. This is an image that Dr. Malone posted. This image, just hours before the shooting, a revolver loaded with a single bullet and the words, quote, 5 out of 6 scientists have proven that Russian roulette is harmless. This was apparently not enough for Dr. Malone because less than 48 hours after the shooting had occurred, he posted several other violent images, including one apparently threatening politicians, and one seen here with an image of an automatic weapon with the words, quote, the Second Amendment was not written in case the deer turn against us. I wrote to Secretary Kennedy in the wake of these posts and demanded a fire Dr. Malone. I would like my letter of August 13th to Secretary Kennedy be entered in the record if there's no objection.
Without objection.
Chairman Johnson, I would ask you to join me in my demand that Dr. Malone be fired. Violence and violent rhetoric should not be tolerated. That is corruption of science. Rhetoric has consequences. Misinformation has consequences. And the failure to respect real science will deprive all Americans of treatments and cures. And before my time is up, Mr. Chairman, I want to acknowledge the study that will be discussed by the majority at this hearing. Citing the fact that one deeply flawed study was not published as evidence of a cover-up ignores the thousands of others contradicting its findings. In fact, as you probably know, there have been 3,000 published studies of vaccines, 1,000 since 2020, showing vaccines are safe and effective. The estimate is that thousands of lives have been saved by vaccines and illnesses prevented. I'm looking forward to hearing from Dr. Jake Scott, an infectious disease specialist from Stanford, by the way, the only doctor on this panel, and why no reputable journal would or should publish that study. It pains me, frankly, it pains me that unscientific studies like this one are being promoted in this committee purporting to be scientific fact. And I fear that this kind of hearing will only undermine our already shaken public health system. But in the meantime, I want to thank all of the public health workers at the federal and state level who continue to do your job day in and day out, despite the discouraging atmosphere here in Washington, and in some cases, despite these kinds of intolerable threats that should merit the firing of Dr. Malone. Thank you, Mr. Chairman.
I think you see there's a slight difference of opinion here on the panel. I would ask that we enter into the record the study Impact of Childhood Vaccination on Short and Long-Term Chronic Health Outcomes in Children, a both birth cohort study by the Henry Ford Health System in Detroit, Michigan. Ask that be entered in the record without objection. I would also ask that we actually have Dr. Malone in the audience today, and we'll see whether, what opportunity we afford him to defend himself. But in the meantime, I would ask that his basically resume, his CV, be entered in the record as well, because Senator Blumenthal has termed him unqualified for the position, which I completely disagree with. Here's his CV. You might even take a copy. It is the tradition of this committee to swear in witnesses, so will you all three rise and raise your right hand? Do you swear the testimony you will give before this committee will be the truth, the whole truth, and nothing but the truth, so help you God? Thank you. This ought to be an interesting discussion. Before we turn to the witnesses, in preparation for this hearing, I became aware of the fact that a full-length documentary is being prepared, basically talking about how this study was proposed, how it was conducted. And I asked the producers of that. It's produced by the Informed Consent Action Network. Mr. Sirius represents that organization. And I asked ICANN to put together a 5-minute video representative of what they're going to be discussing as they tell the story of this withheld study. So can we run that video now?
Children struggling every day with ADHD?
Scott's allergies made it hard to keep up with his friends.
Allergic reactions from accidental food exposure.
Moderate to severe eczema, plaque psoriasis, rheumatoid arthritis,
Food allergies.
Allergy seizure. The Health
of American children is in crisis.
More than 40% of American children now have at least one chronic health condition.
Autoimmune disease like rheumatoid arthritis, juvenile diabetes, lupus, Crohn's disease, all this IBS.
Just a few decades ago, 1 in 10,000 children had autism. Today, it's 1 in 31.
ADD, ADHD, speech and language, tics, Tourette's syndrome, narcolepsy, sleep disorders.
There's no way in the world these kind of rapid increases in the incidence of disease could be genetic. Genetic change takes generations, centuries to play out.
What the heck is happening?
What is happening? Chronic disease has gone from 12.8% in our children in the 1980s to over 54% of our kids now. That's the greatest decline in human health that's ever been recorded. And people will say, how do you know it's not the pesticides sprayed all over our crops or the hormones in our beef or plastics or forever chemicals? But when we're talking about an autoimmune disease crisis, which is what's happening in America, shouldn't we look closest at the one product that's designed to alter our immune system for life? And we don't just inject it 1 time or 2 times or 10 times or 15 times or 20 times or 50 times. 72 times we are altering the immune system for our children with our vaccine program. There'd be one easy study to rule it out. Compare vaccinated children to completely unvaccinated children. But we don't know because they've never done the study.
It's the CDC's responsibility to do those studies, and they've been ordered again and again and again to do them, and they have refused.
This is information that vaccine safety advocates want, and I'm not sure why it hasn't been done.
What we would need is a scientist that the CDC could trust.
There would have to be a passionately pro-vaccine, highly accredited group of scientists willing to do a super robust, retrospective, vaccinated versus unvaccinated comparative study.
As fate would have it, Del met the head of infectious disease at Henry Ford Health System, Marcus Zervos.
Dr. Zervos is the perfect epidemiologist for the study. He's incredibly pro-vaccine, and he's also used to being in high-profile cases because he was at the center of the Flint, Michigan water investigation. Dr. Zervos only agreed to do this study to prove us wrong.
Del and I thought that was an excellent opportunity.
We only had one request.
Whatever the outcome, you publish it. And he said, whatever the results, they get published. Would he stick to that promise if the results show that unvaccinated kids are healthier? Didn't know.
Impact of childhood vaccination on short and long-term chronic health outcomes in children, a birth cohort study. I've never seen this study before.
18,468 subjects.
Henry Ford, like other institutions, has a bias towards the goodness of vaccines. If the results came back demonstrating that the battery of vaccines was associated with chronic diseases, such a result would be particularly convincing. This could be essentially one of the most valuable studies in the field.
The vaccinated subjects were over 4 times more likely to have an asthma diagnosis.
600% more acute and chronic ear infections.
4.47 times the amount of speech disorders in the vaccinated compared to the unvaccinated.
5.5 times risk.
616% increase. Learning issues, developmental delays, speech delays, language delays.
Amongst the unvaccinated group, there were 0.
There was 0 brain dysfunction, 0 diabetes, 0 behavioral problems, 0 learning disabilities, 0 intellectual disabilities, 0 tics, and 0 other psychological disabilities. None.
It's a big difference.
Very important this study sees the light of day.
This is devastating.
This paper should have been rushed to publication on an emergency basis.
We are systematically making kids sick, and not just a little bit sick, very sick.
This may be the most important study that has ever been done, and it needs to be published.
He knows if he puts his name on this, his career is over.
I know, honestly, really emotional.
Zervo's probably going to lose his job over this.
Our first witness is Mr. Aaron Seary. Mr. Seary is a managing partner of Seary and Glimstad with over 85 professionals. He's handled numerous high-profile cases involving challenges to medical mandates, restoring exemptions, agency transparency, including forcing FDA to release the COVID-19 vaccine licensure documents and deposing immunologists, infectious disease doctors, and vaccinologists. Mr. Siri.
Thank you, Senator. Leading up to 2013, the Institute of Medicine was commissioned by the United States Department of Health and Human Services to review the entire body of existing scientific literature to assess the safety of the CDC's childhood schedule as a whole. HHS paid the IOM to do that. After the IOM engaged in that task with a panel of multidisciplinary scientists, it concluded, quote, "The studies designed to examine the long-term effects of the cumulative number of vaccines or other aspects of the immunization schedule have not been conducted, end quote. That's the Institute of Medicine's finding after reviewing the entire body of scientific literature. Meaning the IOM could not find studies comparing, as you would do to study the safety of a product, an exposed group, meaning kids that got vaccines, the childhood schedule, with unvaccinated children, kids who got no vaccines, which is what you would need to assess the safety of the schedule. Lacking evidence to support safety, the best the IOM can conclude was, quote, "There is no evidence that the schedule is not safe," end quote. This, of course, also means the IOM cannot find evidence to conclude that the schedule is safe. The IOM report did say it is, quote, "possible to make the comparison," meaning through vaccinated and unvaccinated children, "through analyses of patient information contained in large databases such as the Vaccine Safety Data Link," end quote, which used to be housed at the CDC. But to date, the government has still not conducted this comparison. By the way, the CDC published a white paper in 2015 on how to do that study. Has it been done? I don't know. Has it been published? No. In 2017, one of our clients, Senator Johnson said earlier, the Informed Consent Action Network, wanted to see this exact study of comparing vaccinated versus unvaccinated children. As the trailer you just watched noted, Del Bigtree, ICANN's CEO, had met Dr. Marcus Zervas at one point, who was the head of infectious disease at Henry Ford Medical Center. And he agreed to meet and to potentially do the study. He is conducts clinical trials for vaccines, including for the Moderna COVID-19 vaccine. He's avowedly pro-vaccine. And when we met him, we argued that this was an opportunity to shut the anti-vaxxers up about their claim that unvaccinated children are healthier. To our surprise, Dr. Zervas said he would conduct the study. He recruited a chief epidemiologist and 2 statisticians within Henry Ford to do so. These were mainstream scientists who no doubt held orthodox views regarding vaccines. In early 2020, I received a copy of the study. It showed the results of the analysis comparing children enrolled in Henry Ford from 2000 to 2016 from birth onward who had no vaccines compared to those who had 1 or more vaccines. This study was based on actual medical records, meaning finally a large vaccinated versus unvaccinated study using health data from a major United States health institution, something, as the IOM pointed out, never existed before. The study began by explaining it set out to reduce vaccine hesitancy by assuring parents the CDC vaccine schedule is safe. Instead, what these researchers found was that vaccinated children had 4.29 times the rate of asthma, 3.03 times the rate of atopic disease, 5.96 times the rate of autoimmune disease, and 5.53 times the rate of neurodevelopmental disorders, which included 3.28 times the rate of developmental delay and 4.47 times the rate of speech disorder. All of these findings were statistically significant. There was also other conditions for which there were numerous cases in the vaccinated group, but 0 in the unvaccinated group. Hence, a rate cannot be calculated, including brain dysfunction, ADHD, learning disabilities, intellectual disabilities, and tics. For example, there were 262 cases of ADHD in the vaccinated group, and there were none in the unvaccinated group. In this study, there were around 16,000 kids in the vaccinated group, by the way, and around 2,000 in the unvaccinated group. So the rate, of course, between those is important, and that's what the study compared. These findings were troubling, including because these chronic health issues can be caused by immune system dysregulation, and vaccines can cause immune system dysregulation. Citations for this are in my written submission. Overall, the study found that after 10 years, 17% of the unvaccinated children had a chronic health issue, while 57% of the vaccinated children had at least one chronic health issue, often multiple. That's 17 versus 57%. The only real problem with this study and why it didn't get submitted for publication is that its findings did not fit the belief and the policy that vaccines are safe. Had it found vaccinated children were healthier, it no doubt would have been published immediately. But because it found the opposite, it was shoved in a drawer. We have repeatedly urged Dr. Zervos and Lamaretta to submit the study for publication. They have affirmed the study was well designed and conducted, but Dr. Zervos has said he doesn't want to lose his job. And Dr. Lamaretta has said she does not want to make doctors uncomfortable. This is a real-world example of how the science around vaccines gets corrupted, how only studies that confirm the beliefs and policies that vaccines are safe get published. Everything else gets shoved in a drawer. This selection bias is dangerous and results in corrupting all the science concerning vaccine safety. We can protect children from infectious disease, and we can protect children from vaccine harms. We should and we must do both.
Thank you, Mr. Siri. Our next witness is Dr. Toby Rogers. Dr. Rogers is a fellow at the Brownstone Institute for Social and Economic Research. He has a PhD in political economy from the University of Sydney and a master in public policy from UC Berkeley. His research focuses on regulatory capture and corruption in the pharmaceutical industry. Mr. Roberts.
Good afternoon, Chairman Johnson, Ranking Member Blumenthal, and members of the Permanent Subcommittee. On July 4th, 2015, my then partner's son was diagnosed as being on the autism spectrum. I was in a PhD program in political economy at the University of Sydney, where I had access to almost all current scientific and medical journals. I wanted to better understand what was happening, so I went to the CDC's webpage on the causes of autism. As a PhD student, I was trained to focus on primary source documents, so I read all the references and their footnotes. To my surprise, I quickly discovered the CDC's narrative did not add up. Claims that autism is genetic don't make sense because autism prevalence was rising too fast. There's no such thing as a genetic epidemic. Then the CDC blamed valproic acid, a treatment for epilepsy that is contraindicated in pregnancy, and thalidomide, which was never approved for use in the United States. Finally, the CDC pointed to advanced parental age, but the odds ratios were modest, and the increase in the proportion of older parents is insufficient to explain the surge in autism prevalence. Furthermore, the cost of autism was already in the hundreds of billions of dollars a year in the US, and yet government was not responding with a sense of urgency. I changed my doctoral thesis topic to the political economy of autism and spent the next 4 years reading and analyzing nearly everything that has been written on autism prevalence, causation, and cost. In 2019, my thesis passed rigorous external peer review. It's now in the top 10 of the most downloaded doctoral research papers in the history of the University of Sydney. Since then, I've continued my research with Children's Health Defense as an independent journalist and as a fellow at Brownstone Institute. Here are the facts. In 1970, the first autism prevalence study in the US found an autism rate of less than 1 in 10,000 children. According to a study by the EPA, sometime around 1987, the autism rate in the US began to skyrocket. The most recent report from the CDC showed that 1 in 31 8-year-old children in the US in 2022 were on the autism spectrum. That's a 32,158% increase in the last 52 years. 2 massive studies from the best epidemiologists in California show that changes in diagnostic criteria only explain a small fraction of the rise in autism prevalence. There are 22 studies that claim that vaccines don't cause autism. None of these studies have a completely unvaccinated control group. So unfortunately, if you want to understand what's causing the autism epidemic, these studies are of no use. Then there are 5 large genetic research projects. Agree, SSC, ASC, Missing, and Spark. Together, they produced 501 published papers. The search for the gene for autism has consumed over $2.3 billion, and researchers have almost nothing to show for it because genes don't suddenly create epidemics. The human genome just doesn't change that fast. Then there are 4 large epigenetic research projects, so genes in the environment. Charge, Marbles, Seed, and Early. Combined, they've produced 437 publications that look at the effects of air pollution, pesticides, fluorinated substances, PCBs, nutritional factors, flame retardants, maternal metabolic conditions, and volatile organic compounds. None of these studies control for vaccines as a possible covariate or confounder, so it's impossible to know the true impact of these variables. The critical missing piece in autism research is vaccinated versus unvaccinated studies. Thankfully, there are now 6 good studies that we can rely on. Unfortunately, these studies have been systematically suppressed and ignored by the mainstream media and the medical establishment. 2 studies by Gallagher and Goodman show that the birth dose of the hepatitis B vaccine significantly increases autism risk. 3 studies by Anthony Mawson confirm that vaccination increases the odds of developing autism by at least 4.2-fold. Preterm birth, coupled with vaccination, increases the odds of neurodevelopmental disability by more than 12-fold compared to preterm birth without vaccination. And finally, a study by Hooker and Miller published in 2021 found that vaccination increases autism risk 5-fold. Vaccination in the absence of breastfeeding increases autism risk 12.5-fold. Vaccination in addition to C-section birth increases autism risk 18.7-fold. After conducting this systematic review of 1,000 studies, my belief is that the autism and chronic disease epidemics are primarily caused by toxicants, mostly from vaccines and about a dozen additional toxicants. If we stop exposing children to these hazards in the first place, that would stop the epidemics of chronic illness in children. Now we must summon the political will to act. Thank you.
Thank you, Dr. Rogers. Our final witness is Dr. Jake Scott. Dr. Scott is a board-certified infectious disease physician and clinical associate professor at Stanford University School of Medicine. He attended the University of Vermont College of Medicine. He currently provides inpatient and outpatient care for general infectious diseases. Dr. Scott.
Chairman Johnson, Ranking Member Blumenthal, and members of the subcommittee, thank you sincerely for the opportunity to testify. It is a true privilege to be here. My name is Jake Scott, and I'm an infectious diseases physician at Stanford. I've spent my career treating patients and evaluating medical evidence with a focus on vaccine safety and efficacy. I have no financial conflicts of interest. My vaccine research is either self-funded or supported by Stanford University. Since April, I've co-led an international team building what we believe is the most comprehensive database of vaccine trials ever assembled. We set out to answer a fundamental question: what does the complete trial record actually show about vaccine testing? We've cataloged 1,088 randomized control trials from 1941 to 2025, involving over 10.5 million participants. Every entry is publicly verifiable through PubMed links. The entire database is openly accessible. Anyone with internet access can verify our findings. This is what transparency looks like. Our findings directly refute false claims about vaccine testing. We documented 661 trials using inert placebo controls with saline, sterile water, or other biologically inactive substances. Of these, 503 involved antigens that routine childhood vaccines are based on. Most importantly, we confirmed that all 16 antigens routinely recommended for children have been studied in placebo-controlled trials. Every single one. The claim that childhood vaccines haven't been tested against placebos is demonstrably false. I'm also a senior researcher on a systematic review analyzing respiratory virus immunizations published over the last 2 years. 590 studies from over 17,000 identified references that we screened through the Vaccine Integrity Project. Our safety monitoring systems work. They detected intussusception with RotaShield in 1 in 10,000. The vaccine was withdrawn. They caught Johnson & Johnson blood clots at 3 per million. When early myocarditis reports emerged, CDC proactively alerted clinicians to enhance surveillance before the signal was confirmed. Within weeks, the risk was quantified, communicated, and incorporated into guidance. These systems detect events as rare as 1 in a million doses. The unpublished Henry Ford analysis being presented today is fundamentally flawed by design. Unlike our publicly accessible database, this study remained hidden from peer review after 5 years. The core problem, vaccinated children had twice the follow-up time, substantially more healthcare visits than unvaccinated children. When diagnoses require doctor visits, children seeing doctors more often will inevitably have more recorded conditions. This is classic detection bias that inflates risk estimates without reflecting true health differences. The study reports 0 ADHD cases among thousands of unvaccinated children. How is that possible? With a national prevalence at 11%, that's highly unlikely unless conditions went undiagnosed. They claimed 6 to 8-fold increase in ear infections. That lacks biological plausibility, but it's fully consistent with differential healthcare utilization. Additionally, the study found no association with autism, an adjusted hazard ratio of 0.62. Yet the authors emphasize selected findings while disregarding this null result for the very condition many claim vaccines cause. How do you explain that? What does rigorous published research show? A Danish study of 1.2 million children found no association between aluminum exposure from vaccines and 50 different chronic conditions. Meta-analyses encompassing millions of children consistently find no link between vaccines and autism. Throughout my career, I've treated countless patients with vaccine-preventable diseases. During COVID, I lost unvaccinated patients who would have survived with vaccination. These realities coexist. Vaccines can cause rare adverse events, and they do, and they prevent vastly more death and disability. We're experiencing our worst measles outbreak in decades, 1,431 cases and 3 deaths in 2025. No kid should die from measles. The choice before this committee is clear. Base public health policy on transparent, peer-reviewed evidence that anyone can verify, or on an unpublished analysis with acknowledged fatal biases hidden from scientific scrutiny. Vaccines have saved 154 million lives globally over 50 years. The data are public. The evidence is overwhelming. Parents deserve policies grounded in this evidence. Thank you. I welcome your questions.
Thank you, Dr. Scott. I'll start with the questioning. I'll just basically turn it over to Mr. Siri. Do you want to start with the 154 million claim? But we had the ranking member, and we also had Dr. Scott say that the Henry Ford study was highly flawed by design. Do you want to maybe start there and defend the Henry Ford study?
Whatever you would like, Senator, I'm happy to do that, yes. Thank you. Happy to start wherever you'd like. In terms of the Henry Ford study, I appreciate Dr. Scott's comment, but I don't believe Dr. Scott has actually read my submission, given his comments about what he believes makes this study fatally flawed. He points to one thing. He calls it detection bias, because what he's saying is that the vaccinated children are more likely to seek medical care than the unvaccinated children. Had he read my submission, he would have seen that the study authors who were looking to validate the safety of these vaccines specifically conducted sensitivity analysis to see whether there was detection bias. How did they do that? What they did is they looked at the average number of times that the vaccinated cohort sought medical care versus the unvaccinated. And what they found was vaccinated children sought medical care on average 7 times a year. Unvaccinated sought it twice a year, which would make sense if you have less illness. But for the unvaccinated kids, those 17% that had a chronic health issue, they sought medical care on average 5 times. which reflects that when an unvaccinated child had a medical issue, they did go see the doctor. Number two, as the study points out, the type of health conditions that we saw in the unvaccinated population are not ones you wouldn't see medical care from. If your child has a serious medical condition, you're going to your doctor. You're going to the medical system. And that's not me saying it. That's what these study authors pointed out. Also, to further validate their findings, they even reran their study to remove any child that didn't seek any medical care. So essentially, they removed the healthiest unvaccinated children, another sensitivity analysis they did, and they still found the statistically significant outcome that that I discussed earlier. Now, the other thing they did to make sure that their results were valid, and again, I assume they did this because they wanted to try and do exactly what Dr. Scott is saying. Well, there's got to be a mistake here. It can't be that this is true. And so the other thing that they did is they conducted a sensitivity analysis whereby they removed any children from the study that weren't in the Henry Ford system from birth onward for at least 5 years, thinking, okay, well, maybe we, got it wrong because the unvaccinated kids, had an average duration of less time. But so by doing that, we're only going to look at kids who were in there for at least 5 years. And what they found was, consistent with the findings, affirming the findings, the risk ratio of chronic disease amongst the vaccinated went up, not down. They also did that sensitivity analysis at 3 years and at 1 year. And each time they still found the vaccinated children a statistically significant increased rate of chronic health issues. They also used cancer as a control, assuming, well, there's no reason vaccines should cause cancer, and they didn't find a statistically significant outcome. So the issue that Dr. Scott points to in a study, which, by the way, he's labeling fundamentally flawed, there was enough information in my submission to have understood what I just said.
He actually said it was flawed by design. You know the study authors of this thing that the people conducted. Do you believe these are professionals that would design a study by design to make it flawed, to give a result that vaccinated children suffered chronic illness 2.5 times? I mean, that's basically what Dr. Scott is saying to the authors of this Henry Ford study.
I mean, I think from the perspective of the establishment, this study is flawed because it's actually designed to detect safety. It's actually designed to reach a conclusion on safety. That's what makes it flawed. It's not like the aluminum study that Dr. Scott pointed to, which he called, rigorous.
So you can get down in the weeds very quickly, and you have to, quite honest.
Yes.
This is true. But let's pull it back a little bit. I heard for the first time during the RFK Jr. hearing that there's been a study that vaccines have saved 154 million lives. You have a somewhat interesting take on that. Do you want to talk a bit about that scientific gem?
Absolutely. Absolutely. I think the claim about 154 million lives saved is it actually is the epitome of the corruption of science. It reflects the corruption of science in action. While this Henry Ford study, for example, is based on actual data, medical records, the immunization registry, and look carefully at it, this study is just based on guesswork and assumptions. It is a study published by the WHO. It is essentially an advertising piece by them for how effective their immunization program has been over the last 50 years. And they claim there's 154 million lives saved. But when you look at the study, unlike the Henry Ford study, it has no confidence intervals. So what is the confidence interval of that 154 million claim? What is the reliability range of it? It doesn't have one. You know why it doesn't have one? Because it's totally unreliable. As buried in page 42 of the supplement to that quote-unquote advertising piece by the WHO, it's set in a section entitled Uncertainty of Estimates, it says that, quote, it cannot put, quote, bounds around the veracity of the estimates. It can't put bounds around the veracity of the estimates. and that, quote, any bounds are arbitrary, end quote, and that, quote, it should not be interpreted as a claim to where the edges of valid estimates possibly lie, end quote. What that means is it could be equally true that 200 million lives were lost because of the vaccine program. It's an unbounded estimate. That is the corruption of science, to rely on that. And it gets worse from there because, and when you actually look at the hard data, the number makes no sense. Almost the entirety of that 154 million lives saved comes down to two vaccines, DTP and measles vaccine. While as laid out thoroughly in my submission, the studies that look at DTP vaccine show that it causes more mortality, far more mortality, than lives saved. While it may reduce deaths from diphtheria, tetanus, and pertussis, the studies show numerous rate the kids. The seminal study showed that the kids who got DTP died at 10 times the rate, 10 times the rate, than kids who did not get that vaccine. And that is, I'll give the PubMed number, it's 5360569. And that study is not just one study sitting on its own. It comes after a long series of studies. It was published in 2017, and then another one in 2018. And DTP is the most commonly used vaccine in the world. That's what the science, based on hard data, that has confidence intervals, shows. Not this WHO advertising report with no confidence intervals. The other vaccine that accounts for almost the entirety of the 154 million lives saved is the measles vaccine. The study assumes, I guess to its credit, that 60% of that decline was from other factors, and 40% of the decline in measles mortality was from the vaccine. But here's the thing. When you look at the decline in measles mortality in other countries when there were no vaccines, like the US, between 1900 and the first vaccine in 1963, measles mortality declined by 99%. That's CDC data, not assumption. When you look at the UK data, between 1900 and 1968, when they first started the first measles vaccine there, measles mortality there declined by 99%. So when you overlay that number, not use a 40% decline, but 99%, and then you add in the increased deaths from DTP, you're upside down already. That's why they can't put a bound on their 154 million lives claim. Those vaccines cost a lot more than $154 million.
Let me give Senator Marino a chance. Okay.
May I ask one last point on this, and I will stop. I'm sorry. And it's this. As I've laid out in my submission, study after study after study shows that people who get measles vaccine die at far lower rates from heart disease and from various cancers. It's not me saying that. I'm just a lawyer, as Senator Blumenthal pointed out, okay? But that's what the studies show, and they're consistent. They're an inconvenient truth when it comes to the medical establishment. When you add in that data as well, it's really upside down. I lay that out, including a 100,000-person, 20-year prospective study in Japan that found that those who got measles and mumps, about 7% were dead from heart disease after about 20 years, whereas those who didn't get measles and mumps, around 14% of them were dead after 20 years. Heart disease is the #1 killer of folks in the United States. I'll stop there.
We'll continue. Senator Marino.
Thank you, Mr. Chairman, for having this hearing. Thank you all for caring about this issue and being here. Mr. Chairman, I was going to direct my first question actually to the ranking member, but he's not here. So I just want to pause for a second, because there's a lot of things that I've seen in my first 8 months here in elected office that happens. It's a little crazy. So I just want us to reflect on something the ranking member said. He said that a person should be fired for exercising their First Amendment rights. And I think we normalize bad behavior like that. We just say, well, that's what people can say. And the comment was about the Second Amendment. You know, something about citizens got to defend themselves. I'm going to read something into the record, and I'm going to submit something for the record, then we'll get on. So there was a gentleman that said the following: the people's ability to arm themselves and form state militias provide a powerful check on the federal power, ensuring the populace can resist potential government overreach. In fact, went on to say that an armed citizenry is the best defense against an ambitious government. Now, the ranking member would have that person fired. What the ranking member may not realize, and I want to submit to the record, is Federalist 46, written by James Madison. So the person that created the Constitution that allows us to do our job here for 240 plus years should be fired for saying that we should have the right to protect ourselves. That's pretty outrageous. And I thought that was an important part to clarify for the record. So again, without objection, we'll submit Federalist 46 to the record.
Without objection.
Thank you. It's available at the archives as well. All right, so let's talk about Mr. Siri. I think the main issue here is about biases. Would you agree that when you have a study, now like I'm a business major, I'm not a science major, but I think the issue here is there a bias in your work? Would you agree that that's foundational? And all three of you can answer that. Is being free of bias important? Mr. Siri, yes or no?
Absolutely, and it's hard to find, obviously. Everybody's got a bias. That's
Sure.
human nature. There's no such thing as something that's unbiased. That's why you want to have as rigorous a design to a study
Oh, yes.
beforehand.
So having clear
Yes, sir.
biases, okay. All right.
Yes, sir.
He won't be as generous with my time. Dr. Rogers, would you agree? Yes, no? Being free of bias is really important?
Yes, absolutely.
Okay. And then, Dr. Scott, would you agree with that?
Certainly.
Okay. So let's talk about the topic of bias. Would the following statement be considered biased or unbiased? Our president is a misinformation super spreader. I know this isn't surprising to a lot of people, but it's deeply disturbing. Biased comment or unbiased comment? Is that based on science?
Are you asking me?
Yeah. Quick. This should be quick.
It
Yes or
reflects a bias against the president.
Dr. Rogers, a biased statement, yes or no?
Agreed, biased.
Dr. Scott, biased? Okay, that was your statement, your tweet on October 1st of 2020. Trump spews misinformation like no other. For our president to say that the problem is that doctors taking care of patients dying from COVID are venal and are committing fraud to cook the books is so low, it's subterranean. Biased or unbiased?
Yes, sir.
Biased?
Yes, sir.
Dr. Scott? Okay, that was your statement in October 25th of 2020. Trump's response to the U.S. COVID crisis when interviewed by Chris Wallace, it is what it is. Vote like your life depends on it. Biased or unbiased? Mr. Siri?
Yes, sir.
Dr. Rogers?
I think voting's a good thing, but I don't really have an opinion on that one.
But that your life depends on whether this election happens, like you will die if the wrong outcome occurs?
Yeah, that
seems biased.
Seems overstated.
Seems overstated. Dr. Scott?
I stand by it.
Okay, July of 2020, your statement. There are 69 days left of the Trump administration. While he schemes to survive politically, thousands of Americans will die. The number of COVID deaths yesterday was 1,421. If the death toll remains the same, then 98,049 deaths will occur between now and January 20th. Biased?
Given the data at the time, I think yes.
Dr. Rogers?
COVID deaths in the Biden administration far exceeded COVID deaths during the first Trump administration.
Dr.
Yeah.
Scott?
I hope you get into his post, too.
So biased. Okay. Now, interesting because prior to me coming to Congress, people think I was in the retail automotive business, and that's true, but I also had a tech company. I'm going to tell you a 30-second story. We were asked during COVID to develop a schematic where somebody could validate whether they were vaccinated or not or tested positive or not using our blockchain agent. I thought that was terrible technology, so we decided not to do it. But when we had my tech team explore it, what I thought was fascinating was there was no way to find out who had tested positive or who tested negative. There was no data. So, typically with a computer system, you have to plug into a data source, pull the data so that you can report it out. So when we went to the state and said, hey, give me the data, who's been tested and who tested negative, who tested positive, you know what the response was? We don't have that data. It's like, well, that's fascinating because every night when I turn on the news, they tell me it's 1,421 people died of COVID. I'm like, well, that's interesting because if the data doesn't exist, then how do you know that's true? So I just thought I'd share that with you a little bit. So the other piece of the equation is when we talk about science, I think there has to be a certain humility. Now, my dad was a doctor. He beat in our heads that the key to being a doctor is to have humility. I think the humility should be able for us to look back 4 or 5 years later and go, we made a lot of mistakes. A lot of people were harmed. And I think it's the failure of that humility that's infuriating to a lot of people. I'll give you some examples. I have a 4-year-old grandbaby. A 2-year-old grandbaby just turned 2 yesterday. Do you think it was appropriate, yes or no, Mr. Siri, if should a 2-year-old have been put a mask on, a 2-year-old? Is that a good idea?
I believe that everybody should be able to make their own medical decisions.
But again, just generally speaking, putting a mask on a 2-year-old.
I wouldn't put a mask on a 2-year-old if it was my choice.
Dr. Rogers?
No,
Dr. Scott?
I wouldn't either.
Okay. You tweeted in January of 2021 that you masked your 2-year-old and that all 2-year-olds should be masked. I'll submit the tweet for the record. That your 2-year-old, I don't know that you have a 2-year-old we've never met.
Well, I changed my mind.
Okay. But again, having the humility to say that was a bad idea.
Yeah.
Having the humility,
I'm admitting it. I'm admitting it.
which is good. I applaud you for that. Having the humility to say, that when you walk into a bar, after having a mask on outside, and then you walk to your table, and then you take your mask off to eat, made sense. We can now look back and go, that was ridiculous.
And I tweeted about that numerous times, how ridiculous that was. So,
well, I'll submit another tweet.
Bias. Selection bias right here.
I'll put your tweet on the record in which you actually said that a man walked outside with a mask, walked into a restaurant, got in a seat, took off his mask and drank a beer and sat with everybody doing the same, as in like, hey, that's normal. In fact, you said something that I thought was very interesting. You said COVID-19 may never go away. So let's keep people isolated and masked. I will submit these for the record. COVID-19 may never go away as a way to keep people locked up inside, keep people out of schools. In my state, in my city, Cleveland, Ohio, we closed our schools for 18 months. You look at why we have youth violence today, you draw a straight line right to those decisions during COVID. That wasn't a virus that made those decisions. Those were elected officials that decided that control of people was more important. And Dr. Scott, I'll give you a chance here. You also said that 1.2 million people died from COVID. From COVID. Now, I was on the board of Metro Health in Cleveland. We had no idea what actually caused people's mortality. What we did do, because the hospital could collect more money, was we labeled anybody who had COVID, who also died, including motorcycle accidents, of dying from COVID. I think what you meant to say, I'm going to give you a chance to clear it up. Did you mean 1.2 million people died with COVID as opposed to from COVID? See the difference?
Oh, I do see the difference. And I also commented quite a bit about the difficulty making that distinction after vaccines had become available. But I think early on, yes, there were a lot of deaths. I lost over 100 patients, okay?
From COVID or with COVID?
COVID, from COVID. COVID was terrible. But it definitely became much more complicated to reconcile people who died with COVID from COVID.
But you didn't have a problem. You were a pretty definitive statement. But what Dr. Rogers said earlier was interesting, which is more people died during the Biden years. Now, just to remind everybody, it's important. Biden put out an executive order that said if you don't get vaccinated, you could lose your job. Think about how insane our public policy got. And I think I speak for at least the people I know that this is an important issue. Just maybe start by acknowledging you made a mistake, apologizing for shaming those of us who said, yeah, that's stupid. Like, yeah, that makes no sense. And acknowledging that if we don't have sovereignty over our bodies, then we are not free people. With that, all right. Thank you.
Thanks, Senator Marino. Dr. Stott, I got a lot of questions. We're going to take a lot of time, and people are going to have a chance to respond here. By the way, PSI hearings are definitely different than normal Senate hearings. I mean, when I first got here, it had Senator Levin. He would have a book that thick, and the hearings would literally run all day long. Go through in detail. That's kind of like to do here tonight. It's not all day long because we only have the afternoon, but we're going to get into a lot of detail here. Dr. Scott, you did mention you said about 100 COVID patients. Can I just ask you, what did you treat them with? What were your drugs of choice? I mean, what was the treatment?
Yeah, so I've treated hundreds of COVID patients, and
did you say you lost 100 then? I'm sorry, I'm not trying to.
I lost dozens of patients,
Okay.
probably over 100. I lost track, to be honest.
Okay.
It was awful. Okay. I lost many nursing home folks who live nearby, and multiple a day sometimes.
But what was the protocol did you use? Did you use remdesivir? Were you using monoclonal antibodies? Did you ever try ivermectin or budesonide or some of the other generic drugs that were recommended?
So I was going based on the best available evidence. My role was actually to focus on the best available evidence for therapeutics. I helped develop the guidelines. And so, yeah, we used, remdesivir if patients met eligibility. We used dexamethasone, which clearly shows or had been shown to be life-saving.
By the way, I had Pierre
supportive care.
Corey, I think in May of 2020. He talked about corticosteroids. He was vilified and savaged in the media till a couple months later they actually had a study come out of England that dexamethasone worked, which is a corticosteroid. Now, generally underdosed when they gave it, but regardless, continue.
Yeah, so, we used a number of things. Did I ever use ivermectin or hydroxychloroquine? I don't think so.
Were you aware of the Surgisphere study on hydroxychloroquine?
No, that doesn't sound familiar.
You've never heard of that, huh? It was published, I think, in May of 2020. Totally came out against hydroxychloroquine, but had to be retracted, I think, 2 weeks later because the data was completely made up. But it had its impact. It completely sabotaged the use of hydroxychloroquine and zinc and, Z-Pak.
Well,
just so that's just one example. It kind of surprises me if you're on the front lines trying to treat people you've never even heard of the Surgisphere, which probably turned off a lot of doctors like you who rely on the New England Journal of Medicine, even though Dr. Mark Angel said you really shouldn't or can't. Done that. But let's move on. I think Mr. Sirius kind of covered the $154 million, which was the first time I heard that. And again, I would call that propaganda. It's not science. Somebody's got some model, fine. I can play with numbers too. As a matter of fact, I'm going to show you how you can use numbers. Dr. Scott, you talked about the Commonwealth estimate of 3.2 million lives saved here in the U.S. in 2021 and 2022, correct? Are you pretty confident of that one?
It's one of a few studies. Yep, these estimates are not easy to make, but yeah, that's one study.
Define study. Were there confidence intervals around that 3.2 million?
It was a modeling study, yeah.
It was published on a blog, wasn't it? Is that correct, Mr. Siri?
Yeah, it's a blog.
That study was covered on a...
Yeah, the Commonwealth quote-unquote study is not a study, it's a blog. It's not a peer-reviewed study, it's not in a journal, it was published on a blog.
Let's put up this little chart that I'm somewhat famous for charts. So let's look at real data. So this is CDC data. So in 2019, total deaths in the U.S. were 2.85 million. Okay, then we had the pandemic year, 2020, 3.38 million, a little under 3.4 million. So that's an increase of a little more than 500,000 people died in the first year of COVID. The following year, 3.46 million people, more people in the second year of the pandemic, 2021, when the vaccines were rolling out. And I think we were close to 70% take up of vaccines by fall of 2021, I believe.
Some of the estimates are that by the second quarter, over 60% of Americans had some form of immunity.
Then in 2022, we started backing down. Now, I think Mr. Siri kind of argues in your piece that, if the vaccines really worked, you'd think even by 2021, because those things are being rolled out pretty quick, you'd probably see those death counts come down, but they didn't. But here's the point I'm trying to make with this Commonwealth Fund study. They estimated 3.2 million people's lives were saved in 2021 and 2022. So if you add that to the actual death count, what Commonwealth Fund is assuming is that in 2021, had it not been for the vaccines, more than 5 million people would have lost their lives in America. In 2022, 4.88 million people would have lost their lives. Dr. Scott, is that even close to credible to think that we'd go from 2.85 million lives lost in in 2019, have a pandemic, no vaccines. Unfortunately, the NIH was sabotaging treatment using effective generic drugs, to telling people, don't treat it all, go home, be afraid, hope you don't have to go in the hospital where they'll plug remdesivir in your veins and hook you up to a ventilator and you probably never come off, okay? So we had no treatment, had 3.38 million people die that year. Are we really supposed to believe the next year we were going to leap up to 5 million lives lost in America? And then the following year, close to 5 again? Because that's what you'd have to be. In order to save 1.6 million lives in 2021 and 2022, you'd have to be assuming the death rate was going to go from 2.85 million in 2019, 3.4 million in 2019, and then leap up to 5 million in 2021 and 22. Is that at all plausible? Do you believe that? Do you believe that we were literally, had it not been for the vaccine, 5 million Americans would have lost their lives in 2021 and 2022?
Yeah, I believe that's credible to me. I mean, were you on the front lines? Because it was awful. I honestly cannot express how terrible it was.
It was terrible.
And there was a dramatic,
it was terrible.
decline.
It was terrible in 2020. And the total death toll was
decline in death
3.4 million
rates after the vaccines were rolled out.
Well,
Dramatic.
Let's move on. Let's move on to some other.
Parse over these modeling studies, but let's talk about hydroxychloroquine and ivermectin. I mean, there were a number of studies that looked into that. Some of which I was involved in.
This is about research. By the way, I'm happy to invite you back when I'll have Dr. McCulloch and I have Dr. Good. We'll do that. Okay, we will absolutely have you come back.
Thank you.
And we'll talk about hospital protocols. We'll talk about early treatment. I would love to do that because I've never been able to get people to actually debate or discuss this with the doctors that did have the courage and compassion to treat COVID, okay? And I appreciate you did as well. So anyway, so you think it's credible. I mean, the records show that Dr. Scott thinks, yeah, we had 5 million people die in 2021 and 2022. Mr. Siri, you want to comment on that?
Yeah, I could add to that just a little bit, which is that, and this is part of my submission as well, that the data reflects that in 2020, when there was no vaccine, the vaccine was first rolled out at the end of December 2020, about 18% of folks, 17% of Americans were infected. And presumably, by the way, the weakest, most frail among us passed away in 2020. Then we get to 2021, where again the data reflects, and this is my submission, around the same percentage of Americans were again infected. Okay, so no vaccine, like you pointed out, that was the increase. Then there was a vaccine in 2021. The vaccination rate went through sky high by the second quarter of 2021. When Delta's coming, the immunity rate, according to the data, is over 60%. But yet, all-cause mortality increases. And I'll point out one last thing about this. Remdesivir, and this is a great example of the corruption.
You know what nurses call that? Run, death is near.
Well, I'll give you an example of the corruption of science with remdesivir. The way you should do a study is you come up with a study design, and then you implement it, because this way you avoid introducing bias. If you start the study, and then you're like, ooh, you don't like what you're finding, and you change the study design, that introduces bias. And that is exactly what happened during the remdesivir clinical trial. The endpoints in the middle of the trial were changed by Gilead as it was going on. In fact, we wrote to Dr. Fauci specifically about that. That is precisely what you should never do. It introduces bias so they can get the results.
By the way, do you remember how many people had some kind of financial conflict of interest, the people that approved that with Gilead?
Yeah.
It's like 9 out of 16 or something like that?
It's a significant number. And obviously, there's lots of folks who've treated COVID during the pandemic, and there's lots of, you had Dr. Jordan here, for example, and he's had a clinic. I think he has dozens and dozens of clinics around the country, and he lost, as he would explain, the protocols he implemented, lost very few people to COVID. I know other doctors in that similar situation using budesonide and so forth.
Dr. Rogers, you have something? Dr. Scott, I think you wanted to say something?
Yeah, I want to add to this debate. So I watched every single meeting of the Advisory Committee on Immunization Practices and the Vaccines and Related Biological Products Advisory Committee in 2021, 2022 and 2023 when all these COVID shots were being authorized for use in this country. And after a while, the CDC's own research showed that the protection from the vaccine, if any, was between months 2 and 6. And by 6 months, it showed negative efficacy. So I'm watching the hearings on my, computer screen at home. I'm yelling at the screen. The COVID shots have negative efficacy after 6 months. Tell me how a shot with negative efficacy is saving lives and it has the worst side effect profile of any vaccine in human history. So how exactly is a vaccine with the worst side effects and negative efficacy saving lives? That's a preposterous claim. What ended the COVID pandemic was the Omicron variant that was more transmissible but less lethal. The vaccine, how many people it helped? I think it's an open debate. It could be a net negative.
Well, maybe we can look at the clinical trial data in which 21 people died in the vaccinated group and 17 died in the placebo group.
I do want to, again, I believe the first study that came out of showing negative efficacy came out of Denmark. But Dr. Scott, you said you wanted to say something, then I'll turn it over to Senator Blumenthal.
Well, I just want to say, in 2020, 2021, my colleagues and I were doing absolutely everything we could to save lives, okay? We weren't using remdesivir because we were paid to use remdesivir. And remdesivir, I have to say, I never thought was, a game changer, but it's not that.
By the way, the hospitals were
unsafe.
paid handsomely for using remdesivir.
Okay, well, I never saw that.
And coding somebody as a COVID patient as well. But
I never saw that. But in terms of, whether or not the vaccine saved lives, it's not just that one study. I mean, there's there's a Stanford Ioannidis study from that was published in JAMA recently that showed that the COVID vaccines probably averted 2.5 million deaths. So, you're cherry picking by saying that I'm, hanging my hat on that one Commonwealth study. I'm not, because I've also posted about these other studies as well. How many lives did the COVID vaccine save? I don't know. I don't know for sure. But I did see with my own eyes the dramatic decline in deaths between December of 2020 and mid-2021.
Variants did change, and Omicron was less lethal. But Delta was a real problem.
Omicron didn't hit until 2022.
I understand. Delta was a real problem. Senator Blumenthal.
Thanks, Mr. Chairman. I think we all know that COVID-19 had a devastating impact on families across the country. It caused deaths and still impacts the lives of a lot of people. The creation of COVID-19 vaccines through Operation Warp Speed, led by then President Trump and now President Trump, was not just one of the greatest achievements in his administration, but it changed the course of the pandemic. The vaccine saved lives and allowed others to begin to rebuild. But unfortunately, just as the vaccine became available, a lot of misinformation about its safety and efficacy spread, and hostility toward vaccines and the public health system that monitors them makes them less available. I want to ask you, Dr. Scott, you saw firsthand what it was like to treat patients when the COVID-19 pandemic began and after the vaccine was approved and disseminated. Based on the studies you've done, do you believe that the COVID-19 vaccines and others have helped save lives and been safe and effective?
Thank you, Senator. So when it comes to safety, I personally am not a big fan of the slogan, vaccines are safe and effective, because there are nuances, right? Nothing is 100% safe. Are COVID vaccines 100% safe? No. Are they generally very safe? Yes. Are they the least safe vaccine ever? No. That's absurd. Show me some evidence that indicates that.
About ready to.
Yeah, please. I'll come back to discuss that. Were the COVID vaccines effective? Yes. I mean, so 2020 was like nothing my colleagues or I had ever seen or expected. It was awful. I'm not making this up, okay? I mean, you know, it was just a nightmare. And despite our best efforts, I lost many, many patients.
Is there let me ask you, is there a reason you believe that the Henry Ford Health System study hasn't been published and has flaws?
Yes, I think that's a great question. I mean, and so one important question is, which peer-reviewed journals have reviewed and rejected this manuscript? What biological mechanism could explain vaccines increasing ear infections by 600%? Do you accept the study's null finding for autism, or only the results that support your narrative? What are the models that adjust for the massive difference in healthcare visits between groups? The analysis reports 0 cases of common conditions like ADHD. That is statistically impossible. There was a cohort of 2,000 children. There should have been hundreds of such diagnoses, unless they were undetected. And let me just clarify, when I said flawed by design, I didn't mean that they deliberately, meant for it to be flawed. I just meant the study design itself had flaws in it, okay? It was methodologically flawed, not deliberately flawed, of course.
And thousands of studies have been done and published, correct?
Correct.
And let me ask you, the seeming assumption here is that this is the only study that ever has gone unpublished. In fact, a lot of studies go unpublished, correct?
Yeah. Yeah, and I review studies before they're published for a number of different journals. And
because they're subject to peer review,
right. And it's not just
analysis.
one person. It's multiple people are reviewing these articles, and if something warrants publication, it's the other thing is, I've recently been reviewing hundreds and hundreds of papers for these 2 massive vaccine review projects.
And simply to be published isn't the only means to make a study public, correct? In fact,
right.
In this body, we have press conferences, we do hearings. This particular study was done and completed in 2020, and now, apparently for the first time, it's being revealed.
Right.
Has it been available during this last 5 years?
That's a great question. I mean, there's preprints, Substacks, obviously, a number of ways to get a study out there. The fact that it's been shelved for 5 years, I think, is saying something.
Mr. Siri, why haven't you held a press conference? Why have you kept this study under wraps?
I appreciate the question. It's never been submitted to a journal, and the hope has always been that it would be submitted to a journal, because I agree with you. It should undergo peer review. It should be submitted to a journal, but they will not submit it because they don't want to get fired. That is what they told me. We've met with the authors many times. These are validly pro-vaccine individuals. They don't want their institution, the journals, their funding sources, their friends, their colleagues, everybody to turn against them, which is exactly what will happen if they even submit this thing.
But that is not my question, and I apologize for interrupting because I'm limited on time. There are lots of other ways to make findings known.
They don't want to get fired.
No, I'm talking to you.
Oh, because I want they are the scientists. They're the ones who have their name on it. They should put it out, not me. My hope is that they would put it out. I wanted the normal course scientific process to work. Look, it's a retrospective epidemiological study. Let them put it in a preprint. Let it go through peer review. Let others try to replicate it. Maybe they'll find a different result.
I'm really curious why you and Senator Johnson or another member of the Congress or members of the health community didn't hold.
Let me answer that for you.
Can I just finish my question?
Sure, go ahead,
Mr. Chairman.
But I'm going to answer it for you.
I'm curious why, for the first time,
Yes.
we're hearing about a study which was completed 5 years ago.
Like I said, my hope has always been that the scientists would publish it, and we've tried to persuade them many, many times so it can go through the normal peer review process. I don't want to run ahead and go put it out there, because you know what that would do? It's going to happen exactly what's happening right now, is you're going to say the things that you're saying, Senator. Well, you know, this is not going through the normal process. This isn't getting submitted to a journal. The answer to that is, I'm going to say it again, it epitomizes the corruption of science. It shows precisely why studies that show vaccines have problems never get published.
I don't think, with all due respect, Mr. Siri, that you've answered my question.
Let me answer it, okay?
And
let me
Mr.
answer.
Chairman,
Your
the
time's
reason
expired.
we have witnesses is so that
I
they can answer our question.
but I'm part of this. I'm part of this answer, okay? First of all, you're not paying attention to what they're saying. The people who conducted this study, highly professional, highly respected, obviously concerned about their jobs. Del Bigtree and Aaron Siri convinced them to do this study. They don't want to have their jobs put in jeopardy. But they respect the fact that these people actually did the study as they requested. When I found,
with all due respect, we have a vote going on. I'm going to leave to vote because more than 90 of our colleagues have voted, and I don't want to miss the vote. Okay, so if you want to hold your answer until I get back, that's fine. I really want to hear from the witness, not from you, Mr. Chairman, because we can talk to each other anytime.
I am the one that prompted this release. Once I found out about it, I said, well, if you don't release it, if they don't release it,
why didn't he tell you about it earlier?
I'm going to release it.
Why didn't he come forward and
because he felt sympathy for the authors about losing their jobs. I'm sorry, I feel the same sympathy, but this is too important to protect their jobs. This is information the public should have had in 2020, and I forced the issue. There's the bottom line. I forced the issue. So there's your answer. But by the way, you can go and vote. You're welcome to come back. This hearing is going to go on for quite some time because we're going to go through this in detail, okay?
Okay.
So this hearing is going to go on for quite some time.
As another American once said, I shall return. Thank you.
Okay. Look forward to it. I think I'm going to lay the COVID injection aside for the time being, but we'll come back because we keep hearing these hundreds and thousands of studies. And one thing I do want to enter into the record is Mr. Siri, what is it, about 2:30 in the morning?
Yes, sir.
Having received testimony, did a very organized and very effective response to Dr. Scott's testimony. And I want to enter that into the record. But, Mr. Siri, I'd like you to go to your section and talk about the 661 studies that Dr. Scott is talking about in terms of these inert placebo controls. And just describe that in detail. I think it's interesting.
Sure. Actually, I think Dr. Scott has done a great service in terms of pointing out the lack of clinical trials supporting the safety of the routine injected childhood vaccines. You see, he's saying there are 661 inert controlled trials to support the safety of the routine injected childhood vaccines. But when you actually drill down into those 661 trials, let me give you the breakdown of them, okay? 567 of these trials were not a routine injected vaccine for a disease on the CDC's childhood schedule. They were for HIV vaccines or other vaccines. So totally irrelevant to the safety of routine injected childhood vaccines. The remaining 94 studies, 70 of them did not involve healthy children. For example, trials of HIV-positive adults. Again, completely irrelevant to the safety of childhood vaccines. Of the remaining 24, 21 did not involve a U.S. licensed vaccine it was not a vaccine used as a control to license a currently used U.S. licensed vaccine. For example, a Chinese flu shots, stuff like that. That leaves us with 3 studies, 3, that were claimed to have a inert control that were relied upon to license a routine injected childhood vaccine out of this entire list of 661. And these actually help really highlight the problem we have in terms of assessing safety with regards to the licensure of childhood vaccines. I want good clinical trial data. I need it for my practice. Okay, let me walk through those 3. One was a trial for the chickenpox vaccine, the varicella vaccine. Now that trial had, it was only a few hundred people, so it was underpowered anyway. But Dr. Scott says it's got an inert control, but actually it was an injection of neomycin, an antibiotic. That's not inert. No. And neomycin used topically can cause issues, let alone injected. The second one was Gardasil 4 trial, which had thousands and thousands of girls and women in the control group. Almost all of them got an aluminum adjuvant injection. And then there were a few hundred, only a few hundred, that were labeled as a inert control, but they weren't. They got everything that's in the vial except for the antigens in the alum, which included L-histidine, sorbate 80, sodium borate, yeast protein, not inert. And then the third one was a Gardasil 9 trial, which finally, by the way, did have a saline injection, just a few hundred. There were thousands and thousands of girls and women in that trial. They all got an injection of aluminum adjuvant, which I don't even know if it's ethical to inject somebody with something that's neuro and cytotoxic, but leaving that aside, the few hundred that got the placebo, but they only got it if they first got 3 doses of Gardasil 4. So again, not an actual inert control group. The result is there's 0 trials, 0, which were relied upon in this list of 6061 to license a routine injected vaccine on the CDC schedule that included a placebo, as well as 0 trials of a vaccine used as a control to license a routine injected vaccine on the CDC schedule. Ironically, by the way, this list supports the opposite of what it pretends to do. And if you want to know what was relied upon to license routine injected childhood vaccines, it's easy. Look at the clinical trial documents. That's what we do. And in fact, my submission to this committee went through every single vaccine that's a routine injected vaccine, and we cited precisely what the control was. Now, I'll just point out one quick thing here, too, is that the CNN fact-checked Secretary Kennedy's claim that there is no routine injected childhood vaccine that was licensed based on a placebo-controlled trial. And it relied on Dr. Scott's list, which at the time had about 248 trials listed as being inert. Secretary Kennedy then did exactly the analysis I did, put it out on a tweet, took it apart. Not one of those was relied upon to license a routine injected childhood vaccine, nor was it used as a control to license a routine injected childhood vaccine. And then after that, apparently, somebody then scrambled all the RCT numbers for those 248. So you can't match it up with the Secretary's tweet. And I guess to bury that issue, just added hundreds more, hoping that they can just hide behind this mountain of trials. But when you look at it carefully, it does not support the safety. In fact, it points out, it shows exactly the lack of safety. What's critical is this. Look, if you want to know the safety of a vaccine, and we need this stuff when parents call us and say, my child got XYZ issue after a vaccine, you need trials that are, 1, properly controlled, which means either they got to get an inert substance or another vaccine that was properly licensed based on a robust trial. And then even if it has a proper control, it still needs to review safety long enough. And then even if it has a proper an inert control and it reviews long enough, it then still needs to be properly powered. It needs all 3 to be a proper, valid clinical trial. And I can tell you there's not a single routine injected childhood vaccine on the schedule that meets those criteria.
Well, again, the whole point of developing or doing this list, this crowdsourcing or whatever, leading an internet effort for the 661 studies was all to prove Secretary Kennedy wrong when he said that there's never been any of the vaccines on the childhood schedule that have had a true placebo-controlled, random-controlled trial. And you've just gone through the 661, and that statement's true. Dr. Scott, go ahead and, I guess, try and refute that.
So, yeah, the reason why we did this project was to, yes, directly address through systematic evidence compilation the questions around the quantity and quality of clinical data supporting vaccine safety and efficacy. We found 1,000, we screened thousands. We've extracted data from 1,088 randomized controlled vaccine trials. We started our search in 1800, and studies were published from 1941 until 2025. Of those 1,088 studies that are randomized controlled trials, 661 used what we consider an inert placebo, generally saline, et cetera. There were a number of other control groups used historically for various reasons, partly for ethical considerations and partly just because things have developed over time. As far as this being an example of how there aren't enough data to support the safety and efficacy of vaccines, I don't see the logic there.
Well, I think Mr. Siri completely picked your 661 studies apart. You said, saline, et cetera. I think it's wondering what's the et cetera. Mr. Rogers, you kind of raised your hand. You want to speak to that?
Yes, ma'am, please. Thank you, Senator Johnson. So look, in PhD programs, you have to read original sources and you have to define terms. Let's be crystal clear about the definitions of these terms, because the fate of the Republic depends on getting these definitions right. And Dr. Scott is playing fast and loose with these definitions, so let's be crystal clear about what we mean. Inert should mean that the substance does not cause a chemical or biological reaction in the body. When supporters of the status quo use the word inert, they can mean just about anything. Paul Offit routinely calls mercury and aluminum inert, even though they are known neurotoxicants. Philip Grandjean and Philip Langergan published, they're the best two toxicologists in the world. They published a study in 2014 that says both aluminum and ethyl mercury are known neurotoxicants. But the supporters of the status quo say that these things are safe, and they're not. They're absolutely not. In the context of vaccines, placebo should mean saline, as verified by independent third-party testing. That's not what the supporters of the status quo mean when they say placebo. The fact is the FDA has no regulations concerning the contents of placebos. So manufacturers can put whatever they want into the comparator intervention and can still call it a placebo by law. Furthermore, scientific journals have no regulations concerning the contents of placebos. Sometimes the manufacturers disclose them in connection with the study, and about 2/3 of the time they do not. And a double-blind randomized control trial should have two groups. A group that receives the vaccine, that's the treatment group, and a completely unvaccinated group. Given a saline placebo, that's the control group. That's not what the supporters of the status quo mean when they say randomized control trial. They compared two groups, but one group gets the new vaccine and another group gets a shot full of aluminum adjuvants. Or they compare a new shot to an older shot. But the one thing they never do is to compare a completely unvaccinated group with a vaccinated group, because everyone knows that such a trial would show harms. So if you go through all 1,704 trials in the database that Dr. Scott has put together, as Aaron Siri has done, you'll find that the inert ingredients are not inert. The placebo is not saline, and the randomized control trial does not have a completely unvaccinated control group. And we know that my assertion here is correct because on page 9 of his written statement, Dr. Scott states that vaccinated versus unvaccinated studies are especially prone to bias. It's hard to imagine a more Orwellian statement. Up is down, left is right, dogs are cats. And according to Dr. Scott, a proper vaccinated versus unvaccinated study is unethical. That's why we're in this mess. That's why we have an autism and chronic disease epidemic in this country.
Scott, first after Scott respond to that.
Yeah. Yeah, I'd be very surprised if you went through all 661 trials. We haven't even conducted the full analysis yet. But once
I think Mr. Siri,
yeah,
I think Mr. Siri kind of has.
you should join our team. Yeah.
He's got a pretty cracked team doing that.
Yeah, smart guy.
If you let me make the decisions, I'll join your team.
Yeah, let's do it. Let's team up. Yeah, first of all, yeah, we are, this is a work in progress. Hopefully it'll be published, and once it's published, I welcome any feedback, for sure. In terms of how we defined controls, that has not been publicized yet because we haven't published this, okay? But we did break it down between inert placebos that were biologically inert and placebos that were immunologically inert. So biologically inert placebos primarily include saline or buffer or water. And so there are certainly many studies that met that criteria. Then there are adjuvant-only controls. So we separated all that.
But again, the whole point of the 661 studies was to prove Secretary Kennedy wrong when he never said, and I don't know the exact statement, but there's never been any vaccines on the childhood schedule that have had a true random control.
I have the quote here if you'd like.
Yeah, go ahead.
Oh, sure. So Secretary Kennedy said, this was the CNN article reported, that, quote, 76 shots that children in this country receive, unquote, meaning routine injected vaccines on the CDC schedule, quote, none of them have been safety tested in pre-licensure studies against the placebo. And in response to that, the CNN article quotes Dr. Scott as saying that that made Dr. Scott's ears perk up, end quote. Scott, an infectious disease specialist at Stanford University, knew that the assertions couldn't be true, and now he says he has the proof, meaning Dr. Scott, quote unquote, knew the assertion couldn't be true before he even looked and did it. So whatever he's planning to publish, obviously he had his a priori belief beforehand.
So I was familiar with the body of evidence. I wasn't aware that there were going to be 1,088.
So
well, then why not start with the clinical trials that are actually published by the FDA and relied upon to license each vaccine?
We've included those as well.
Again, the problem with this discussion debate is it just gets into a lot of detail, and you have accusations going back and forth and assertions made back and forth. It is very difficult to follow, okay? Again, I personally think that Mr. Siri did a pretty good job of taking that 661 studies apart. But I want to go back to something that's, again, a little bit easier for us lay people to contemplate, and go back to numbers. I'm an accountant, I like numbers. In your testimony, you talk about the CDC estimates where I think the final number that I'm dealing with is a study that said the CDC between 1994 and 2023 that vaccines saved 1.1 million lives in America, okay? So again, I'm just working with numbers here now, okay? So let's take the 1.1 million. I'm comparing to the 154 million. I'm trying to make sense of these numbers, right? So if there's 154 million lives saved over 50 years, according to the WHO, CDC is saying, well, it's 1.1 million here in America over 30 years. So I just start doing the extrapolations, because again, these numbers aren't science, they're models. So let me continue the model. 1.4 million, we're 4% of the world's population. That'd be 27.5 million lives saved according to the CDC worldwide, just based extrapolating our share of population. That's over 30 years. So divide that by 30, come up per year, it's about 910,000. Times 50 years, that's about 46 million worldwide. So there's discrepancy right there between what the CDC is saying lives saved. Again, they're just making this up. They're just creating some model that is highly biased toward their viewpoint. The World Health Organization says 154 million. And again, I think Mr. Siri did a pretty good job of picking that propaganda apart. And that's what it is. It's propaganda. It's not science, it's propaganda. But let's dig a little bit further. In that CDC study, the way they get 1.1 million lives saved is basically off of 3 diseases: diphtheria, hepatitis B, and measles. And Mr. Siri does an excellent job of laying out some basic numbers that are hard to refute. So let's go through them. Diphtheria, about 750,000 of that 1.1 million. By the way, those 3 diseases account for about 84% of the 1.1 million lives saved according to the CDC. So how do they calculate that? Well, they say that diphtheria, they've saved about 750,000 lives over 30 years. That's 25,000 lives a year is what they're claiming is saved with vaccines preventing diphtheria deaths. The problem with that number is in 1948, when the first vaccine was licensed for diphtheria, the actual death was 634 per year. But let's, by the way, put up the diphtheria chart here. I think we have it on the video as well, don't we?
This is the first.
So the first diphtheria vaccine was put in use in 1929, was it?
It was 1926.
1926.
Senator.
But the first licensed vaccine was 1948.
Well, between 1900 and 1926, the mortality from diphtheria.
Oh, I'm getting to that.
So the first licensed or the licensed vaccine was in 1926, but it was rarely used. And between 1926 and the 40s, the mortality declined at the same rate in areas that used it, mostly major cities.
So by the time the first vaccine was widely used,
1949 was the first licensure.
The death rate had already declined by 97.8%.
When routine vaccine use really began in 1949.
By 26, it already declined by about 80-some%. Well, it wasn't from vaccine. That's from improved sanitation. We weren't living in squalor. There's better nutrition. There's a host of reasons why diphtheria dramatically was reduced in terms of rates per 100,000. So by the time we really started widely using diphtheria vaccine in 1948, we'd already reduced the cases, the rate fatality of
mortality declined by over 97%, and none
by
of that,
98%.
Virtually none of that had to do with vaccine.
But
it couldn't
again,
have been.
That year there were 634 deaths.
That's right.
And the CDC is saying we're saving 25,000 deaths a year of diphtheria.
Yeah.
Okay. So that's the most stark example of this. Hepatitis B, they're claiming 3,000 lives saved per year.
Right.
But in 1980, when that
first vaccine, 1981,
first came about, there were about 294 deaths. It's actually increased now that we've got the vaccine out there.
It's about 1,700 deaths a year now, so the number of deaths have gone up, but they're claiming 3,000 lives saved somehow.
So for measles, they're claiming about 2,700 deaths per year. 1963, prior years to the release of that vaccine, they're about 400 deaths per year. So in total, if you add up those three illnesses, okay, a total of 30,700 lives claimed saved per year for those three illnesses, whereas the death rate of the year of basically use of vaccines total 1,328. So they're literally claiming a 23-fold increase of lives saved over the actual death count when the vaccines came about. So again, there's all these claims, 154 million, 1.1 million. The numbers simply don't add up. And what's very clear, we could actually put up the measles chart. Can we do that in the same basic dynamic. By the time we actually had a measles vaccine, there was a 98% reduction in the rate of mortality with measles.
Right. With increasing population.
That's right, the book, Dissolving Illusions. Improved sanitation, improved nutrition, antibiotics, other treatment, which is a big problem with me with COVID, that we sabotaged treatment. We ignored treatment and put everything toward the COVID injection. But anyway, I think that's a point that needs to be made. What actually brought down the rate of death in these infectious diseases? Sure, vaccines might have provided the tail end of that, right? But the bulk of the reduction of those diseases occurred well before vaccines ever became popularized. Correct, Mr. Siri?
Absolutely. And overstating the benefits of a medical product is just as dangerous as overstating its risks. And they overstate the benefits based on this data by numerous folds. There's a few other points regarding that if you'd like me to address them.
Sure. Thank you, Mr. Chair. Just by way of explanation, I voted, and we have another hearing going on in the Judiciary Committee on Internet safety for the parents in this room. When you're done here, if you want to come over to the subcommittee of the Judiciary chaired by Senator Blackburn of Tennessee, we're looking at ways that the internet and social media can be made safer for children, Kids Online Safety Act. And I say that by way of explanation for my absence. I do apologize, but I think maybe we have some common ground on stopping toxic content that's driven to children by big tech, just as, by the way, I have urged and demanded and taken action to stop some of the abuses in big pharma. And the chairman and I have talked about ways to reduce the prices of big pharma. I'm working with Senator Cornyn on a measure that would lower prices of pharmaceutical drugs by eliminating some of the abuses. So I just want to make clear, I'm not here as an advocate for big pharma. I don't think anyone would ever say that I was. I want to come back to maybe a little bit of science here. Dr. Scott, what would happen if we stop routine childhood vaccines?
Well, we know that there would be preventable outbreaks of preventable illness and death.
And maybe you can expand a little bit. Why is it that unvaccinated children who, say, come down with measles can lead to outbreaks in schools, in communities around the country? I know it sounds like a simple, common sense question, but
Yes.
I'm not a scientist, and I'm asking questions because I'm curious.
Yeah, so these are contagious diseases, and they can spread to people who either weren't able to get vaccinated or who didn't get vaccinated or who are severely immunocompromised.
And that's substantiated by studies and by real-life experience, most recently in Texas, correct?
Correct. Yeah. Vaccines, have definitely played a role in, helping stop these outbreaks. I don't know how that could be denied.
Correct. And you have recently launched a project to document all of the randomized control trials that have been conducted by licensed vaccines. Could you talk a little bit about what that project has revealed?
Yeah, I think that you might have missed some of our discussion, but
I apologize to you as I do to everyone here.
And let me just say that the scientific evidence supporting vaccine safety and efficacy really represents one of the most extensive bodies of medical research ever assembled. And so we screened thousands of studies online, and we cataloged 1,088 randomized controlled trials that were published between 1941 and 2025 from around the world, covering vaccines from adenovirus to Zika virus. These are all publicly accessible, and transparency is built in by design. On our Google spreadsheet that is accessible to everyone with internet access, there are links that you can click on to see the primary source. And so across 7 decades of trials, we found no evidence of suppression. The challenge really is the sheer volume, not access to data. There are a lot of studies out there. There are a lot of poor quality studies out there that get published, even no matter how bad they are. There is a massive amount of studies out there, especially around COVID vaccines.
And the ones that are not published are available, are they not? It's available. Studies are available even if they're not published.
Well, I mean, this one wasn't.
And others as well, correct? There are links to them. They're available to people who ask about them, who want to make them public.
Yeah, but for the most part, it's not that hard to get a study published somewhere. I mean, there are thousands of vaccine studies.
Mr. Siri, we've been talking about medical issues. You're not a medical doctor, are you?
No, sir.
And you're not an immunologist or biologist or any kind of...
Or vaccinologist, no, but I depose them regularly, including the world's leading ones with regards to vaccines, and I have to make my claims based on actual evidence when I go to court with regards to vaccines. I don't get to rely on titles.
Okay. But you're not a doctor.
No, I prefer not to be a doctor because I prefer to rely on the evidence, not slogans like we've been hearing.
Okay. Let me ask you, have you spoken to Secretary Kennedy about his decision to approve COVID-19 or limit the approval and availability of COVID-19 vaccines?
No, sir.
You have not. Okay. Have you spoken to him about the vaccine injury compensation program?
I do not recall.
You have represented him, correct?
Yeah, I represented him when he was running for president of the United States of America. I've represented him during that period to get him off ballots across the country. I've represented him in some other capacities. I've also co-counseled with him in many cases for almost a decade.
Have you been under consideration to be part of his team at HHS?
I have not put my name in to be part of the government. I respectfully prefer to be outside of government.
Mr. Rogers, I understand your degree is in political economy, correct?
Correct. As I imagine you know, to earn a PhD, one must make an original contribution to knowledge as verified by external peer review. That's the degree that I have. And unfortunately, these days, medical school is just a glorified trade school for people trained to obey the pharmaceutical industry. Now, trade schools can be great, but Western allopathic medicine has completely lost its way. So, but I'm a doctor of philosophy and social sciences.
Okay. I guess we've established your views on the medical profession. You know, I'm curious. I don't know the answer to this question. In some of your Twitter posts, you said, and I'm quoting, "You people are all going to spend eternity in hell. Nuremberg 2 first, then hell." What did you mean by that?
Thank you for the question, Senator. I believe that we are in the midst of one of the greatest crimes in human history. We have a product being injected into children 70+ times over the course of their development that's never been tested against a proper saline placebo. Over that course of that time period, chronic illness in this country has gone from 10% of children having one or more chronic conditions to now more than 50% of children having one or more chronic conditions. Secretary Kennedy, in the hearing that was last week, said that the latest data from the CDC says that 76% of Americans now have one or more chronic conditions. And I believe that lots of these chronic conditions stem from iatrogenic injury. We have 3 million children with autism. Back in 1970, the rate was so low that it was essentially zero. I'm outraged by that, and I think every person in this room should be outraged by that. I don't know how to say it anymore clearly that we need to change course in this country. And I'm terribly disappointed by the medical profession. In the social sciences, there's this term called epistemic capture, which is when the entire knowledge production process becomes captured by one industry, and that's what's happened with science and medicine. And so I think we need to change course, and I think the people who have covered up the autism epidemic and the epidemics of iatrogenic injury should be held to account for their actions.
Are you comparing? I'm holding up a copy of the tweet. I'm sure you recognize it. You people are all going to spend eternity in hell. Nuremberg 2. And in another tweet, you made, I think, fairly clear that you thought Nuremberg 2 referred to executions. And then you said, if we could hit those sorts of numbers, meaning the numbers of executions following the Holocaust, when pharma fails, we would be doing great. I think the inevitable conclusion there is calling for the execution of people.
I think that's overstated. I think you're putting words in my mouth, respectfully, Senator.
I'm
if I
asking
may.
the question.
Yeah, no, I appreciate that. I appreciate that. So look, let's put it in the context of COVID. I've already talked about autism. Let's talk about COVID. The state, however you define that, the military, CDC, Tony Fauci, Ralph Barrick at the University of North Carolina, created a weaponized virus, correct? Gain-of-function research. They contracted it out to China, and it caused a pandemic around the world once it was released. The government created a weaponized virus that then got out and caused a global pandemic. When are we going to have accountability for that? I generally don't understand why government officials are allowed to engage in
Rogers, I'm not putting
research.
words in your mouth. I'm just quoting your words.
I would like to have
And I think
accountability for the COVID era, and I'd like to have accountability for the fact that the CDC has known since 1999 that vaccines cause autism, and they've covered it up for 26 years. How do we begin to have accountability? You want to call it something different? Truth commissions, criminal trials?
So
I would welcome
you're
that.
comparing the COVID-19 vaccine to the Holocaust.
Sir,
Well,
respectfully.
I
No,
will
first-
ask that these posts be entered in the record if there's no objection.
No objection. Okay, let's, I want to move on.
Let me
Let me put up a chart to show why there are people that are horribly frustrated.
I thought I had the floor.
No, you went over 4 minutes for your 7. So I already gave you like 11, 12 minutes there, so you're done.
I thought we had all the time in the world.
You
at
can,
that
once I do my 7 minutes, then you'll get 7 minutes again.
Well, I'm going to go back, and I invite anyone who's interested in internet safety, which is harming children, to attend the hearing of the subcommittee that I'm going to return to. I want to thank the witnesses in case I don't have the opportunity to come back. Thank the witnesses for participating. Everyone who is here, thank you for being here. And I'm sure we will have additional opportunities to air the issues that we've addressed here. And I hope that the corruption of science truly will end. Thank you, Mr. Chairman.
So thank you. So let's quick put up chart number 6. Again, I'm just kind of laying out why people are outraged, because people haven't been held accountable. This is a history of autism. This is a chart showing from, again, hard to say, but with CDC numbers starting in around 2000, from 1 in 150 to now 1 in 31. According to your testimony back in 1970, it might have been 1 in 10,000, a little less certain than using CDC numbers, but there's been an explosion. What are we doing about it? Who's asleep at the wheel? Who's trying to determine what caused this? As Dr. Chris Palmer said, when it comes to chronic illness, and I'd throw autism in there, they don't want the root causes discovered. That's why people are outraged. That's why people may put on Twitter things that they may regret later. Let's put up the next chart, number 3. This is probably my most censored chart. Dr. Scott, were you aware that worldwide on VAERS we've reported 38,742 deaths worldwide associated with the COVID vaccine? Were you aware of that carnage?
I'm not aware of that figure in particular, no.
In America, I believe the number 19,000, correct? Again,
but VAERS does not prove causality.
Oh, I've heard that time and time again. So let's take a look at the bottom figure down here. Of those 38,000 deaths, 9,252, 23.9%, it's called 24%, occurred on the day of vaccination or within 1 or 2 days. Now, I know that doesn't prove causation, but man, that's a correlation that we ought to look at. Do you know to what extent VAERS is reported to understate adverse events? Do you have any idea? Have you ever seen any studies on that?
I'm sorry, what's the question?
To what extent does VAERS underreport adverse events? Again, it's a pain to report something to VAERS. Okay, doctors are busy, takes half hour, 45 minutes. A lot of people don't know about it, so the vast majority of adverse events from a vaccine or a drug doesn't get reported to VAERS. So again, they've actually done studies on this. Do you know what percent actually get reported versus what doesn't get reported?
No.
Somewhere between 1 to 10%, correct, Mr. Siri?
No, it's less than 1% according to an AHRQ-funded study of Harvard researchers.
So if it's less than 1%, let's just use U.S. figures. Okay, by the way, what is this, 17,000 or 19,000 U.S. deaths? Yeah, it's close, okay? It's one of those, 17 or 19,000 deaths reported in the U.S. based on VAERS. If we're only recording 1 out of 100, that would mean deaths from the vaccine is somewhere between like 170,000 in the U.S. 170, again, that's at that kind of reporting ratio. This is why people are outraged. And what people are denying, they're not denying the potential effectiveness of vaccines. I think most of us think, yeah, they probably work to a certain extent. Okay? What they're denying are the vaccine injuries, the injection injuries. Mr. Scott, how much do you know about the mRNA technology?
A fair amount.
So is the mRNA that's encapsulating the lipid nanoparticle, is that true mRNA?
Is that true mRNA?
I mean, true mRNA, your messenger RNA, degrades very rapidly in the body. Mm-hmm. Correct?
Correct.
So the mRNA in the injection, is it true mRNA? Does it degrade rapidly in the body? Do you not know?
I do know. Yes, it does. But
it does. No, it does not. It's modified mRNA, and it's designed not to degrade. And there are studies that show it sticks around the body. We don't know how long. The lipid nanoparticle. Do you realize that it was designed to permeate difficult to permeate barriers, like the blood-brain, like the placenta barrier? Did you know that? Did you believe when Fauci told us that the mRNA shot would stay in the arm? Did you believe that? It's a simple yes, no. I mean, do you believe the COVID injection stayed in everybody's arm? Do you believe that's what happened?
Primarily.
You think so, huh? Were you aware of the Japanese FOIA of the study that was conducted of biodistribution where in rats it biodistributed all over the body, accumulated in the adrenal glands, in the ovaries? Because the lipid nanoparticle is designed to permeate difficult to permeate barriers, they knew, the designers knew, and they did a study that would biodistribute all over the body, but our CDC, Anthony Fauci, said it was going to stick in the arm. Now, do you know what the mRNA does? It's not a traditional vaccine, is it? Do you realize that? It's not an attenuated or a dead virus. It's messenger RNA, modified RNA, that's encapsulated in a lipid nanoparticle that distributes all over the body, and when it attaches to a cell, it unloads its mRNA into the cell, and it turns the cell into a manufacturing cell of a protein that is toxic to it. Do you realize that? Are you aware of that? I mean, just yes or no. I mean, do you know that or not? Because I talk to a lot of doctors who don't have a clue.
I know a fair amount about the mRNA vaccines. Do I know about all of these studies that you're referring to?
This isn't a study. This is the basic operation. Do you know how it works? It doesn't appear like you do.
Well,
so again, why would we have why would we have almost 1.7 million adverse events, dramatically understating it? Why would we have that number of deaths? It's because these little lipid nanoparticles are distributed all over the body. They're attaching to cells. They're turning cells like a heart cell into a manufacturing site for the spike protein, which is toxic, and the body attacks it. It causes inflammation. That's what myocarditis is. And the designers of the injection knew it. And Anthony Fauci knew it, and he lied. That's why somebody like Mr. Rogers, Dr. Rogers, gets so upset and is outraged by the cover-up of this. That's the problem here. I've got a lot more to say. Have you heard, do you know anything about, for example, the DNA contamination that's being reported? I want to enter into the record the McKernan study, just recently released, without objection. There's nobody to object. Again, have you heard about this, that there's DNA contamination in, particularly the Pfizer? You're aware of that?
Yes, and
Do
the levels
you know at what levels it exceeds the FDA recommended amounts?
No.
36 to 627 times. The allowed amount is 10 nanograms per dose. And this research paper shows it's 36 to 627 times higher than that. Does that concern you?
Yeah, if that's a legitimate finding, yes, that's not the information that I've been aware of.
Yeah, but you know, it saves 3.2 million lives. No, it didn't. It's impossible. That's entirely possible. Okay, so I got the McKernan study there. How about Dennis Rancourt's study? Are you aware of that one? It's a model.
No.
But it's a model of, I think, 17 equatorial and south hemisphere countries whose excess all-cause mortality was highly correlated to the uptake in the vaccine. So based off that study, their data, he estimates 17 million people died of the COVID injection. 17 million. I don't know, it's a model. It's like the 154 million. It's like the 3.2 million. It's like the 2.5 million. It's all those numbers that are confidently spewed. This study gets no reaction. I've entered that in the record. Mr. Secretary, I want to ask you, the 1986 law set up a task force. It was disbanded in 1998. It was supposed to produce reports on how to improve vaccine safety. How many of those reports were ever produced to Congress?
So the mandate for safer childhood vaccines, which is what you're referring to under the 1986 Act, the third section, at 3 parts, required a biannual report to Congress that explained how HHS, in which the FDA, CDC, and NIH are all located, made vaccines safer in the prior 2 years. The total number of reports since 1986 are 0. 0. Never been submitted. The second part of the mandate for safer childhood vaccine creates a task force, which you just mentioned, Senator. That task force is comprised of the head of the NIH, CDC, and FDA, and they're supposed to make recommendations on how to make vaccines safer to the Secretary of HHS. That task force made one set of recommendations in 1998 and then was disbanded and has now been under Secretary Kennedy put together. The first part of the mandate, if I may add, is what actually requires HHS to make vaccines safer, right? Because they made the pharma companies immune to liability. They took away the normal market forces that would drive them to actually engage in safety, recognizing that Congress, in its wisdom, at least in that part, was wise. It made HHS responsible for vaccine safety. And of course, if HHS is not doing the simple parts of the mandate for safer childhood vaccines, which underpins all of vaccine safety in this country, of putting biannual reports to Congress, of having a task force, you think they're doing the hard part in part 1? Of course not.
Talk about V-Safe. Switching gears, kind of sticking to COVID. I mean, you're the one that had to sue. You know, I think one of the interesting, I think actually the very last sentence in Dr. Scott's testimony is, let me find it. The data are public.
Yeah, the data certainly are not public. First of all, when it comes to the clinical trials for each vaccine, we've had to sue the FDA to get the underlying clinical trial reports. For most of them, we've sued for the Varivax vaccine, for the Hep B vaccine, for many of them, and for the COVID vaccine.
Real
That's
quick,
not public.
I'm going to
Sorry.
get back to V-Safe.
V-Safe.
Dr. Rogers, isn't it true that even peer reviewers don't get to look at the data of studies? That's common,
right?
Generally true. I mean, what is the truth in terms of how often researchers actually make the raw data available?
I mean, a proper study should make the data available. That's a norm, but that doesn't happen in the case
part of the
vaccines.
problem with that, the Anderson et al. Study in Denmark, that's being touted that aluminum is not a problem, is people questioning cannot get the data even though it's already been de-identified. Correct?
I mean, that's true of yes.
And by the way, the data safety link.
Yeah, the VSD, the Vaccine Safety Data Link.
What happened to that? How available is that right now?
It's not. In 2000, up until 2000, it was part of the CDC, and you could get access to it through a FOIA. A number of people did. Published studies the CDC didn't fit the policy about vaccines, and so they then shifted it over to a trade association to get it out of the reach of the Freedom of Information Act and others. So it's been distributed. You can't get
That's
access
not
to
very.
VSD.
That's just that it's not exactly transparency, is it?
It's actually literally. It's not only is it not transparent. You cannot get the data underlying VSD studies they published, like the data for 2 of them, which is antithetical to how science. You can't do reproducibility. Not only that, it's selection bias, because if you want to do a study, it has to go through CDC's clearance process, actually, which means that only studies that conform with its policy that vaccines are safe are going to get published.
So let's talk about the V-Safe, which was established for the COVID injection. 10 million people voluntarily signed up. I mean, I think what they were reported is completely inadequate. But talk about how you had to sue and how long it took you to get the data from what was supposed to be the transparent safety surveillance system, and then what the results were. Could you just quick tell that story?
Over 2 years, actually collectively almost 3 years of litigation it took. V-Safe was a safety system rolled out in December 2020 along with the release of the first COVID vaccine. Up until that point, CDC touted VAERS, and they said, well, VAERS isn't reliable. We're going to have V-Safe. V-Safe, they said, was a robust, rapid way to identify safety issues with COVID-19 vaccine. 10 million Americans signed up very rapidly over about 6 months. These were the vaccine enthusiasts who got the vaccine from December 2020, and about 9 million in those first 6 months. And they got a form to fill out every day for 7 days after the shot, then every week for 6 weeks, and then 3 times after that. On that form, we checked the boxes. There were basically 2 types of check the boxes. First, check the box was for symptoms. But the symptoms that the CDC chose to include were the ones that they say are normal and fine after the vaccine, and they only collect that for 7 days, what they call reactogenicity. They're good. They show the vaccine is working. You're having an immune response. So that data was completely irrelevant for assessing safety. In fact, they reported 60, 70% of people reporting having that, and the CDC said, great. That leaves only one other check-the-box data that was actually worthwhile, and that was folks seeking hospital care, missing school or work, or not performing normal daily activities. Well, what the CDC was doing is they were pumping out study after study after study that only showed the first week after the shot for those 3 categories. Well, we wanted to see the full data set. My client, the Informed Consent Action Network, wanted to see the full data set. So we said to the CDC, hey, this stuff's totally de-identified. Just release it. It's literally sitting there in files. You could release it in 2 minutes. It took us almost two federal lawsuits, a year and a half of litigation, 2 years of litigation almost to get that data. And when we did, it was clear why the CDC wanted to hide it. It wanted to hide it because what it showed was 7.7% of these vaccine enthusiasts reported needing medical care that they attributed, most likely, to the vaccine after getting the COVID shot. 7.7, that's 1 in 13. And on average, they sought medical care 2 to 3 times each. You don't go to seek medical care 2 to 3 times each. And 75% of those were hospitalization, emergency room, or urgent care. So these were serious issues. I don't know if, and that was the only data point that V-Safe could possibly have used to actually assess safety. If 1 in 13 seeking medical care, on average 2 to 3 times each of the manner I just described, is not enough to pull the plug, it was clear V-Safe was not designed to assess safety. V-Safe was designed to affirm its a priori belief this shot was safe. If it wanted to make V-Safe actually a system that would assess safety, it would have added, for example, a check the box for chest pain. right? So they can assess myocarditis. It could have added, check the box, for the numerous adverse events of special interest that its own vSafe protocol identified 2 months before it rolled out, including myocarditis, pericarditis, all the issues blood clotting we ended up seeing. From the clinical trial, apparently, it knew that these could potentially be issues. It put it in the design documents, but it never made it into the actual system itself. vSafe was not designed. It's the closest thing to mens rea, purposeful intent to design this system to assure that it would never actually show a safety issue. I don't think they expected that many people to report seeking medical care.
Can I add something?
Sure.
Thanks. I just want to emphasize that the last thing I want to do is cause any harm. The last thing I want to do is the last thing I want is for anyone to be harmed by a vaccine. If there is a vaccine safety issue, I want it to be detected. And there are multiple overlapping layers of monitoring systems that I do think work pretty well. Are they perfect? No. But when it comes to, de-identifying data and all that, it's a little complicated. So, but there are a number of other data monitoring systems. But it's just really important that we understand that there is not some grand conspiracy amongst the CDC, FDA, EMA, around the entire world, thousands of scientists and doctors and public health experts, you really believe are conspiring for the sake of helping pharmaceutical industries profit?
I think
Mayor respond.
I think this is a case example of why that happens, is because if you conduct a study and get the results that runs counter to their interests, they will destroy you. I mean, again, I had Dr. Peter McCulloch, I had Dr. Pierre Corey, I had a bunch of other people come before Congress, testify truthfully. Their careers were destroyed. They were destroyed. It doesn't take too many people to be targeted and made an example of before everybody else kind of goes, I don't think I'll step out of line. And so I think that's, again, the sympathy shown by Mr. Bigtree and Mr. Seery in terms of the people that they convinced to do the study. They didn't basically want to rat him out. I'm the one that ratted him out. Okay, and so I forced him along here. Okay, and again, and I hope, God, I truthfully hope, because I think the people who did those studies, Dr. What is it?
Dr. Zervos.
Again, I don't want to see them lose their job. I'd like to pin a medal on them in terms of, good, you conducted a great study. Shame on you for not publishing it, but we understand because we know you probably would have had your career destroyed. All those years in medical schools, all the lives that you save when you treat patient, you won't be able to do anymore because the certification bureaus, the boards, they will destroy your career. Again, I've seen it. I know the people. It happened during COVID. So yeah, I mean, is it a grand conspiracy? I don't know what you call it. It's certainly what I would call the COVID cartel and the medical establishment cartel and captured agencies. Yeah, that absolutely exists. Okay? You don't think so?
No, I don't. I think that, I love people. I love my patients. I try to give them the best care that I can provide them. I discuss the risks and benefits. I discuss the risks and benefits of every vaccine or every intervention. I have a nuanced conversation with them. I don't shame them, no matter what their views are. Do
you think doctors should have been fired for prescribing ivermectin? Do you think they should have had their certification taken away from them? Do you think they should have been sued? Do you think that should happen to doctors? By the way, ivermectin and hydroxychloroquine are all FDA approved, and you as a physician have full off-label prescription rights, correct?
Correct.
So again, do you think it was right that doctors who prescribed ivermectin were fired, were decertified, lost their license? Do you think that should have happened?
I don't have an opinion about that.
You really don't, huh?
No, I don't. I've never thought about it. I don't
think about it now. And we'll come. And by the way, I truly want you to come back,
I would love to. This has been a real...
Okay, swear on the Bible. 'Cause
pleasure.
We're going to have you come back with Peter McCulloch and Dr. Pierre Corey and Brian Cole. Might even have Dr. Malone, which, by the way, don't leave, because I think I'm going to ask consent to have you come up and defend yourself, seeing as you were slandered in this hearing. I think we're kind of running the course here. I mean, I could keep going. I mean, I would recommend everybody watching the hearing. This will be posted. Mr. Seery's response to Dr. Scott's testimony. I think it's important. I think it's insightful. But what I will do is I'll give all three witnesses an opportunity to just make some concluding remarks.
If I may just address a number of things that were said that I think are important to address just on the record. I appreciate that opportunity. In terms of the Henry Ford study, first I'd like to just say that the scientists that engaged in the study should be given incredible credit for having the fortitude to at least do the study. Now, maybe they didn't go through it at the end of the day and publish it because they don't want to lose their jobs, and it got the result they didn't expect, but they at least went and did it, which I could say is far more than I could say for most scientists that I've tried to interact with. In terms of the claim with regards to, somebody asked, well, what did any journal say about it? No journal had an opportunity because they don't want to get fired, though they themselves have reaffirmed it. And I litigate around studies all the time. I've read hundreds, thousands. You can watch my depositions regarding specific studies. In terms of a design of this study, this is probably one of the best designed studies in the area of vaccines I've ever seen by far, and it is the best study that assesses the safety of vaccines.
No study's perfect.
No such thing.
It's hard to design these things. I mean, just
Absolutely.
give them that credit.
But what they did is that unlike some of these other studies that play games or have basically vaccinated versus vaccinated studies, that's what most vaccine science is. I'm going to compare this person that got X amount of X and this one got X amount, and that's not the way you should assess the safety of any product. You got to look at folks who got it versus those that don't. The other thing is that
the analogy I use on that is kind of like saying, well, we wanted to study the danger of arsenic. Let's compare it against hemlock.
Yeah.
Maybe not a perfect analogy,
I'm going to do this. I'm going to look at 17 vaccines in this group, 16 in the other, and I'm going to say C vaccines don't cause autism, for example. That's not a good way to assess whether vaccines do or do not cause autism, as an example. Now, an issue kept being raised about ADHD. How could there be 0 cases of ADHD in the unvaccinated group? First of all, I'd like to point out that there are issues in the unvaccinated population in this study. There are kids, for example, 52 children had asthma who were completely unvaccinated. So obviously, there are other environmental insults that can harm children, not just vaccines, right? But when it comes to ADHD, and I have this in my submission, the underlying science on ADHD shows that it is a result of a form of immune system dysregulation. ADHD is blamed on something going wrong on the immune system of our kids, and there is biological plausibility for precisely how vaccines could cause ADHD and why you might have ended up with 0. And if Dr. Scott ever looked at some of the other studies out there that do have vaxxed, unvaxxed, then they're smaller. They have not as robust as this, but they exist. One of them, they also found far higher rates of ADHD amongst the vaccinated population. In terms of biological plausibility, I will rest on my submissions where I go through each of these conditions, cite to peer-reviewed science that shows the etiology often is some form of immune system issue, and they can be caused by immune system-related issues. On the autism piece, on the null hypothesis, yes, there was one case. There were 23 cases of autism in the vaccinated group. There was 1 case of autism in the unvaccinated group in this study. Back up until basically 2012, you could not diagnose and bill under the billing codes for ADHD and autism. You had to pick, okay? So most autism cases did end up in the ADHD category up until that time because that's how the DSM-IV was structured at the time. The DSM-5 changed that system, and so there's probably a lot of the autism is probably within the ADHD category in this study, by the way. But putting that aside, that also, one is that you've lost those to the ADHD category, and then 2, if you don't have enough power, you can't reach a conclusion. The confidence interval crosses the one line on both sides. So it could be there's an increased risk, it could even be a decreased risk. This study just can't tell you, that's all.
I think it's fair to say, you take a look at that Henry Ford study, it's not perfect, it's not necessarily determinative. What it says is we ought to look at this more.
Absolutely.
We ought to take this seriously. I mean, it's pretty high probability that, heavy vaccination might lead to higher incidence of chronic illness. I mean, it says that. I mean, that seems to be indisputable. Whether you can't read the whole thing as everything is gospel and this is black and white. The world is gray.
And you were accused earlier of being cherry picking that Commonwealth Fund study, though I will point out that is what Dr. Scott, and the only study he put in the United States for reducing COVID-19 vaccines.
By the way, that's been quoted here in these hearings before this.
I
kept going, where are they getting this 3.2? What's that all about? Well, I found out, and like I said, I did my own arithmetic.
And I appreciate Dr. Scott's anecdotal experience with COVID, but that's not the way we make scientific decisions. We have to look at the data. And I think when you look at the data, all right, not on slogans, not on what people feel about these products, okay? I mean, he might be I have no doubt Dr. Scott's a very nice guy. I don't know him. He might be a very nice gentleman.
He's been a pretty good sport.
And he's been a great sport, and he's endured a lot here today. He has probably not been exposed to a lot of this data and side information, and that's true of most doctors that I depose. I mean, your typical pediatrician and infectious disease doctor, when I depose them about vaccines, they know nothing. I mean, you put him through the ringer on COVID-19 vaccines, but that's not what he's trained to know. He's not trained. It's not within his knowledge. It's not part of his training. It's not what his typical experience is. That's my experience with most doctors. I mean, they're bad. They just don't know. And at the end of the day, I know that they're taught that there's this incredible body of science that underpins the safety of vaccines. I could tell you as somebody who has to litigate these products, that is just a slogan, okay? It is not true. And the fact that there are so many doctors who agree that that's true is of no moment. The fact that medical organizations say it is of no moment. The only thing that matters is what the evidence itself actually shows. And you can crowdsource as many clinical trials as you want from around the world randomly, haphazardly on some Excel file list on the internet. But that does not change what the actual clinical trials were that were relied upon to license each child a vaccine. And when you look at each one of those, as we have done, as we need to do for our work, they are disturbing. They do not affirm the safety of these products. There is not a single routine injected child vaccine that was licensed based on a trial that affirmed its safety.
Okay. Thank you, Mr. Rogers, or Mr. Siri, Mr. Rogers.
Thank you, Senator Johnson, for organizing this hearing. I'm so grateful for your leadership in the Senate and across America. We're deeply indebted to you for your courage in the face of the wealthiest and most powerful industry in the history of the world. So let me explain how all this works. This is right in my wheelhouse. This is what I study. I follow the money. Autism is a political economy problem. These are all political economy problems. So let me explain how this works. Thus far, government has failed in response to the autism epidemic because of regulatory capture. Rather than protecting public health, regulators have advanced the interests of the pharmaceutical industry. That's pretty straightforward. Science and medicine have failed in response to the autism epidemic because of epistemic capture. And what I mean by that is that the pharmaceutical industry has captured every step in the knowledge production process in science and medicine. Big Pharma controls what is studied, how it is researched, and what qualifies as evidence. Now, this capture permeates every level of the system. Medical textbooks and curricula are influenced by financially conflicted academics. Universities and department chairs hold substantial pharmaceutical ties. Most clinical trials are conducted by for-profit contract research organizations in China and the Third World. A large share of scientific journal articles are ghostwritten. The pharmaceutical industry spends over $27 billion annually on drug promotion and continuing medical education. Standards of care are authored by conflicted physicians. So from the first day of medical school to the final years of practice, doctors live inside an epistemic bubble engineered by the pharmaceutical industry to increase its profits. Senator Blumenthal and Dr. Scott only pay attention to captured science, science that's controlled by the pharmaceutical industry. The correct answers, the best science, is happening outside of that epistemic bubble. The entire system of knowledge production in science and medicine needs to be overhauled to liberate it from the biases and distortions imposed by the pharmaceutical industry. So just to wrap up, An estimated 115,000 children develop autism every year in the United States. That means that 315 children develop autism every day in the US. Now, if Dr. Sally Ozanoff's work is correct, and she's at UC Davis, she shows that 88% of autism cases are characterized by regression. That means that, so if she's right about that, and I think she is, that means that 277 children regress into autism every day in the United States. Now, regression suggests an acute toxic exposure, not genetics, not better awareness, an acute toxic exposure, which means that most cases of autism are preventable. Autism is not a medical or scientific mystery. We know beyond a reasonable doubt that toxicants, mostly from vaccines and about a dozen additional toxicants, are causing autism. If we repeal the 1980 Bayh-Dole Act, the 1986 National Childhood Vaccine Injury Act, and the 2005 PrEP Act, that would remove the structural incentives that created the autism epidemic and the chronic disease epidemics in this country. Thank you.
Thank you, Dr. Rogers. Scott, we'll give you the last word on this panel. And again, you've weathered the storm. You've been a good sport about this. Appreciate it.
Thank you. And no, I appreciate debate. I do. I don't appreciate intimidation. Not that you are, but there has been a very alarming degree of threats against doctors and public health experts. I mean, I think that it's very important that we recognize the CDC shooting for what it was. And I hope that we can all agree that regardless of our beliefs and opinions about vaccine safety, that we don't send mobs looking for scientists and physicians, okay? Can we all please agree on that?
We can agree that you shouldn't characterize those who don't want to vaccinate as violent.
What's
I
that?
can agree with that. I believe what you're trying to say is you're characterizing those who take issue with this product as violent, which is precisely what folks do when they don't agree with another person's position. They dehumanize them in that matter. So I don't agree on that score, but I, of course, abhor and always condemn violence from anybody.
Yeah. So I certainly don't characterize people who have skepticism or whatever you want to call it. Okay,
You're accusing them of you know exactly what you're accusing them of.
I'm not referring to people who are skeptical of vaccines. I'm referring to people like Dr. Robert Malone. I'm referring to people like Toby Rogers, who implies that people like me should be executed.
No, I think he implies
that is completely false.
I'll ask as his counsel for a second. He said there should be a trial. That's an opportunity to have evidence. That is not execution. That is a court proceeding, though I'm not acting as Mr. Rogers, Dr. Rogers' attorney at the moment.
So 20 days after Officer Rose was killed at the CDC, leaving a young daughter and pregnant wife, Dr. Robert Malone, who currently sits on the ACIP and sitting behind me, posted on X to his 1 million followers, "We know Fauci is hiding out in Siena, Italy, but where in the world is Lena Wen and Rochelle Walensky? Inquiring minds want to know." A sitting ACIP member asking for officials' locations after targeted violence is not criticism. That's incitement. Johns Hopkins has documented that 57% of health departments reported harassment. JAMA published data on widespread physician threats. I myself received physician threats, and I imagine that those will go up after this. Many officials have resigned from their positions. CDC staff have described working in fear since the shooting. This is not scientific debate. That is intimidation, okay? And when someone advising CDC on vaccine policy asks where in the world officials are hiding after a deadly attack, that crosses every line. These are doctors and epidemiologists with families, not enemies of the state, and they deserve to work without fearing for their lives. okay? So that's one thing. Going back to the Henry Ford study, I would love to see more people look at this and analyze it, okay? So let's put it out there, all right?
Well, that's better than your first position.
Nothing shouldn't be suppressed. So I don't know why it was hidden for so long.
I've explained that, I think, numerous times.
Yeah, I don't really buy that.
But you don't buy that. You don't buy that.
Let Dr. Scott make a statement.
Do you accept the study's null hypothesis, or sorry, null finding for autism?
Absolutely. It had a null finding for autism. Clearly, that's what it found. 21, I mean, it was right there in the study. It said 23 cases of autism in the vaccinated, 1 in the unvaccinated.
Provided plausible explanation.
Right,
And I explained exactly what it is, and it's exactly what it says. The data should say what the data says, and unfortunately, that's not what typically happens with vaccine science.
Okay, good. All right. So I also just want to say that we should all take autism seriously, and we should all do everything we can to find the underlying cause, okay? If there is a link between an ingredient and vaccines, I want to know about it.
Why don't we just start with looking at the safety of the whole schedule, which is what this study does.
Mr. Siri, let Dr. Scott finish,
I apologize.
please.
I will also say that vaccines and autism has been studied more intensely, perhaps, than any other question in public health. There was a Danish study that followed 1.2 million children for 24 years, no autism link. There was a meta-analysis of 1.25 million children, no link. Sibling studies that control for genetics, no link. Denmark removed thimerosal in 1991. Thimerosal was, supposed to be the culprit, right? And then autism rates went up. The US removed it in 2003. Rates continue to rise. Autism is approximately 80% heritable and develops in utero. So the apparent timing with vaccines likely reflects when symptoms become noticeable, typically when children have scheduled visits. That's correlation, not causation. Every major health authority, national academies, CDC, WHO, Cochrane, has examined this evidence and reached the same conclusion. When independent research teams across different countries, populations, and decades consistently find no link, that is pretty convincing to me. But we should continue to do what we can to find the true underlying cause. Now, I see a lot of patients. I'm primarily a clinician, okay? I don't know every study out there in the world, especially, animal studies on mRNA in the brain, okay? Laugh at me if you want. Yeah. So, but I primarily see patients, and when I talk to them, I give them the best information that I have so that they can make the best decisions for themselves. I don't tell them to not to get a vaccine or not. I have honest conversations with them. And I think that it's important to note that a lot of the patients that I see come to me having been misdiagnosed with something. I see a lot of patients who have chronic fatigue and a number of other symptoms. I'm one of the few who's willing to see these people because a lot of other doctors aren't, to be honest. And I have deep respect and compassion for them. There are a number of people who suffer from conditions like autism, like chronic fatigue, and we do need to find the underlying cause. And we do not, I do not, dismiss those very serious issues, okay? But if we hang our hat on one thing because we have this confirmation bias, we run the risk of totally detracting from actually finding the underlying cause, okay? And then, these people suffer unnecessarily. So yes, we need to do everything we can to optimize vaccine safety. There are a number of things we can do to improve our vaccine safety monitoring systems, no doubt. There are a number of things we can do to investigate the underlying causes of autism and everything else. But I do just want to end by saying we need to be civil and we need to be respectful.
Well, Dr. Scott, first of all, I think I've been civil, respectful.
You have. I'm not accusing you.
I will say
I'm not accusing you.
I don't hang my hat on anything, other than I know we have been lied to. I know, to a certain extent, science has been corrupted. Okay, those things I just know because I've seen it. Okay, I do ask you one question, because kind of like Bobby Kennedy. I mean, I didn't I didn't come here to do this, okay? I mean, Bobby Kennedy was an environmental lawyer. He'd give talks. Moms would show up with their T-shirts about their vaccinating their children. Kept them at arm's length until one mom showed up on his front step and said, I'm not going to leave till you read this science, this research. And he did. And he knows how to read science, and once he did, his eyes were open. He couldn't close them. Del Bigtree produced a documentary called Vaxxed, and they took it on the road. And they weren't expecting this, but everywhere they premiered this documentary, literally ended up being thousands of parents showed up to telling their story. We had, in our hearing the vaccine injured, we had one of the moms who lost her child to SIDS. And in her SIDS support group, what all the parents were talking about were the vaccine. So I guess the question I have you as a clinician, what do you say, because we have plenty of examples, I'm seeing one sit right behind you, others who have testified. What do you say to parents who had a perfectly healthy child at whatever age, 18 months, 2 years, whatever, take their child in, they get a vaccine, or multiple vaccines. They come home, that child has a severe fever, seizures, never utters another word. Ends up being 20 years old, so frustrated. What do you say to those parents who have that? I know it's anecdotal. I know it doesn't prove causation, but what would you think? If you're a parent, perfectly healthy child, talking, developing great, vaccine, what do you say to those parents? Are they just making it up? Because that's what's being denied. That's what I've seen. As I've gotten involved in this, starting with the COVID injection injuries, they're still being denied because nobody wants to have to deal with it. Nobody wants to admit they're wrong if you're a doctor and you suggested that injection or these vaccines. You don't want to admit that maybe that wasn't right for that person. So and society, trust me, doesn't want to bear the costs. I mean, the cost of compensating vaccine and injection injured, again, I'm a fiscal hawk. We're $37 trillion in debt. That's a problem. So again, in all honesty, what do you say to those parents that have that experience?
Well, I certainly wouldn't dismiss their concerns. I'm a parent. If one of my children, came home after having been vaccinated and, had a seizure, yeah, I would be concerned. And so I try everything, I truly sympathize with my patients, and I would truly sympathize with that parent. And I would try to understand, everything I could about that particular case. And I would take it very seriously, and I would sympathize. Yes, I understand. So I do understand why it's concerning.
It sounds like you'd have an open mind.
Yes.
And honestly, that's all I'm asking. I think that's all that anybody in this community is asking. Please, God, have 100%. An open mind. Help us discover the cause.
100%.
Help us understand this. Nobody's suggesting violence. Nobody's trying to incite violence. They're frustrated. They maybe write something on Twitter that maybe they regret later on when it gets bandied out in a Senate hearing.
I don't.
But it's just that pent up frustration of we've been ignored, we've been gaslit, we've been vilified. That's the problem. So again, I truly appreciate. I think you've been a very good witness. You've obviously you're outnumbered. I think, as I said, whether the story, you've been pretty sport, and it sounds like you have an open mind. So that's really all I'm asking of not only you but everybody else is have an open mind.
100%.
Okay,
we're on the same page there.
Okie doke. So again, Mr. Very quick.
Can I respond to the point of civility? There is nobody out there that you can talk about the way that the media and the medical profession talks about people that don't vaccinate. Throw them out of school, kick them out of their jobs. The way that those folks are treated, they're not to be lectured by anybody about civility.
Remember this
that is the height of absurdity. Absurdity. I mean,
But now
truly
actually-
absurdity.
So next, I actually
It's an insult on top of injury. That's what it is.
So I actually have one extra, and this is a genuine question, because it always popped up during COVID, and I have to ask the same vaccines. I asked it repeatedly during COVID, if these things are so effective, why do you care whether somebody else gets vaccinated? I mean, I think that applies to I realize there's some children immunocompromised can't get vaccinated. I got that, but
Well,
still.
Senator, you know our firm has the largest practice in the country that represents children that need medical exemption. I will tell you, we don't have a single client who is immunostate. Their neutrophil levels are such that they're only susceptible to disease that could really injure them for the few that we vaccinated, but not the other 1,400 known pathogens. It doesn't exist. It's a myth. It's a myth, basically. But it's a way to bludgeon again the kids whose parents typically don't need these vaccines. Can I just say one thing about the autism bit, just because it's been bandied about? You know, we sued the CDC for the studies that support that the vaccines given in the first month of life do not cause autism. We sued them because they wouldn't give it to us. We said, give us the studies that show the meningococcal vaccine, the polio vaccine, the Hep B vaccine, the Hib vaccine, and the Hep B vaccine. Those 5 vaccines don't cause autism. You know what they provided? None. We sued them in federal court. They ended up in stipulated order. They gave us 20 studies. Not one of them has to do with those vaccines. They're all MMR or they're all thimerosal. This notion that there's a mountain of studies out there that show vaccines of autism is ridiculous. And I've heard the measles death in Texas bandied about. We represent one of those families. We've seen the medical records. One of those kids, I can tell you for certain, did not die from measles. He died from hospital malfeasance. That's what he died from. He wasn't even having measles when he died, and we'll be putting out a report on that. And somebody else has reviewed the medical records of a second kid. I agree we shouldn't engage in fear-mongering. And if we were talking about the overview of the scientific literature, instead of randomly looking at studies, maybe start with the Institute of Medicine reviews of the entire body of literature from 1991, 94, 2012, the HRQ reports, and you could see how vacuous vaccine safety science is. I'll leave with one last point. Look, if vaccines are so safe, why are they the only consumer product where you cannot sue the manufacturer for injuries to claim it was made safer? It's been 1980s, it's been over 30 years they're telling you Hep B safe, Hib safe, these are safe. You still need immunity? Okay, let me tell you my definition of vaccine, Senator. It's a product that causes so much injury that it has to have liability for the injuries that it's causing, immunity for the injuries that it's causing. That's what a vaccine is.
Okay. So again, I want to thank the witnesses. And again, Dr. Scott, I'd love to have you back and talk about treatment, because again, that's what kind of drives me nuts. Now, Dr. Malone, I see you just standing up. I will say that the advice of my staff is, let you respond to the comments made against you to the media. But if you want to, I mean, I'm going to ignore the advice of my staff here, but you'd have to be sworn in. If you want to come up here, I'll offer that opportunity. I'll dismiss the other panel.
Mr. Scott, I'd like to say hello. My name is
Hello.
Dr. Robert Malone. I
Nice to meet
invented
you.
mRNA vaccines. I know the answers to all those questions that you don't have.
Well, he's not here. So, close out this hearing? You want to do it? Okay.
Hey, I've been defamed twice.
Okay.
Twice during this meeting.
Okay, just hang on. I've got it. Their committee rules. Hang on.
Civility.
Okay.
Ridiculous.
So we by rule, we have to allow Senator Blumenthal to come back here, okay? So before I do any of this, we have to give him that opportunity. Is there a time limit on this? Yeah, I know. Okay. So why don't you, again, this panel is dismissed. I'll sit here.
I congratulate Dr. Scott on his ability to read minds. Now, I've been trained as an expert, and I know that one of the things you cannot do is infer intent. Dr. Scott has done exactly that. He has misconstrued what I said about Rochelle Walensky and about Lena Wynn.
Yeah. This panel, you're dismissed. Thank you again for your testimony. And Dr. Scott, we might get another invitation letter here sometime in the future. Okay, thank you much.
Thank you, Senator Johnson.
Over the last 4 years, thousands of essays. And we get a little bit of a break. We put them out 7 days a week, but we get a little bit of a break on Fridays and Sundays by doing a roundup of memes that other people have posted previously. They're sourced from many different places, and we typically cluster them around topic areas. Now, unfortunately, the morning, and just a little more context, of course, I speak here as a private party, even though I am appointed as a special government employee, serve at the discretion of the Secretary on the Advisory Committee on Immunization Practices for the Centers for Disease Control and Prevention. I have 30 years of experience in vaccine development. I have multiple fundamental patents and discoveries, of which 6 have to do with mRNA vaccines. They were all filed between 1990 and 1991 that have subsequently issued. Those are the foundational documents in RNA vaccination history. They go back to my original invention disclosure about the use of RNA as a drug at the Salk Institute, working in Inder Verma's lab in the molecular biology and virology laboratories of the Salk Institute, circa 1987. This predates the work of Carrico and Weissman by well over a decade. mRNA vaccines were reduced to practice at Vical in approximately 1991. Again, published. I hold over 100 papers, thousands and thousands of citations. I'm recognized internationally for my work. And as I say, it goes far beyond mRNA vaccines. I've been asked to testify at the World Health Organization twice. I played a key role in bringing forward the new health Public Health Agency of Canada vaccine for Ebola and got it sold to the company Merck because I believed Merck was the most appropriate firm to further develop that vaccine, and I helped get hundreds of millions of dollars of federal funding to support the development of that Ebola vaccine at Merck, which was subsequently licensed. I am a vaccinologist. I am an immunologist. I am trained as a pathologist. I taught in medical school pathology for decades. But when I spoke about medical ethics early on in the COVID crisis and the fact that coercion, compulsion, and enticement were not consistent with the norms of medical ethics, a discipline that I've been trained in extensively because I do clinical research, that led to my being asked to comment about the technology for RNA vaccination, having developed it. And that led to an incredible wave of hate and blacklisting and defamation. Now, among those were many articles from, say, the New York Times, the Washington Post, Atlantic Monthly, Business Insider, et cetera, et cetera. But the consequence of this was that my consulting business that had been operating for over 20 years was destroyed. It's not the first time that I've been a whistleblower and had my profession destroyed. Unlike some of these folks, as physicians that were unwilling to speak out, I have spoken out. I spoke out in particular about the death that occurred at UPenn, having to do with Jesse Gelsinger and the use of adenovirus vectored gene therapy. And when I did that, I destroyed my academic career, which is why I transitioned to working primarily with the U.S. Army, particularly working in biodefense. I have many friends within the biodefense sector, have worked in there for years, have secret clearance from the Department of Defense, have been involved in virtually every major biodefense vaccine product that has been developed for the U.S. military. But I destroyed, again, my consulting business by speaking out about what I was observing, particularly about the bioethics of the mandates, the coercion and enticement that occurred. And since then, I've had to find some way to make a living. And the way that I make a living as a licensed physician is to publish a Substack essay once a day, day after day after day, year after year after year. And as I said, every Friday and every Sunday, my wife and one of our associates pulls together memes from the prior week, assembles them around topic areas, and publishes them. Unfortunately, the morning, and your initial statements conflated this, the timeline. The morning of Friday, when this unfortunate event occurred at the CDC, we published one of the memes of many, including one that referenced you and your attacks on Janine Piero, accusing her of being a conspiracy theorist. But in that collection of memes, there was one that used a metaphor for random chance with severe outcomes. That metaphor was Russian roulette. Russian roulette is a metaphor. It is just like any form of roulette, only it has a very severe outcome. And that particular meme meant to make a point that when you have a random event with a severe outcome, it can appear statistically to be inconsequential, but in fact it has a major impact. Hence the chamber with one bullet in a revolver and the statement that 5 out of 6 would agree that Russian roulette is safe. It is a metaphor. It is not a violent indication. It had no indication of any weapon being pointed at anybody. Then on the following Sunday, after the event that occurred approximately 5 p.m. at the CDC, and I concur with you and have expressed as a member of the ACIP to CDC my deep regret about what transpired. But the following Sunday, 2 of the memes in the collection referenced Elizabeth Warren's statement that one doesn't need 20 rounds to be a hunter. If you need 20 rounds, you're not a good hunter. And that provoked a lot of response from Second Amendment supporters. And 2 of those responses we happened to collect and post together. One of them specifically referenced the senator and made a statement, the meme went, well, she's saying if you need 20 rounds to be a hunter, you're not a very good hunter. And the response was, if you need to disarm the population, then you're not a very good governor. The other one was the one that you've posted. I don't believe that's an automatic weapon, but I'm not a specialist. I don't actually own any guns except for a couple pellet guns that I used to kill rodents on my horse farm in Central Virginia, about 10 miles from the former home of James Madison that was cited earlier as a strong supporter of an armed populace and the Second Amendment. But I'm not a gun nut. I don't carry guns. The meme was referring to the senator's facetious statement, and it was poking fun back at her And I think most would agree that humor is a very effective way to resolve tension and to discuss sensitive political topics. And our Friday Funnies and Sunday Strip are probably what is paying most of the bills now and allowing me to buy hay for my horses, because my audience really enjoys them. That's all they were, was meme collections, humor, by the way, free speech, and none of those were ones that we originated, by the way. And none of them had anything to do with inciting violence. You made a statement earlier that I have advocated violence against scientists. I object to that. I haven't advocated violence for anybody. And those memes do not advocate violence. The first one refers to basically a quirk in statistics, and the second one refers to a political statement from Senator Elizabeth Warren, which was intended on her part to be humorous, and the responses were also intended as humor. Thank you for allowing me to comment on your, let's say, and by the way, I think you also said on MSNBC that I was unqualified to serve on the ACIP. When I heard that, it was brought to my attention moments after you said it, I called up your office and I said, you know, the senator probably has never read my CV. Can I come in and talk to one of your staff at your office and go over this, thinking that there must be a misunderstanding? And I was given the number, the contact information, email, to set up a meeting with one of your staffers. And I would have been glad to drive up here from my farm in Central Virginia and meet with one of your staffers, go over my CV, and discuss your concerns. Unfortunately, they never got back to me. So for me, by the way, Senator Blumenthal, I used to be a registered Democrat. I grew up in the Central Coast of California. What I've observed during the Biden administration completely turned me around, like many people, like Sasha Stone, like many people in this audience. Regarding the statements that were made earlier by the young doctor, in which he cited a tweet that I put out. Actually, my wife reprimanded me. She thought that was a little too edgy, where I commented on Anthony Fauci seeking refuge in Siena, Italy. Now, how do I know about that? Because I go to Italy a lot, and I was approached by two whistleblowers, including one from the Policemen's Union, that has been tracking Anthony Fauci's movements within Italy, and told me about a number of things that he has been doing and asked me to get that information back to the government. So I was aware of his movements in Italy, hence the comment. And regarding my comment about Lena Wen and the former director of the CDC, the former director has repeatedly lied to the American public. And then after resignation, or whatever we want to call it, has gone completely silent. Not be heard of, no testimony, no request for forgiveness, no acknowledgement of those lies. And more about those lies, I suspect, may come out soon. I speculate, because I'm not able to speak about what we know at the ACIP. Regarding Lena Wen, she made a series of statements about what is essentially violence that she believed should be done to the unvaccinated during COVID. I'd like Lena Wen to apologize. I'd like to know where Lena Wen is. I'd like to know what she's doing right now. Not because I want to cause her any violence or harm, but I'd like her to be held accountable. I'd like both of them to be asked, why did you say these things during this crucial time? These things that caused so much pain, that caused so much harm, that was so divisive, that politicized public health during the COVID crisis unnecessarily. Why did you say those things? Do you regret them now? Do you have any sense of what you did? That's why I'd like to know where they are. I'd like to have them stand up and acknowledge to the American public that they did wrong. Thank you for the opportunity to speak and to address these comments, and I'm glad to respond to any question you happen to want to ask Senator Blumenthal, recognizing that I am under oath.
Dr. Malone, Senator Blumenthal, you have any questions?
Just a couple of questions. I just want to make sure I have the facts right here. First of all, let me say I was unaware that you called my office. If you want to sit down, I'd be happy to do so.
And I'm glad to do so anytime. Thank you.
Second, you're a member of the Advisory Committee on Immunization Practices in the CDC, correct?
Correct, sir.
You were appointed by Secretary Kennedy after he fired all 17 of the previous members, correct?
Which I had no role in doing.
My view, tell me if I'm wrong, is the Advisory Committee on Immunization Practices, also known as ASAP, is a position of immense public trust.
That's your opinion. Personally, I think the ASIP is a federal FACA committee which should be immune from intimidation and which has had mission creep. That's my opinion. I think that this committee and the sense of importance attributed to this committee is grossly overplayed. The committee's role is...
The committee has responsibility for deciding...
No, it doesn't. The committee has responsibilities for advising the director of the CDC only.
Deciding, in its view, what vaccines should be recommended, and then providing that advice to the secretary or to the CDC, correct?
That is one interpretation. I take a much narrower view of the charter of the ASIP, having had to study it.
Let me just say, I view this committee as one of public trust. I view it as seriously responsible for providing advice to the secretary, and that's the reason why he wanted you there. And I have no quarrel with your expressing your views as a matter of First Amendment rights, whether they were intended for humor or some other reason. But in a position of public trust, you have a responsibility to consider the practical effect of your words beyond just your personal consideration. And you may have a First Amendment right to say what you wish, and you do. I would defend that right. But as a matter of a public official in a position of public trust, the posts that you did had consequences.
In your mind.
I'm sorry?
In your mind. You made an interpretation about that. The bulk of
you,
Americans recognize humor.
Your comment is that on the morning of August 8th, hours before a gunman fired 200 rounds at the CDC.
All true.
You put up a post with a gun, and we had it here.
Yes, it was posted. You shared it with us at the beginning of the meeting.
And that's a pretty threatening post, I would say.
If you believe that's threatening, then clearly you haven't watched Netflix. We are constantly bombarded by violent images. They are part of our culture. That is not a threatening post, in my opinion.
And unfortunately, we are also all too commonly experiencing gun violence in this country, which
and that's a fascinating point because of the linkage between gun violence and certain medications.
Which does not condone any person in a position of public trust doing something that could in some way normalize it or make it okay. Let me just ask you.
So you infer that that normalizes gun violence, that post about random chance.
So we're going to have.
Let me just,
we're going to have a
Mr.
vote.
Chairman, I want to
let's wrap
finish
this up.
because here I'll end it with this question.
Wrap it up.
48 hours after that gunman killed a police officer guarding the CDC, as a member of the Advisory Committee on Immunization Practices for the CDC, you posted that second one here.
Together with another one that made it very clear that both were about Elizabeth Warren's statement, which is the one at the top of that meme.
So my question to you, Dr. Malone, is, as a member of that advisory committee to the CDC, did you think about how the dedicated employees of the CDC, the scientists and researchers and public health advocates, would take that kind of post, given that they had just been through one of the most traumatic experiences of their lifetime? Their building under lockdown because there was an armed gunman firing at them and killing a police officer. Did you consider how they would react?
And Senator Blumenthal, I'm under oath. And the truth is, no, I didn't. I had to go feed the horses, take care of the farm. My wife put together the memes. I looked through them, and I said, go ahead and post it. Now, in terms of the traumatization of CDC members, they live in Atlanta. I used to live in North Atlanta.
Do you regret-
Gunfire is normal in Atlanta. It happens all the time.
Don't you regret those posts?
I don't.
I have no further questions.
Okay, thank you. Probably wouldn't have even noticed if you wouldn't have blown it out of proportion. But anyway, the record for this hearing will remain open for 15 days until Wednesday, September 24th, 2025 at 5 p.m. For the submission of statements and questions for the record, this hearing is adjourned.
There's 1,065 papers in the peer-reviewed literature on COVID vaccine myocarditis. So let me summarize them for you. The first one that came on my radar screen that was alarming came from Washington University in St. Louis, August 18th of 2021. The first author is Verma and colleagues, New England Journal of Medicine. 42-year-old man comes into Washington University Hospital with vaccine myocarditis. The infection's ruled out. It's the vaccine. He's in the hospital. This is one of our best hospitals in the United States. He dies 3 days after taking Moderna. They can't save him in the hospital.
Say, Dr. McCullough, move the microphone just a little bit away from you.
Then one was reported from Korea by Choi and colleagues. This is now a younger man. Just a few days after Pfizer, he comes in the hospital. He dies within 8 hours of being in the hospital. I can tell you, I'm a cardiologist. That doesn't even happen with heart attacks. He dies within 8 hours. I examined all of the slides and the images that the Koreans had showed us. It looked like somebody took a blowtorch to that heart. It was so completely fried with inflammation. His heart was destroyed. These cases, which were widely known at the time, should have gotten everyone's attention. Everyone should have been laser focused on this. We should never have someone die after taking a vaccine. That's directly caused to the vaccine. Then Gill and colleagues, Connecticut, published in Archives of Pathology, 2 boys, aged 16 and 17, who die a few days after taking Pfizer. These are teenagers. They're found dead at home by their parents. They're absolutely horrified. They request an autopsy. They call in University of Michigan and University of Minnesota to look over what are they finding at autopsy. Conclusion, it's Pfizer COVID-19 vaccine myocarditis, unequivocal. These are autopsy-confirmed cases. So for all the mothers in the room, how would they feel
if they found their children dead after taking a COVID-19 vaccine. This is in the peer-reviewed literature. This is not misinformation. Everyone should be paying attention to this. This is not conjecture. This is in the peer-reviewed literature. So we started to ask ourselves, what is going on? Turns out that Pfizer and Moderna and Janssen are the genetic code for the spike protein. The spike protein is the damaging part of the virus. The spike protein is loaded into the body and it causes tremendous damage in some. Acute myocarditis appears to have some genetic predilection, and all of the vials of the vaccine are not the same. But I can tell you, I'm concerned that until the vaccines are stopped, there will be cases of acute myocarditis. And to finish, we've had 216 vaccine deaths this year alone. So if the vaccine campaign continues, we have to look at what are we getting out of it now, 4.5 years of the campaign, and how many more people will die. I'm Dr. Peter McCullough. Thank you for listening.
Thank you, Dr. McCullough. Our next witness is Dr. Jordan Vaughn. Dr. Vaughn is a physician and clinical researcher in Birmingham, Alabama. As owner and CEO of MedHelp Clinics, Dr. Vaughn has directed his organization to the leading edge of early outpatient treatment of COVID-19 for his patients and greater Birmingham community. Dr. Vaughn has treated over 4,000 long COVID and COVID vaccine injured patients. Dr. Vaughn.
Thank you. Chairman Johnson and Ranking Member Blumenthal, thank you for having me. I'm going to dovetail a little bit off what Dr. McCullough said. And one of the things that, as a clinician who also had about 200 people working for him and actually seeing about 170,000 patients a year, when COVID came along, I had to really figure out how to not only help my staff and make sure they're safe, but also help the patients that my organization was responsible for. And that really made me dive into understanding the pathology. And what I came away with was understanding that the spike protein, the S1 subunit specifically, is not a benign protein. It triggers inflammation, it disrupts endothelial barriers, it induces fibrin resistant to breakdown, and it promotes a lot of amyloid aggregates, which is what I research. These effects impair oxygen delivery, damage blood vessels, contribute to clotting pathologies that manifest with a lot of the symptoms that we're seeing in the long COVID and vaccine injured, which to this day is a huge amount of people. We're talking upwards of 10 to 15 million people in America that are being affected by the consequences of COVID in the long form or vaccine injury. And the typical symptoms are things like heart racing, brain fog, shortness of breath, and post-exertional malaise. In my clinic, I actually use immunofluorescent microscopy to be able to actually see what's going on in the blood and look for these amyloid aggregates. Some as young as teenagers that are unable to stand. Others are previously active adults suffering small strokes without typical identifiable causes. These are not abstract theories. They're the lived realities of my patients in Alabama and beyond. The mRNA injection, heralded as a solution, introduced a novel mechanism, lipid nanoparticles delivering modified mRNA that instructs the cells to produce a stabilized spike protein. Unlike traditional vaccines, this approach resulted in uncontrolled production of the spike protein for an unknown duration and distributes it widely across organs, including the heart, brain, and vasculature, and ovaries and testes. The actual EMA, their assessment of Comirnaty, which is Pfizer's vaccine, noted biodistribution beyond the injection site, contradicting claims that the vaccine stays in the arm. And a recent groundbreaking study using single-cell precision nanocarrier identification revealed LNP accumulation in the heart tissue of mice with adverse proteomic changes in immune and vascular proteins, raising concerns about the cardiac complications that dovetail with what we were seeing when we were looking at the COVID-19 vaccine myocarditis. I will tell my first encounter with a vaccine injury came in winter of 2021. 69-year-old man from Alabama presented with unexplained shortness of breath. He was a patient of mine. He really had no other reason that he had this shortness of breath. And after the second Pfizer dose, he actually had significant shortness of breath, I couldn't figure it out in a sense because it would typically be that he had a pulmonary embolism, but empirical anticoagulation and antiplatelet therapy brought rapid improvement. This case prompted deeper investigation that the spike protein's ability to induce fibrin that's resistant to breakdown, activate platelets irreversibly, and damage the inside of our vessels that run to every part of our body and every organ, explained his symptoms and those of thousands more since. I have treated approximately 4,000 patients suffering from long COVID and vaccine injury, or both. Many were young and previously healthy. For those with vaccine injury, trust in public institutions has been shattered. Many were coerced under the August 2021 federal mandates, despite legitimate hesitations due to prior infection or personal health risks. They knew their body better than the agencies. Now disabled, they are dismissed or ignored by the systems that mandated their compliance. The myocarditis signal was also a big thing. This spring of 2021, a clear safety signal emerged. Myocarditis in young males linked to mRNA vaccines. The Department of Defense confirmed cases of rare heart inflammation, and peer-reviewed studies later detected circulating spike protein in post-vaccine myocarditis cases. Autopsy findings have confirmed fatal vaccine-induced myocarditis. Yet federal authorities accelerated licensing and mandates, sidelining concerns. The CDC's hesitation to issue a health alert on myocarditis, and the FDA's former CBER director promoting vaccines on social media crossed a line from oversight to advocacy. This was not regulation, it was endorsement. Informed consent is the foundation of a patient-physician relationship. Absent the regulators providing that information, that relationship is irreparably harmed, and the practice of medicine will continue to suffer. In closing, I urge you to stop blindly following the science. Science does not lead anywhere. It is an observer, measurer, and descriptor. It must inform leadership, not replace it. When leaders hide behind the science to justify policy, they abdicate responsibility. We need leadership that humbly engages with data, listens to patients, and actually acts with courage. Thank you. I welcome your questions.
Thank you, Dr. Vaughn. Next witness is Dr. James Thorpe. Dr. Thorpe is a board-certified obstetrician gynecologist and maternal fetal medicine specialist with over 44 years of clinical experience. As U.S. veteran and widely published physician, he has testified internationally, served as a journal peer reviewer, board member of the Society for Maternal Fetal Medicine, and examiner for the American Board of Obstetrics and Gynecology. Dr. Thorpe.
Thank you, Mr. Chairman and members of the committee. My patients, I focus on the most vulnerable patients, pregnant women and preborn. It is difficult to conceive of a more egregious breach of medical ethics by the government-controlled medical industrial complex than the promotion of COVID-19 vaccines to pregnant women, thereby, through transplacental transfer, effectively vaccinating their unborn and newborn children. This campaign was not accidental. It was calculated. Pregnant women were targeted deliberately for two reasons. First, women are the primary decision makers of healthcare across the human lifespan, a known marketing principle. Number two, pregnant women are the most vulnerable patients. If they could be convinced that the vaccine was safe and effective, it would imply that it was safe and effective for everyone. From the outset of the pandemic, this vaccine campaign was never grounded in biological science, but rather in behavioral science, specifically the manipulation of public perception through influence, fear, and persuasion. The federal government outsourced much of this psychological operations to NGOs which disseminated emotionally charged and misleading messaging. These entities falsely assured pregnant women that the vaccines were proven safe and essential for maternal and fetal newborn health, despite the fact that early evidence indicated quite the opposite. Pregnancy itself was protective against COVID-19 maternal mortality. Dr. Jay Winston, an initiative director at Harvard School of Public Health, described the government's vaccine marketing approach in a 2020 CBS News interview. He explained that the strategy was to, quote, go for the low-hanging fruit, those easiest to pick and harvest, end quote. And the fruit, in quotes, tragically, were pregnant women. Only This deception was institutionalized in the now infamous Shimabukuro study published on April 21, 2021 in the digital version of the New England Journal of Medicine. 21 authors claimed the miscarriage rate was 12.6%, but the raw data revealed an 82% miscarriage rate in women vaccinated during the first trimester. This figure mirrors the effects of chemical abortion drugs such as RU-486. Also, in the same journal edition, on the same day, an op-ed appeared by CDC Director Rochelle Walensky and Journal Editor-in-Chief Eric Rubin. These publications were riddled with conflicts of interest and deliberate misrepresentations intended to coerce pregnant women into taking vaccines. Subsequent studies have also claimed that COVID-19 vaccines are safe and effective during pregnancy and have been rebuked by respected researchers. These publications are fundamentally compromised by serious conflicts of interest, ranging from biased funding sources and institutional mandates, and even threats to their medical licenses and board certifications. Between 2020 and 2022, pharmaceutical companies paid $1.06 billion to reviewers at leading medical journals, the New England Journal of Medicine, JAMA, Lancet, and BMJ, thus corrupting the peer review process. At least 6 existing studies, 3 from CDC, FDA, and 2 from Pfizer, revealed major breaches in safety signals for COVID-19 vaccines and pregnancy. These findings were ignored. Conversely, countless independent researchers with no conflicts of interest published findings that contradicted the false narratives and the pharmaceutical industry narratives, only to be rewarded by persecution, censorship, and threats to their medical licenses and board certifications. This is not hypothetical. It happened to me. On February 8, 2025, our team of researchers published a peer-reviewed study in Science, Public Health Policy, and the Law. We identified 37 adverse pregnancy outcomes significantly associated with COVID-19 vaccine, including miscarriage, stillbirth, birth defects, cervical insufficiency, premature rupture of membranes, preterm birth, and death of the newborn. Lin and colleagues in a major journal publication documented that the COVID-19 vaccine traverses the placenta, enters the fetal blood, and bioactively produces spike protein in the placenta and the lining of the uterus. Recently, animal studies revealed the mRNA COVID vaccine causes the destruction of 60% of the ovarian reserve in rats. This catastrophic public health failure was financed with taxpayer dollars and channeled through federal agencies to medical gatekeepers such as the American College of Obstetricians and Gynecologists, ACOG, the American Board of Obstetrics and Gynecology, ABOG, and the Society for Maternal Fetal Medicine, SMFM. These organizations have abandoned their ethics and responsibilities to physicians and patients and must be held accountable. I urge the government to immediately halt all funding to these entities and to end every promotional campaign that coerces or recommends experimental mRNA therapies to pregnant women. This must stop now. Thank you.
Thank you, Dr. Thorpe. Our next witness is Dr. Joel Walskog. Dr. Walskog is an orthopedic surgeon originally from Wisconsin. He experienced an adverse event after his Moderna COVID-19 injection that he received on December 30th, 2020. He has subsequently been diagnosed with transverse myelitis, an unspecified autoimmune disorder, and autonomic dysfunction. He is medically retired. He is now co-chairman of REACT 19. Dr. Walskog.
Thank you, Senator Johnson, Senator Blumenthal, and the subcommittee for inviting me to testify on the development and safety of the COVID-19 vaccines. I am Joel Walskog, a board-certified orthopedic surgeon, now medically disabled after 1 dose of the Moderna COVID-19 vaccine. Before the pandemic, I enjoyed a successful practice in Wisconsin, performing over 800 major surgeries annually. Trusting my health authorities, my practice followed CDC COVID-19 guidelines, delaying surgeries and even temporarily closing. I proudly elected to get vaccinated, and within a week, I developed leg weakness, numbness, substantial balance loss, leading to falls, including one while treating a patient. Diagnosed with transverse myelitis, a spinal cord lesion at T8, T9, I was stunned that my providers dismissed any vaccine link, despite news of similar cases halting the AstraZeneca trial in the UK. 4 years later, while I can walk, I have been diagnosed with dysautonomia and an undefined autoimmune disorder, both debilitating conditions affecting multiple body systems. I remain medically retired. The career I loved and worked so hard for is now gone. In 2021, federal health agencies assured Americans that the COVID-19 vaccine trials were rigorous and closely monitored with rigorous post-marketing surveillance. They also claimed a robust safety net that would handle what they said were rare and mostly mild injuries with monitoring, follow-up, and financial aid. After my own vaccine injury, I learned the hard way that nothing could be farther from the truth. In my own battle to restore my health, I could not find a single reliable source of information from the CDC, from the FDA, or the NIH. Further, answers did not come from medical teams, the media, or even medical journals. Rather, the answers were being pieced together by tens of thousands of vaccine-injured patients, huddled together in social media-based support groups who are constantly fighting for their right to simply exist. You will hear today a great deal about myocarditis, maternal-fetal complications, and blood clotting disorders after the COVID-19 shots. I hope to talk more about the neurological adverse events to the COVID vaccines. These are the most common adverse event to the COVID shots. I am now co-chair of React 19, which is a national, science-based, non-political, nonprofit that represents over 36,000 Americans seriously injured by the COVID-19 shots. Our mission is to provide financial, physical, and emotional support. This gives me a unique perspective to share the collective experience of those who have been harmed, not just by the COVID-19 vaccines themselves, but also by the U.S. government. React 19 surveyed our 36,000 members, asking if the FDA takes vaccine injuries seriously. 100% said false. Not even one person voted favorably. The vaccine injured share a uniform story. We did our duty for our country, became injured, disabled, or died. We further reported to VAERS and vSafe, repeatedly contacted our elected officials and applied to the Countermeasures Injury Compensation Program, or CICP, only to face silence from the VAERS, no response from vSafe, ghosting by our own representatives, and a 98% rejection rate from the CICP. The many cries for help were ignored. Some were studied at the NIH in a program under Dr. Fauci, where they were diagnosed with vaccine complications, but never disclosed to the public, despite promises that the NIH would do so. Privately, the agencies said neurological conditions needed early recognition and treatment, while publicly they remained silent and often denying that they were even treating vaccine injuries. Rather, they promoted boosters and high safety claims, while the White House directed social media to censor, quote, true stories of vaccine injury, end quote. Relegating NIH confirmed injuries into silence. That silence by health authorities, elected representatives, and even our White House has resulted in even more severe health outcomes and worse for many, death. The PrEP Act shields drug companies from injury liability and strips Americans of their constitutional right to due process and jury trial. This liability shield places the responsibility squarely on the U.S. government to address this crisis. Our constitutional rights must be replaced with effective safety monitoring and compensation. Today, these programs are dismal failures. Congress must urgently reform these failing systems or remove itself as a middleman and repeal the PrEP Act. An analysis of clinical trial data showed that for every 800 people vaccinated, one suffers a serious adverse event. We are here today to end the silence for the 1 in 800. It is time to stop politicizing vaccine injuries and start building meaningful recognition, research, competent care, and fair and just compensation. At React 19, we say we've had negative reactions, but we're about seeking positive actions. I will not stop until these humanitarian goals are met. Thank you.
Thank you, Dr. Walscock. Our next witness is Mr. Aaron Seary. Ms. Seary is the managing partner of Seary and Glimstad with over 85 professionals. He has handled numerous high-profile cases involving challenges to medical mandates, restoring exemptions, agency transparency, including forcing FDA to release the COVID-19 vaccine licensure documents, and deposing immunologists, infectious disease doctors, and vaccinologists. Mr. Seary.
Good afternoon. Thank you. Our vaccine practice, I believe, which has over 40 professionals, it doesn't represent pharmaceutical companies, I believe is the largest vaccine practice in the world. When we litigate vaccine cases, we cannot rely on credentials or fancy titles. We have to prove our claims with high-impact data and sources. For example, I saw a slide put up that showed 3 million lives were saved from COVID-19 vaccines. The citation to it was to the Commonwealth Fund. If you follow that, that's not a peer-reviewed study. That's a blog. It's a blog that used a mathematical model to calculate that 3 million lives were saved. So I agree with the Senator Blumenthal who said, quote, claims made, I think you meant regarding vaccines, we need to examine the evidence. And that's an example of that. We need to look carefully at the evidence we are relying upon when we are making claims about vaccines. I don't think that if I went into court and I was relying on a blog that used a mathematical model, I would be laughed out of court if I was making those claims about vaccines. But unfortunately, when it comes to promoting vaccines, well, that's what we often see. The underlying data is not typically really carefully evaluated. Claims about what vaccines do when they're positive, because our health agencies are responsible for promoting them, easily made. Claims that vaccines cause any harms or injuries often get ignored no matter how good the underlying data. I also heard that deaths sharply declined in 2021. Well, when you look at all-cause mortality in the United States, deaths in 2021 went up compared to 2020, and presumably most of the most frail, the weak among us died in 2020 from COVID. We should have had a reduction in all-cause mortality in the United States. We did not. And those numbers you can't argue with. They're binary. You're either dead or you're alive. You can argue whether the vaccine killed you or didn't kill you, whether COVID killed you or didn't kill you. But it can't argue with all-cause mortality. And we did not have a reduction in all-cause mortality in 2021. We had an increase. And we really need to answer that question. We have sent many letters to our federal health officials trying to get an answer to that. With that said, not only do we need to carefully study the data and science before we go and litigate our vaccine cases, because again, I don't have a MD or a PhD or an MPH, we also need to understand the economic and regulatory framework around vaccines. And COVID-19 vaccines did not just fall into a vacuum. They fell into a very well-developed regulatory and economic framework for vaccines that has developed over the last 40 years. For every product on the market, you can sue the manufacturer for harm, for design defect claims, meaning the claim that the product could have made safer. I mean, literally, look around this room, planes, cars, pharmaceutical drugs, every one. There's only one product in America. You cannot sue the manufacturer for design defect claim to claim that it could have been made safer, and that are vaccines. I heard, injections, vaccines. My definition of vaccine is any product for which the government needs to give it immunity from harms. To me, that's what a vaccine is, because some prevent infection, some don't. That's what a vaccine is, meaning it can't survive without that immunity, apparently. Why did vaccines get this immunity, which was provided in 1986 under the National Childhood Vaccine Injury Act? Because leading up to 86, there were only 3 routine childhood vaccines, MMR, OPV, and DTP, and they were causing so much harm and causing so much liability that all the manufacturers were going out of business to stop making them. And Congress, instead of forcing those manufacturers to do what every other product manufacturer needs to do in that situation, which is what? Make a better, safer product. Instead said, you know what? We're just going to give you immunity. We're going to make it so nobody can sue you for those harms. And you can keep selling your product to the American public no matter how many children it kills or injures. And the issue is that that immunity was not just given for those 3 products. It was given for any childhood vaccine, routine child vaccine that was developed thereafter. I tell you this not to take issue with childhood vaccines, but to explain to you the regulatory framework in which vaccines have developed over the last 40 years. We have now gone from 3 injections in the first year of life under the CDC Schedule in '86 to 29 injections, including in utero, if a child follows the CDC schedule today. Every one of those vaccines, save one, was developed by a pharmaceutical company knowing they would not be responsible for the injuries that are caused by those products. So when you have drug trials where pharmaceutical companies, they care about losing money, they don't want to lose money on their drugs, they often do multi-year placebo-controlled trials before they get on the market because they don't want to end up upside down. They're there to make money. But with vaccine products, because they don't have that financial incentive, they have actually the disincentive. Almost every childhood vaccine in this country is licensed based on clinical trials with no placebo control, save for COVID-19 vaccine, often days or weeks, up to maybe 6 months of safety review after injection, and are often extremely underpowered. Those trials could never have really confirmed the safety of this product, and my submission to this committee laid out every single vaccine and put them in detail. I will, since I'm running out of time, I'll just wrap up by saying this. You might say, well, okay, the pharmaceutical companies did that, but why would the FDA allow it? It's because, unfortunately, our federal health authorities are hopelessly conflicted. Congress gave them conflicting structural duties. They're responsible for promoting vaccines and for defending them in the Vaccine Compensation Program. And you also ask them to be responsible for safety. Those conflict. One has overtaken the other. And for the most part, based on our over 2,004 requests to federal health agencies over the years on behalf of our client, I could tell you, our federal health agencies act like partners with pharma. They encourage their inroads. They act basically in the shoes of pharma because when the immunity to liability was given to the pharmaceutical companies, Congress recognized that apparently and transferred all the safety functions to HHS and the mandate for safer childhood vaccines. And by doing so, it's made them hopelessly conflicted. That was a very, very quick way to try and convey the regulatory and economic framework into which COVID-19 vaccines fell into, and why, from the pharmaceutical and FDA's perspective, the COVID-19 vaccine clinical trials may have been robust, and they were compared to childhood vaccines, but compared to drugs or anybody that actually wants to assess safety, they absolutely were not robust. They were incredibly anemic. And as for post-licensure, regulators didn't do their jobs, but really they acted like pharmaceutical companies seeking to cover up harms and avoid reputational damage and financial liability. I hope this hearing can help begin the process of changing that. Thank you, and I apologize for going over on my time.
Yep. Thank you, Mr. Siri. Our final witness is Governor and Doctor. I've always found senators like to be called doctor, if they are one. So Governor and Dr. Josh Green. Governor Green is the 9th governor of Hawaii. He earned his degrees in biology and anthropology from Swarthmore College and an MD from Penn State's College of Medicine. Dr. Green served 2 terms in the Hawaii House of Representatives, 3 terms in the Hawaii State Senate, and a term as lieutenant governor, during which he was the state's point person addressing the COVID pandemic. Dr. Green was elected governor in December 2022. Governor Green.
Thank you, Chair Johnson. Thank you so much for welcoming me. Thank you, Ranking Member Blumenthal. Thank you, Senators. First of all, I'm coming to you as a physician. When I speak as a doctor, I'm here to say that vaccines save lives, period. I care about saving lives. You care about saving lives. Everyone in this room, I believe, cares about saving lives. But I've seen firsthand children dying from the spread of preventable diseases because of vaccine skepticism, because people lose faith. I've seen the lives of some children in one house who are vaccinated live, while children in the house next door who have not been vaccinated die. And we saw a lot of this during COVID. I want to tell you a little bit about my COVID experience as the COVID liaison in my state, a state of 1.4 million people. And let me preface this by saying we worked very closely with President Trump and his team. And then subsequently, as Lieutenant Governor, I was able to work very closely with President Biden and his team, and I appreciate them both. I appreciate that President Trump, using Operation Warp Speed, got us a vaccination in an extraordinary time. We were desperate as healthcare providers. I worked as an emergency room physician virtually every single weekend for 20 plus years, including through the whole pandemic. And this is what I saw. I saw people dying of terrible disease when they caught the Delta variant of COVID especially. I saw people recover better when they had been vaccinated. In Hawaii, we had the lowest mortality rate in the country. We had the highest vaccination rate in the country. People have asked me in the course of the prep for this hearing, well, is Hawaii safer because it's a tropical island state? No, actually, it's quite the contrary. We had COVID coming from east in Asia, where it originated, and west, travelers from the mainland. But we put together programs based on science. Day by day, I counted case after case after case because there was so much uncertainty. And I was able to share in our state where we had infectious disease doctors, where we had extra need for ventilators, where we had extra need for vaccinations, where the rates were lower. And day by day, working with all the healthcare providers in my state and listening to others, not mandating. I'm not a mandate guy. That may come as a surprise to some today. We were able to make sure that we had a science-based response. We put together a safe travels program which tested anyone coming into the islands so that they wouldn't travel or that they would isolate or quarantine if they were positive so they wouldn't spread the disease. And over time, we had the experience that no one else had. We saw death rates constantly lower than all the other states with the single exception of Vermont on occasion. I tell you this because we have to follow science, and I truly believe that we can't politicize science or vaccinations or any of these public health matters, and it's very important going forward. This is where we should unite with one another. We should heal our country together in this space. Now, another experience I had, measles. I was the doctor that was asked to go to Samoa when they had their outbreak of measles. Why did they have their outbreak? Because they lost faith in the vaccination program, and it was tragic. The Children's Health Defense went there and they scared people. After tragedy, admittedly, it should have never happened. I had children die in my arms who were not vaccinated but died of measles. This beautiful boy was with me and a pediatrician. Dr. Nadine Tansala had a terrible case of the measles, and some of his relatives passed away from the disease. But we went there and we vaccinated 37,000 individuals in 48 hours, and the measles just stopped. And I say this because this is what we have to look forward to in the future if we somehow fall into a place where we don't believe in vaccinations any longer. And we shouldn't do it blindly. We should study them. We should check for safety. Absolutely, that is essential in science. But these vaccinations save lives. They saved many lives during COVID. In my state, they saved over 10,000 lives. We anticipated mass casualties, which we never saw because we fought this disease with great intelligence and great acumen. I will tell you this. There are lots of things to share today. Protests resonated through the COVID experience in my state. People protested at my home, around my family. But the leader of the protests ultimately, after I was worried that he would catch COVID, did exactly that. Ended up in grave, grave peril. His wife was in the intensive care unit. His name was Witkoff. He later disavowed the protests against the vaccinations after seeing individual after individual after individual be intubated and go into the ICU because he experienced it. And that's what we as physicians see too often. Once a tragedy occurs, and my heart is with everyone who had any kind of reaction to the vaccines that we're talking about or loses a loved one. Of course, we love our fellow mankind, but we cannot turn away from science. So these are some of the things I wanted to share with you today. Ultimately, we have to decide whether we're going to be committed to public health in our country. And right now, we are in great peril. It is absolutely my firm belief that vaccines have saved millions of lives over the last 50 years, 150 million by many people's accounts. It's decreased infant mortality by 40% globally. And we have to continue to commit ourselves in this way. So I'm concerned. I'm concerned that as we end up in a politicized discussion, that we will move away from science. We will not trust one another, experts. We will not trust one another, and we will end up in conflict. So what I would say is this. Let's work together. Let's find a way to actually find the common ground to protect our children. Let's find a way to make sure our public health system remains intact, not taken apart by the current approach where HHS is jettisoning many of its people, many of the billions of dollars, perhaps many of the vaccinations. This is our opportunity to come together, and I'm sure we'll talk more about this as the hearing goes on, but I'll say one last time. Vaccines save lives. I've given vaccines, I've taken vaccines, I've treated people that didn't get vaccines, and it's broken my heart when they've passed away.
Thank you, Governor Green. Quick comment. I'm not aware anybody on my side of this issue has politicized it. The accusation is always that we're not. You did state, by the way, 10,000 lives saved in Hawaii. I would love to have your citation on that, so if you can give us a study so we can put that in the record. And any other citation, give us on the millions of lives saved by vaccines as well. I mean, again, I want to know the truth. Just real quick, I've got a couple other charts I want to put up there. This is a chart, a lot of people produced it.
Chairman, if I could just interrupt for 10 seconds over here.
Sure.
Is today's, just a point of order, are we talking about vaccines or are we talking about the COVID vaccine?
Well, specifically, we were talking about the hiding of the safety signal on myocarditis.
So we're not talking about all vaccines?
We can talk about anything you want to.
Okay.
I mean, again, it has obviously opened up because we're also talking about the corruption of science. And I think science has been corrupted. So fair game. So, and again, I appreciate you staying here and stick around and ask a lot of questions. I think you'll learn an awful lot. Put my time back on the clock. No, I'll take whatever I want. This is a chart. This is a chart. Again, I was looking at the VAERS. You know, I had been.
Mr. Chairman, that's not the way I ran this subcommittee.
I had been. Well, this is a different. Again, I'll be very generous. Okay. I was actually instructed as a non-doctor what the COVID injections were. Encapsulated lipid nanoparticle that was designed to permeate difficult to permeate barriers. So they lied to us when they said they'd stay in the arm. They knew it wouldn't. They had a study. The Japanese regulators uncovered that when they did do a biodistribution study in rats, it distributed all over the body. So that was the first lie. Didn't really talk about too much about the toxicity yet of the lipid nanoparticle, but it goes all over the body. So I was aware, and again, that this was not a standard vaccine. This isn't a attenuated or dead virus that the body reacts to. This actually hijacks the cell, has the cell produce the spike protein, which is toxic to the body, which means the body attacks it. Again, I'm a layman, but it's pretty simple for me to understand this. So I was aware of this like in October. So I'm watching VAERS, and so I'm publishing these charts, and I'm being censored. I see the next chart, chart number 2. This is the full history of VAERS and the number of deaths being reported associated with the vaccine. You got a couple hundred a year until 2021, and yikes, 21,725 deaths worldwide. Why? And everybody's saying, "No, this is safe and effective." The vaccine injured were being gaslit. They weren't being treated. They're still being gaslit. There is no, by the way, there is no compassion, Governor. I could fill this room with photos of people who are dead because of the COVID injection. I could fill the room. And that is being denied. That is being denied. It is being denied, and these people haven't been able to get help. I held an event in Milwaukee in June 2019 and 2021, and all the vaccine injured, those women, all they wanted was to be seen and heard and believed, and they are not to this day. Okay? So again, they're not the ones politicizing. They just want to be helped. They want compassionate doctors to treat them, to recognize what caused their illness, not gaslight and not deny that it exists. But anyway, so you take a look at this chart, and they're still denying that this, nothing to see here. This is safe and this is effective. Okay? Next chart. This is the current VAERS chart. 38,607 deaths reported worldwide associated with the COVID injection. And we know VAERS dramatically understates, by a factor of 10, 100? We know it understates it. 9,228 of those deaths are occurring on the day of vaccination or the 1 or 2 days. Okay, I know VAERS doesn't prove causation, but man, that's a correlation we should have been looking at, but they ignored and they censored. But enough of that. Dr. McCulloch, please, in my layman's terms, I just kind of laid out the harmful mechanisms of this injection. Can you and Dr. Vaughn, because I think you've both spoken to this, again, in layman's terms, talk about why this caused so much harm in so many different ways because of the biodistribution. Dr. McCulloch.
80% of Americans took a vaccine. 20% didn't. 20% did not take a vaccine. The vaccine was never safe enough for me to take. Messenger RNA, devised by Pfizer and Moderna, has been chemically modified to be unassailable to enzymes in the body to be broken down. The messenger RNA is found in the human heart of people who die after the vaccine. It's found in the brain. The spike protein is found everywhere in the body. 3 studies now show the spike protein is circulating in the blood for 6 to 9 months after people take the shot. This part of the virus, the lethal part of the virus in the vaccinated, it's circulating in the blood. And then they take a booster, they get more circulating in the blood. It is a killer protein. It cannot be safe. It was not safe by design. Safety trumps efficacy. We cannot tolerate false drug claims. And we saw a poster behind Senator Blumenthal making a false drug claim that vaccines saved millions of lives, specifically the COVID vaccine. Well, let's take a look at that. When someone signs consent for a vaccine, Senator Blumenthal, does the consent form say it's going to save their lives? Of course it doesn't. It's not on the FAQ. There's never been a prospective, randomized, double-blind, placebo-controlled trial ever showing that COVID-19 vaccines reduce mortality or hospitalization. There's not even a valid non-randomized study. Thankfully, COVID mortality went down for 3 reasons. Because we all got the infection, vaccinated and unvaccinated, so we developed population natural immunity. We developed early treatment. Credit to Operation Warp Speed. We used all the Operation Warp Speed tools, additional drugs. We treated patients with multi-drug protocols at home so they don't go to the ER. So Governor Green never saw the patients we treated because they were successfully treated at home. And the third reason is that the virus mutated to a much milder form. Those things happen concurrently with rollout of the vaccine. The vaccine cannot be falsely credited with saving millions of lives. We can't allow false drug advertising to be put up on a poster behind one of our public servants. We cannot accept that.
So let me quick. And I will have a lot more. I will have a lot more questions. Put up my last that optional chart number 4 here, because I think this is something I developed September 2021, and this shows the number of daily cases of COVID, and you see it's peaking in January. Right as we're rolling out the vaccine, but we really haven't injected it with anybody. If by the time we had any kind of significant uptake of the vaccines, we were way down in terms of the number of daily cases. I mean, this virus was burning itself out. Okay, now we had different variants. Again, I've read a lot of information about vaccination into the midst of a pandemic driving variants. Is that what happened? I don't know. But you would think if a vaccine were that effective, the tail would just continue and the pandemic would be over. But that's not what happened. We had a whole new surge, and this is Delta, and doctors I've talked to, a very deadly, probably a more deadly. Would you agree with that, Dr. McCulloch? Delta was a more deadly. I know you guys are kind of freaking out that your early treatment wasn't working as well.
It was definitely more difficult to treat. But fortunately, by that time, we had treatments.
But anyway, I just wanted to put this thing up here. Again, to a layman, if the vaccine really worked, was that efficacious, prevent all that disease? By the way, they all admitted that it didn't prevent transmission. They lied to us about that for 4 months, if maybe a year. Then they finally had to admit it didn't prevent transmission. But again, this chart right here just shows you that if the vaccine really would have worked, you wouldn't have had this. You wouldn't have had this. But I'll turn it over to Senator Blumenthal.
Thanks, Mr. Chairman. And I think we'll try to certainly stay within our 7 minutes so our colleagues can have their day of questioning.
But again, we'll have second, third, fourth rounds. I mean, we'll use up the time of this hearing room.
The debate here seems to be about the efficacy of COVID-19. But the central issue that brings us here today is the allegation that there was purposeful concealment of knowledge and evidence. And I just want to make the point, I may be sounding a little bit like a lawyer, not a physician, but purposeful concealment, intentional hiding is essentially undocumented by the evidence released by this report itself. In fact, the documents released by the majority today show that public health officials took multiple steps in the spring of 2021 to make healthcare providers aware of those rare reports of myocarditis among vaccine recipients. On May 14th, almost 2 weeks before the CDC decided to issue clinical considerations rather than a HAN on myocarditis, which is, by the way, the primary piece of evidence that the majority cites in this so-called cover-up. The CDC's National Center of Immunization and Respiratory Disease sent an email to state and local health departments around the country entitled, quote, "Monitoring Reports of Myocarditis," end quote. The email noted risks and contained a reminder that providers were obligated to report cases. 5 days later, they sent out a follow-up email urging recipients to let providers in their region know of risks and reminding them once again of the obligation to report cases. I have 2 emails here that are in the majority report. They're available to the public. I ask that they be made a part of the record, Mr. Chairman.
Objection?
I'm not going to read them. They're for everyone to see. One begins with, "I would like to flag a message we sent out late Friday night. I encourage you to forward this important message about vaccine safety and reporting," and it goes on. Warnings. Far from a cover-up, these public health officials were trying to alert scientists, doctors, the public about the potential side effects. Mr. Siri and I are both trial lawyers, and issuing that kind of warning is far from evidence of trying to hide or conceal something. You can say they were wrong somehow, but intentional cover-up is not within the realm of the plausible allegations here. So I think we need to be really clear and careful when we start discrediting scientists or public health officials. I'd like to ask Governor Green, can you tell us how, as a physician, publicly funded research, which is being cut by this administration, is important to establish not only new vaccines, but also the safety and efficacy of ongoing use of vaccines?
Thank you, Senator. So as governors, we rely on funding to do so many things from the federal government, and cuts to research will be devastating. You can't just simply pause research and wait until a different ideology resumes governing, or until we get through these hearings and we restart critical research projects. We will lose ground on this science and the science that benefits from it, the R&D that goes forward. We've all been very supportive for decades of advanced scientific research. Sometimes it happens through the military, sometimes through our universities. We are in deep trouble if we stop the research component of our commitment to our people. We will also be in grave danger if we don't do the public health assessment in our states, in our rural areas, because we will not even know what we're being affected by. We will be blind to the diseases that roll through our communities, whether it's chronic disease or acute disease from an infection like this. And I just need to address a couple statements that I feel are misconceptions. And I'm not judging. I feel that there is a misconception that the COVID vaccination didn't decrease the severity of disease. That is what it did. It decreased the severity, and I saw this clinically, and we saw this from a public health standpoint. It decreased the severity of what people were facing, so they didn't die, or they died at a much lower rate. And you can see that in the charts that we've seen, but through looking at them through a different lens, the exact same charts. When the death rates dropped because people had begun to develop immunity, because their immune systems were responding to the vaccination. And in fairness, we could debate the language, but even some of the individuals that are also testifying with me here today referred repeatedly to the mRNA vaccination because it was putting these particles into people, and then the immune system was responding to them. And so I do feel that it's a vaccination, but be that as it may, we ultimately saw the ability to stop the severe and deadly cases in our hospitals. And so there are many ways to view vaccinations. There's many ways to view treatments, and they're all valuable. For some, vaccinations straight up stop infection from occurring. That's the case when we talk about measles. Measles, mumps, rubella, when you get that vaccine, you really prevent the spread to a great degree. And it was commented earlier that we were misleading, or we were being misled by others on what the vaccinations were doing and what the information was that was being shared. Well, let me tell you what it was like during that period. And we all saw it. There was a great deal of confusion because the unknown was so enormous. And to the credit of scientists and to the credit of those who invested in the research at, again, extreme speed and extreme dollars, we were able, as a nation and a global community, to find our way to something that helped us. Now, of course, there were some tragic outcomes, and again, not a single case should ever be dismissed, minimized. No one should be impugned. But the grander picture of a vaccination program is to protect all and to find a way to protect people so that they can also help protect the people around them, which is why the research is important, the spending is important, why I'm very concerned about the announcement yesterday that we will only be recommending vaccinations for people over 65 or those with chronic disease, because a couple points. One, first of all, and I'm sure many of you had this experience, the chairman mentioned going to Swarthmore College, which is my alma mater. The president of our class, named Nick Jesdanin, 51 years old, unvaccinated because the vaccinations were not yet available, healthy, a marathon runner, died of a COVID infection. He was a prominent writer, an extraordinary human being, but utterly healthy. And that may have been, of course, more rare than an 82-year-old or a 91-year-old contracting COVID and dying, but it does happen. He is an individual that would have been vaccinated immediately when given the opportunity. And also, the reasons that we were able to avoid so many unnecessary deaths in a very difficult to treat state, where we have 1, 2, 3, sometimes 4 generations of people living under the same roof with one provider. The challenge there is if we suddenly can't vaccinate teenagers or people who are 28 years old and are the breadwinners for the community, and we have another pandemic, or we have this outbreak worsen again, they will come home with the disease and very likely spread it to those who are vulnerable. And so I'll pause there. I just say that we should give people choice and we should honor and respect their stories, but we have to do the research.
But their stories haven't been honored and respected. Our next question will be Senator Kim.
Yeah, thank you. Governor, I guess I just would like to stay with you here for a sec, because I think you have an interesting perspective, someone who's both a doctor as well as an elected public official in an executive position. And I'm trying to digest the information that I'm hearing here and thinking about how to talk about it to my constituents back in New Jersey. And if they're watching this I think that a lot of this is beyond what the average person understands. It's beyond what I understand in terms of the fullness of what happens in terms of our health system. So from your experience, Governor, when these cases come forward, these cases that Dr. McCullough and others have raised, in terms of these concerns, what's supposed to kick in? How does this system work? You talked about this, saying that, we have a robust system for safety, that the system is designed to monitor, identify, and transparently report possible side effects, to review. Can you explain to me and my constituents, how this unfolds and what to expect?
Yes, thank you, Senator. So the way it should work is that we totally support science and we support public health so that we are able in labs and in public health offices to take in the concerns, the complaints, the vignettes, the data, and analyze it thoroughly. And to the chairman's concern, I'm sure some people were not listened to or they felt not listened to, and that should never happen. That is one of the great challenges of our modern time, where we're talking past one another, where when people are spreading their stories anonymously, sometimes they're spread in ways that are not really even from the individual who's suffering themselves. There are great challenges, but we have to have this robust system. And how do you talk to people? How did I talk to people? In my state, and many people feel that we had the most positive and effective strategy to deal with COVID, was because we did something very simple. It was partially accidental. In the early days of COVID, I started a whiteboard. And ultimately, tens and hundreds of thousands of people followed this whiteboard. And just so people know that it didn't have bias, implicit or otherwise, it didn't have partisanship, I just put the actual numbers that we had to the minute of how many cases that day, how many people were vaccinated, how many beds we had, how many intensive care unit beds were available, how many ventilators were available at each facility, how many infectious disease doctors, and so on. So that if someone truly didn't believe COVID was a threat, and some people felt that way, they could just look at the data and decide for themselves how they would respond in their lives. This is how you talk to your constituents about something that's this disconcerting, in fact, terrifying. And we just showed day after day after day, in a brief moment, sometimes 90 seconds, exactly what we had as the best data, long before we had these very complex reports from Johns Hopkins or USC or other universities, okay? Before we had that, we had our capacity in our state to share with our people what we were dealing with. And so what happened? Now, people could argue about this, but I will tell you that I believe we had far more people get vaccinated because I just shared exactly what we were experiencing. And I'll tell you, I look back at some of those early reports, and I sometimes shudder a little bit because we learned so much, which is what happens with science during one of these crises. You learn as you go. There were times, as you know, that we didn't have the right recommendations on masks. And we, of course, could debate that in this room, I'm sure. But we gave our best scientific data and our best experiential data. And that's how you talk to people. And yes, you never tell people that they are not valued, and you never just dismiss their stories. And I'm positive I or others have been guilty of that in the moment, and we shouldn't be. But we also should not demonize one another. And when we, in my family, ultimately had protesters, which did, to a large degree, cross some lines, when some people were just communicating with me, other people, I have to be honest with you, some people wrote swastikas on signs that were next to my home. Certainly, my father's Judaism had nothing to do with my COVID response. But I can tell you that sometimes because people were traumatized, and I understood how scared they were, and I understood what they were hearing out there, but that's how you talk to people. And if we do that after not, and I have to be honest about this, if we don't systematically dismantle our public health system, we'll be okay. We will find common ground, even though I suspect that there are some pretty significant differences between me and some of the other testifiers on what we would do with the next pandemic. We would actually be able to still move forward together.
Yeah, I mean, I think, something you said earlier, I thought stuck out to me, the sense of that, no one should be ignored. I think that's a principle I hope everyone here can agree upon. that I think they always have space for more transparency. But also just keeping in mind that broader context. I mean, as you're saying, here are the challenges that we're facing when it comes to this system and how we can work on it. I mean, certainly, I can imagine your experience, whether on addressing COVID or in Samoa, certainly that becomes more difficult to fully enact this monitor, identify, and the transparency report. When you're in the middle of a crisis, when you're in the middle of the chaos, that's something I think we can try to do to improve. To the point that was raised earlier, I think a lot of this also says this is a reason why we need to invest in capacity, invest in personnel, people working in our government to do this, and as opposed to cutting back on staff and trying to say that we need simultaneously more transparency when that becomes all the more difficult. But I mean, look, I understand, and I've had people in my life that have been ignored and not believed, whether that's, my time as a diplomat before, and people I know struggling with Havana syndrome and people telling them, I don't believe you, and other issues that are out there. But we should always have that system in place. And that's what I just hope we can come back to. I mean, I get it. I'm new on this committee, and I understand, and I'm seeing, years worth of back and forth that are coming here. But someone who's coming with some fresh eyes, I hope that we can try to cultivate that sense of trust that I know has been so deeply wounded, because I worry about what comes next. I worry about how we deal with the next diseases, the next pandemics, how we try to move forward and understand how this technology of mRNA and others try to move forward on. So I just appreciate, being able to hear this all and try to figure out how best I can be able to relate to the people in New Jersey, around this country, about the safety of the COVID vaccines that I have seen be able to save lives, but also be able to assure that we won't ignore people if they have other concerns, and we do our best to be as transparent as possible and to be careful of accusations of personal malfeasance, especially with some of our public servants, in terms of whether or not they were intentionally withholding information or not. We need to be very careful about those accusations on this committee. And with that, I'll yield back.
I will say we are just seeing the tip of the iceberg here, and you will see more evidence. Trust me. Senator Marino.
Well, first of all, thank you, Chairman, for putting on this hearing. I'm going to focus on, let's just stick to COVID-19 and COVID-19 policies. Let's not get into this conversation about vaccines writ large. Dr. McCullough, do you feel that you were listened to in 2021? Did you feel ignored?
Our November 19th, 2020 hearing, done for Homeland Security and Governmental Affairs, was very lightly attended by our senators who are working for us. That's a disappointment. It's disappointment there's chairs empty here. Our hearing was actively suppressed, scrubbed off YouTube.
So just to clarify, not only were your viewpoints ignored, you were called a conspiracy theorist, a spreader of misinformation, somebody who didn't know what they were doing, by people who didn't even take a science class in high school. And yet you're a doctor and you're completely ignored. Let me ask you, Dr. Vaughn, real quick question. How many children under the age of 5 years old died of COVID?
So very, very few. Actually, theoretically, a healthy child under 5, there wasn't any.
So basically zero?
Yes, it's
How about
statistically
under the
zero.
age of 10?
It's still statistically zero.
15?
When you get up
15?
into the 15, 16, I mean there is some.
So under 15, none.
Yeah.
Pretty much none.
Statistically, yes.
All right, so I'm confused because Governor Green said he held the children who would have died from COVID, but that's crazy because evidently nobody died of COVID who was under 15. We're talking about, but see, that's the confusion. See, when we talk about COVID vaccines and then we stick in other vaccines, we get off topic because COVID-19 wasn't about measles. Now, Dr. Thorpe, do you think, good idea or bad idea, that you should close schools?
Bad idea.
Now,
Bad idea.
Now, why? I mean, kids can learn at home, can't they?
They can learn very well at home, but at school, they will have the opportunity to develop natural immunity.
So, and school, well, by the way, schools is where you socialize, you learn your behaviors, you learn how to meet other people. Because if we don't believe in schools, the federal government and state government can save a lot of money. So schools are important. Let's just get that out of the way. So why would you close schools, which you did, Governor, when no children died of COVID? What would make you make that decision? You close schools. And by the way, the impact on that is generational. You destroyed the lives. You and the other governors that closed schools destroyed the lives of children in doing that.
So, okay, I've got to tell the audience, please notice, sir.
Senator, may I respond to
Yeah,
these
that was a question
accusations?
for you.
Yeah, I think it was. Well, first of all, I think you misunderstand some of the value to.
No. Why did you close schools?
Well, I'm going to address each
Just
of your
answer
points.
that and not filibuster me, please.
I'm not going to filibuster you. Schools, I did not want to close, and
But
we
you
tried-
did.
Actually, I was not governor at the time.
But you were lieutenant governor and you were the point person. Do you think the governor made a mistake in closing schools?
We reopened the schools as soon
Did
as
you
we could
think
get the
he made a
teachers as soon as-
mistake?
Well, if
Do you
I
think he made a
may I
mistake?
answer the question, or is this senator going to filibuster me, sir?
No, you're going to answer my direct question or just say I'm not going to answer you.
No, I'm going to answer
Do you
your
think
question.
it was a good idea? Yes or no, the two choices in this answer. Do you think it was a good idea to close schools? Simple answer. Just give me a yes or a no.
As we had COVID surging through our society because there was massive spread from children to adults, we were waiting to make sure the teachers
So let me get this straight. You sacrificed the lives of children because maybe they would spread something that you don't know to adults. You thought that was a good idea. That's
No,
interesting.
that's
Okay.
not always it. Actually, it's your party that's
Okay.
trying to
We can-
close
we
our
can-
schools
we
and get
can-
rid of the Department of Education. So
That's-
we do
So
have
we're not
differences of
politicizing
opinion.
this hearing. Okay,
No,
we're
well,
moving on.
You said my
We're
governor and the other governors that closed schools, which is a politicization
Look,
of the issue.
when I'm in Hawaii and I'm having a hearing before you, you can interrupt me. When
I will.
you're here before the United States Senate, you're not going to interrupt me. Moving on. So here's the next question for you. Show me the science that said that when I walked into an airport in Hawaii, and I wasn't, I didn't want to tell you because it's none of your business whether I had a COVID vaccine or not, or tested positive or not, because that's also none of your business. Where's the science where I had to quarantine for 14 days? Tell me the science behind why you locked your residents up and did not allow them to go grocery shopping, why you closed your beaches and your parks. I would love you to put that science into this record because you can give me the nice, happy talk, but those were terrible decisions. And what COVID highlighted more than anything else, by the way, it's why I'm here. I ran for the United States Senate, not because I had this deep desire to be a government politician, but because I was so incensed by the arrogance, by the ignorance, by the lack of common sense among our elected officials that we needed different kinds of people here in Washington, D.C. and other places. So,
Shall I answer those questions, Chairman?
no, there was no question for you. That was just a
There were
statement.
several questions.
No,
You asked about why a 14-day quarantine. You asked about what
what's
the
the science?
airports.
Sure, what's the science? 14-day quarantine.
Because
not 12, not 16.
Actually, I asked for 5 days, just so you know.
So
With
what
my-
was it? Was there a dartboard?
No, it was 5 days because that was the amount of time from symptoms to transmission.
So why
that we-
14?
The 14-day was before we had the
So 14 wasn't scientific, just to be clear.
14 days was how long it took for people to get over the disease, and people were still shedding virus through that period. And that's why you do use science, and I use science, but you didn't like science for Hawaii. But we did have the test, and we did have the test to enter Hawaii, so people could make a choice, an informed choice, and they did. And then they didn't have to quarantine at all. Just to make sure you know that, because I think you have your facts wrong. And also, I didn't close the beaches. That was the mayor of Honolulu and not me. So just, it is important that you get the facts right if you're going to be a political official.
So that's what you're saying. It wasn't me. It was the other guy.
No, it was me who ran the COVID response.
Zero accountability. Dr.
Well,
McCullough.
I'll take more accountability if you give me more time.
I'm done with you, Governor. Thank you.
Thank you, sir.
So Dr. McCullough, quick question for you. Just completely objectively. Look, I went to business school. I was not a doctor. So I'm going to truly objective, using your most subjectiveness here. Did the vaccine stop the spread of COVID-19?
No.
So then let me ask you one simple question. We'll go down the line. You guys can answer it. It'll be my last question. So if COVID-19 did, the vaccine, the injection, did not stop the spread of COVID, why is it that Joe Biden, President of the United States, issued an executive order, which was ruled unconstitutional, by the way, that said that if you worked for a company with 100 employees, because not 99, 100, that you would be fired if you did not prove you didn't have a COVID vaccine negative test or got vaccinated. Why would we have some decision like that? How depraved do you have to be to do that? Answer the question the way you feel down the line. Go ahead, we'll start with you, Mr. McCullough. Dr.
Briefly.
My testimony on this issue went all the way to the Supreme Court that overturned 4 out of the 5 Biden mandates. They were scientifically ungrounded, they were sociologically deranged, and they caused great harm. To this day, people are in court trying to get their jobs back and trying to put their lives together because of these disastrous policies.
And just to be clear, sorry, Chairman, nurses were included in that, correct? Healthcare workers. The ranking member called them heroes. It seems to me that when you have a hero, you don't terminate their ability to make money and have them fired because they're making a personal choice. Because he ultimately, and I'll end with this, ultimately, this is what this is all about. See, I get to get a choice if I'm going to get vaccinated. And if it doesn't stop the spread, it is none of any other human being in this country's business what I did or did not do. Would you agree quickly?
100%. And I think Director Walensky, when she said of the science of hope, that is not science. Science is facts. Hope is not science.
Thanks, Senator Marino. Again, please, let's not express any emotion out there in the audience. Dr. Walskog, I just have to go to you because you have direct experience. I almost feel like bringing up Breanne Dressen to talk about the concealment that you witnessed firsthand when it came to your working with, Bree's working with NIH officials, trying to do studies, being carried along with some assurance that this was going to be revealed to the public, and it never was. Just talk about that level of concealment. Again, there's going to be so much evidence of this if it hasn't been destroyed. This is just the tip of the iceberg, what we're seeing here with myocarditis. But talk to what you and your fellow vaccine injured who were dismissed, who were gaslit, who were treated horribly. I mean, horribly when you came to the United States Senate and asked to be heard by senators and their staff, you were treated. Describe how you've been treated.
Well, thank you, Senator Johnson. So what I'd like to say is being vaccine injured in this country is unfortunately a huge polarizing event, which it should never be. If I could describe one word that I think all, if not most, vaccine injured will say is, what's one word that describes your experience after your injury? And it's abandonment, okay? We get attacked, we walk a tightrope. We get attacked from the right say, we're stupid, we shouldn't have got a shot, we should die. Okay, and I could show you social media stuff. The left says we're anti-vaxxers, which to me is one of the most ignorant things to say of myself because all my children have been vaccinated. I got vaccine injured because I got vaccinated. But still, regardless, we get called anti-vaxxers. We report these to VAERS. Okay, nothing happens. I had an adverse event, which was, delayed the AstraZeneca trial in the United Kingdom, 2 times for 3 cases of transverse myelitis. I expected a call the day after. Days passed, weeks passed. By 3 weeks, I called the CDC myself and demanded, a response. I always thought, I'd get this quick response and someone would help us. All of us that are vaccine injured know there's no phone call coming. There's no help coming. We have repeatedly met, and Breanne Dressen, who's my co-chair with Reactine, have met with Peter Marks over and over and over for the last, for a period of about 2 years. We have been placated. We have been blown off. We bring up adverse events, the neurological adverse events. We bring up the MIS, which is the multi-system inflammatory syndrome. We bring up the myocarditis. He thanks us. He says he'll get back to us. He never does. That went on for 2 years. So for people that think it's this kumbaya where people are listening to us and people are all in these federal agencies are trying to to help and get to the bottom of it, it is the farthest from the truth.
So there have been a number of claims made, and I think there'll be continue to be a number of claims made. I just ask anybody making a claim, please provide your citations. Please provide, again, respect the science. Let me see the science. I mean, I'm very genuine here. Let me see, the science behind this actually reduced the symptoms, or this prevented deaths, or this prevented transmission. I would like to see the science. Dr. Vaughn, you are really specializing in the blood clots. I've seen video after video, picture after picture of these long white blood clots in autopsy. We've also, throughout COVID, autopsies were really discouraged. We weren't seeking the scientific truth. I see Dr. McCullough, I'll have you kind of answer that, but Dr. Vaughn, first talk about the clotting we saw and what you know in terms of what was discovered under autopsy.
Well, first of all, early in COVID, the spring of 2020, my collaborator, Jacques Lobscher in South Africa, was the first one to kind of alert people to say that this was primarily a vascular disease, not a pulmonary disease. And that's one of the reasons that ventilators are probably one of the most ineffective things you could have done to people, because if you have a vascular disease of the lungs, increasing the intrathoracic pressure just closes down more vessels and ultimately kills them. And what we also saw was if you went into the hospital in the spring or summer of 2020, you were twice as likely to leave alive if you were already on a blood thinner. Now, I will tell you, most of your friends that are on blood thinners probably aren't healthier than you. So it's kind of interesting to find out that the people that were on blood thinners had a protection. So again, those were signals that were really downplayed. Unfortunately, after a lot of the treatment was codified by the CARES Act, it resulted in basically a protocol-based treatment for in-hospital care.
As long as you start, anybody describe remdesivir? Anybody want to speak to that? If not, I'll do that for another hearing. I mean, just the conflict of interest of how that was being approved. So we'll wave off on that.
But what we uniquely found, and my collaborators in South Africa, Risha Pretorius and Doug Kell at University of Liverpool, was that the spike protein was able to induce fibrin from fibrinogen, which is a fancy word for saying, hey, forming the backbone of clotting. But it did it in a way that was different, that we had not seen. And it was what we would similarly think of fibrin as kind of like spaghetti coming out of the colander that you could pull apart when you didn't need it. It was easy to break down. But the actual clot that was formed in COVID or from the spike protein from the vaccine was like burnt spaghetti casserole that you have to get a Brillo pad to get off the dish. And a lot of people, their issue is their inability to break down that clotting mechanism. We all need to clot, but we all need to actually get rid of the clot, and that is the problem.
That's pretty obvious, was ignored. Dr. Thorpe, I'll get to you, but Dr. McCullough real quick.
Quickly, in the last 5 years, I've never treated as many blood clots in my entire multiple decades of in clinical practice as a cardiologist. The blood clots occur after the infection with the virus and the vaccine because the spike protein causes blood clots. It's without any controversy in medicine, the spike protein causes blood clots. So it is reckless and foolhardy to continue to vaccinate people and load the body with spike protein and cause more blood clots.
There were other parts of the coronavirus that they could have used in the lipid nanoparticle. I mean, they could have injected something else that wasn't quite so toxic.
Yeah, and actually, a paper in Cell, July of 2021, it's called Broad and Durable Immunity from basically COVID. And what they found was the nucleoprotein was actually the thing that supplied broad and durable immunity for actually prevention of infection. Unfortunately, the spike protein did not elicit that response. And as much as we love this mRNA technology, it seems like they sold it as something that we could change on the dime as information actually came to light. And by July 2021, we knew the wrong protein had been picked. Why didn't they change it?
That's a good question. Senator Blumenthal.
Thank you, Mr. Chairman. Dr. Vaughn, I noticed that you were careful when you said that children didn't die of COVID to say statistically, which I appreciate, 1.2 million Americans died of COVID-19. Tragically, more than 1,000 of those deaths were children. In fact, 700 were 4 years old or younger. And I'm sure you will agree that those deaths were tragic, and most especially for the families who will never be the same. Children were affected by COVID. There's no question that children died, but equally important, the trauma of COVID affected children. The fear and anxiety that spread throughout their families. You don't have to be a doctor to understand that point, or a parent.
Yeah, I have a 7 to 9-year-old, and it was a very interesting time. But in many ways...
Well, interesting is a somewhat euphemistic way of putting it. I'm
Yes.
sure you'll agree. But let me just point out that our entire society was traumatized by COVID. People were out of school. We can argue about the merits of whether they should have been, but it has affected our entire society. And just so we're all on the same page here, I'm in strong agreement that schools are good. Kids should be in school. Let me point out, though, because we want to learn from history here, that when there are side effects, when there are threats to public health, there should be warnings. The public should know, so should doctors and researchers. And right now, I'm looking at a report from NPR, it's dated May 21 of this year, which describes the effects of cutting back on the CDC's capacity to warn, and says that many of the platforms, quote, many of the platforms the CDC used to communicate with the public have gone silent, end quote. It says, quote, many of the CDC's newsletters have stopped being distributed. Workers at the CDC say health alerts about disease outbreaks previously sent to health professionals subscribed to the CDC's Health Alert Network, HAN, haven't been dispatched since March. I understand the concerns that have been expressed here, and let's learn from scientific practice and make sure that the Department of Health and Human Services provides the resources that are necessary to warn the public. I want to ask Dr. Brown, because you've talked about both your experience in Samoa in 2019 with the measles outbreak there, which eventually killed 83 people, as I understand it. Again, measles was thought to be eliminated in the world. That outbreak was fueled by misinformation about the measles science, spread by a number of vaccine doubters or skeptics, including the now Secretary of Health and Human Services, Robert F. Kennedy Jr. That campaign caused the vaccination rate against measles in Samoa to drop from over 74% to just 34% between 2017 and 2018. Do you see parallels between the measles outbreak you helped to address in Samoa and the one that we're now seeing in Texas that has reached 31 states, including Hawaii, and the COVID-19 situation?
Thank you, Senator. There are more than parallels. It's just terrifyingly similar. So what happened, I'll give you the brief version, in Samoa was prior to the outbreak, 2 children had been given vaccinations, and tragically there was human error, and 2 nurses who were later prosecuted made a mistake, a tragic mistake, and they used the wrong reagent, the fluid with the vaccine, and they vaccinated incorrectly, these 2 children and the 2 children perished, which is, of course, tragic in every way, and we always have to hold all healthcare people to account. Now, after that, there was panic. And what happened in the months and years thereafter was that human error was not a vaccine flaw, it was a human error. And that information was then spread incorrectly by then Mr. Kennedy, before being Secretary Kennedy, and the Children's Health Defense. And that country and their leadership told me this directly. They received letters. There were stories all across Samoa that this group of people came and convinced them not to vaccinate. And they had a lot of challenges with health literacy, and they stopped vaccinating. And then when you get vaccination rates that are that low, and mind you, we have this challenge because we have 14 states, my state is among them, where the kindergartners in our states, age 5, sometimes age 6, are at dangerously low vaccination rates for measles. When it gets that low, you're going to see outbreaks. Unlucky. The cases could come from anywhere. They could come from overseas. They could come from within our own country. But if you get below 95% and certainly below 90%, you see these outbreaks. And then you have, 1 in 5 people end up in the hospital. You have 1 in 20 with pneumonias. You have encephalopathies. You have all sorts of damage. So that's what happened in Samoa. And to be very direct, and actually I want to be generous here, there are many things that Secretary Kennedy is doing that I support. I support his work on some of the questions about processed foods and dyes and environmental toxins, things that I have believed for decades and fought for, as have many of you probably. However, this is so central to the public health of our country that because we have vaccine hesitancy, and because when you fall below 95% and particularly below 90%, you will see these outbreaks. So we can anticipate that we're going to have a lot of outbreaks, first of measles, and there's going to be fatalities and lots of consequences. We're going to see pertussis. God help us all if we start seeing meningitis or polio break out. These are diseases that have been eradicated. And so what I would say is I really appreciate the chairman's focus on truth and making sure there's transparency and going through the record. I appreciate that. I appreciate individuals who I disagree with fighting for their voices. But what I don't appreciate is when there are individuals with no public health training, whether it's a senator or someone that's one of our colleagues, and they make an assertion to move away from science and away from prevention that has been proven, that I have deep concerns about. And that's what happened in Samoa, killing 83 people. We had to jump in. And then that is what is happening in Texas and a bunch of other states. And I don't think it would be very interesting to ask all the senators privately and congresspeople and all of us if any of us could accept that kind of spread of infectious disease amongst the people that we love. Even if we don't believe in vaccinations, we certainly don't believe in tragic outcomes, things that we can prevent. And that's where I think we should go as a country to heal.
Okay,
I'm going to interrupt just to
you
say, I apologize. I am the ranking member on the Veterans Affairs Committee. There's a separate hearing beginning right now. I have more questions. I'm going to try to come back, Mr. Chairman. And I apologize. I'm going to have to leave. Thank you.
Appreciate you coming. This is the part I was actually looking forward to. Unplugged. So, Governor, I'm just going to be honest with what gets under my skin is how many times those of us who've had a different narrative on this, or not a narrative, but just a different viewpoint on this, we are always accused of ignoring science. I think I've been trying to follow it quite closely. So again, I will ask you, and we can go through your testimony. Every time you cited something, we will ask you to cite the study that proves what you're saying. Okay? So again, not really a challenge, it's a request. I mean, I would ask that of all of you. Any of you who have cited some study or some opinion, back it up. And we'll include in the hearing record. We'll have this hearing record will stay open for 15 days, so I'm really encouraging people, send me that science. Again, I entered a piece from Raphael Lataster that pretty well debunks the Watson, I think it's Watson et al., that claims it's the COVID injection saved millions. This is based on mathematical models. It really wasn't scientific study. So again, throw it all in the hopper and let the public decide. But I do have some questions. Dr. Thorpe, speaking of corrupted studies, you mentioned in your opening statement the Shimabukuro study, which, by the way, Tom Shimabukuro, we have sent something like 70 oversight letters, more than that. In many of them, we've told the CDC, FDA, NIH, we demanded they preserve their records. And that should have been widely distributed throughout the agencies. You know, we, in our subpoena, specifically asked for the communications of Tom Shimabukuro. They couldn't find any. I know the current HHS is investigating that individual. We've sent I would call it a referral to the FBI and to Attorney General to determine this. But again, what happened there? Okay, again, when people are supposed to maintain records and they don't, I get suspicious. But again, going to Dr. Thorpe, and I'm going to probably interrupt you because I want everybody to understand what you're talking about in this study, because we're talking about numbers here, but describe that study on, would you call it fetal demise, miscarriage, and how it was originally presented as evidence to push this on the most vulnerable, as you're saying, pregnant women and the unborn. And how did they distort that study to make that point? Go ahead.
Thank you, Senator Johnson. So the study in question is a New England Journal of Medicine on April 21st, 2021. And in that same day, the digital edition, there were two publications that were extraordinarily concerning. Both of them, interestingly, coming at a time when vaccine hesitancy was increasing. So the Shimabukuro study was a separate study in addition to an op-ed. The op-ed was by the New England Journal of Medicine, editor-in-chief, who was Eric Rubin, and the managing editor, who was Stephen Morrissey, and then director of the CDC, Rochelle Walensky. And they made statements that were false. They made statements that was fear-mongering, insinuating that pregnant women, if they didn't take the vaccine, would put their lives in harm, their preborn lives in harm, and their newborn lives in harm, when they knew absolutely the opposite was true.
How did they know that?
Well, they know that for several reasons, Senator. Number one, the study by Pinnells and colleagues, who is a maternal fetal medicine specialist from University of Texas, Houston, published a very large study documenting that pregnancy in of itself reduced the maternal mortality by as much as 75% during pregnancy compared to non-pregnant women. That study was available. Also, Dr. Shimabukuro, Tom Shimabukuro, and then director of the CDC, this was 7 weeks after the Pfizer 5.3.6 post-marketing data in 10 weeks that showed the COVID-19 vaccine was the deadliest and most injurious vaccine ever released, with 42,086 injuries, including 1,223 dead. They had that information. They still pushed it on pregnant women.
So let's get to the number where there's 700 individuals included in the statistic that shouldn't have been included. So describe that. I mean, talk about this study.
Right. Well, there's bias. There's bias in the title, okay? Just look at the title. There's bias in the 21 authors, all of whom were federal employees, and Tom Shimabukuro, a safety officer in the FDA itself. Then you go to the numbers. We look at, we're looking at about numbers of over 4,000 in a 10-week period. And then all of a sudden, it's just, how do we arbitrarily go to 10 weeks in this V-safe smartphone collection system? And then what happened to all the other patients? We go down to 827 patients. What happened to the rest?
So you got 827 patients that became pregnant or were pregnant in this. Correct. In terms of, again, it's not really studied, but I mean, they're just analyzing data. So you had 827.
Right.
Okay, so these were women who were pregnant.
Right. 827 that completed a pregnancy in 10 weeks.
Which is not necessarily a born child, but the pregnancy
or
is.
a miscarriage, right.
Okay.
Now, they claimed a 12.6% miscarriage rate.
Which is pretty kind of a normal miscarriage?
No, it's not.
What's a normal miscarriage rate?
3% when you have a normal booking visit.
Okay, so it's already an abnormal miscarriage rate in that 827.
That's correct.
Okay.
And
so now describe exactly how they.
Okay, so we have 827 patients, right? And they talk about a 12.6% miscarriage. But a miscarriage of those 827, 700 of those mothers had their vaccine in the 3rd trimester. That's way beyond the window when a woman has a miscarriage. So they artificially took those 700 patients and put them in the 1st trimester. No, the 104 patients that had the miscarriage, that goes to the 127. 104 over 127, you're looking at 82% miscarriage. So the key is the percentage of women that got the vaccine in the 1st trimester had an 82% miscarriage. And by the way, that's the exact same miscarriage rate that was seen in the Pfizer 5.3.6 post-marketing
So
data.
I would argue that proves both points in the title of this hearing: the corruption of science, the corruption of federal health agencies. Governor, listen, I'm cognizant of the fact that you're kind of outnumbered here. So I want to give you an opportunity to respond to that if you want to. You don't have to.
Sure. No, I'm happy to. Look, appreciate the information. The tragedy of a miscarriage is always there. It's not 3%.
What is it? What do you think it is?
Well, in my training as a family physician, the miscarriage rate for women is often in the 20s or 30 percentile. For women across their pregnancies, there are just a lot of miscarriages that occur amongst women. So those are all tragic, and I would obviously defer to ACOG, the American College of OBGYNs, who did, and they should come and testify too, who did strongly recommend the vaccine. I mean, I'm not going to speak as an OBGYN. I'm speaking as an ER physician and as a governor. But I'm sure that would be a vibrant discussion. And again, it's a very good point that we have transparency in studies.
So let me move on to my next point. In one of our events, some of you were there, there's Dr. Moon opened up the insert for the COVID injection. Big piece of paper, fold up and it's other than it says intentionally left blank, it's blank. Now this was quite a few years, I think this was probably a couple of years into the COVID injection, distribution of it, and all these studies, everything on VAERS, I would think somewhere, when you take a look at the actual studies and the adverse events that were documented within those studies, it's now been released through the Pfizer papers and other means, you would think somewhere they ought to put some information in there. So the point I want to make is I think an awful lot of folks are saying that there was not informed consent. I would argue they violated the inviolable principle of informed consent with this COVID injection. I just think that's indisputable. I'll start with you, Dr. McCulloch. Do you want to weigh in on that?
I've presented at the FDA advisory meetings. I've advised companies for decades on this, so I know the regulatory science very well. When a product definitely results in death, and there are thousands of peer-reviewed papers on this, Governor, the COVID vaccines in some people, sadly, result in death. Some on the very first day they take the shot. That must be a black box warning on the product immediately. I just checked the package inserts for the currently available products, the ones that Senator Blumenthal wants to pursue. Sounds like Governor wants to still pursue these. Our FDA still wants them to be administered. They still don't have the word death in the package insert. As of today, they don't. And so Americans are not fairly informed.
Do you have any doubt in your mind that the COVID injection caused some deaths? I mean, what do you think of the, what is it, 38,607 right now listed on VAERS? What do you think the real number is? And do you have any science to back up your opinion?
The best data are autopsies. So in the largest autopsy series published to date, I know because I'm the senior author, of all the deaths we examined, and we re-reviewed them. We had an adjudication committee. We had ways of arbitration deciding on did the vaccine cause death. The answer is, of these cases that came in for autopsy after vaccination, 73.9% of individuals, it was determined that the vaccine was the cause of death. First author is Holscher and colleagues. He's sitting right behind me.
And again, by FDA's own laws, that should be included on that package insert, correct?
Immediately in 2021, Dr. Carol Tassetta, working with the Daily Cloud, wrote Peter's Marks in the summer of 2023 and said, where's the black box warning? Where is it? No word from Marks.
Dr. Vaughn, you want to weigh in on the informed consent?
Well, the other thing is, I think emergency use authorization, actually by definition, when you fill out the documents for the patient, if they read it, it actually says that they should make sure that they are under no compulsion to get this product. And that is what's so confusing, because even though the product was mandated in the summer, at the end of the summer of 2021, the product on the shelves was still the EUA product. And in that sense, for somebody to be mandated to something that they also have to sign to say that they weren't mandated to do it is kind of hard to do legally.
By the way, that's the subject of a couple oversight letters in terms of the whole full authorization type of thing. Dr. Thorpe, quickly?
Yes, on informed consent, there was completely the opposite in pregnant women. HHS appears to have captured the American College of Obstetricians and Gynecologists, and my research team, including Maggie Thorpe, JD, have proven that with the Freedom of Information Act.
For a few million dollars, correct?
Many $1 million. They captured ACOG. In December of 2020, everybody at ACOG and the other organizations, we're not going to push this vaccine in pregnant women. In the span of a pregnancy, 40 weeks, September 27th, 2021, you will push the vaccine, you will push it in pregnant women and follow all the HHS criteria. And if you don't, we will destroy you and your professional career will take your license away and we will decertify you. That went out to 60,000 OBGYN doctors. So
we probably should have expanded the title of this, corruption of science, federal health agencies, what would you call those? Professional organizations?
These are the three organizations that essentially govern obstetrical care, not just in the United States of America, but the whole world.
By the way, I wanted to ask you, to what extent are the medical journals funded by various conflicting organizations, pharmaceutical companies? I've heard Chinese interests. I mean, are you aware of that? You were talking about the article written by the editors of the New England Journal of Medicine.
Yes, I'm aware of the study by Wen and colleagues, David Daniel Wen, that was just published October 10th of 2024, documenting that 1.06 billion with a B dollars went to the reviewers of the medical journals, of probably the most influential medical journals, New England Journal of Medicine, Lancet, BMJ.
That's coming out of the pharmaceutical industry.
That's correct.
So Dr. Walscott, as a vaccine injured, do you believe you received informed consent?
Absolutely not. Absolutely not. I mean, informed consent, and I, as a physician, I believe strongly in informed consent. Informed consent requires true and transparent data. And we can sit here and hear the mantra, or the typical narrative of safe, effective, saved millions of lives, but in reality, that's not true. Okay? We can talk about efficacy if we want. Again, certainly the vaccines don't prevent infection, don't prevent transmission. I think I could present to you, I mean, and refer to a lot about safety data, particularly with regards to all the adverse events that I think there's more than ample evidence that the federal regulatory agencies ignored. A lot of these systems, VAERS, V-Safe, I call deliberately deficient by design. So do I think I got informed consent? No. Do I think anyone here in the United States in the last 4 years have gotten informed consent in considering getting a COVID vaccination? Emphatically, no.
So by the way, my theory, and it's just a theory, I don't have the proof, it's hard to prove these things, but my guess is the reason they were so concerned about issuing a warning on the HAN is, again, they didn't want any vaccine hesitancy on this, right? And also, if they alerted doctors to the fact that if you have a patient with myocarditis, you might want to ask them, did you just get a vaccine recently? And otherwise, the doctor is looking at myocarditis trying to figure out how to treat it, right? Not trying to figure out the cause, because myocarditis does happen. Dr. McCullough, quickly.
Myocarditis was so common that in the UK and Australia, they actually did issue guidelines to doctors on how to recognize it and when to get MRIs. That's how big a problem vaccine myocarditis is.
Also, one of the points I made is they did not warn, they didn't advise doctors to advise against strenuous physical activity, right? They pulled that off of the one warning that they gave. Talk about how dangerous that is. Also, I mean, the mild. Talk about how often myocarditis is mild versus serious.
Before the pandemic, there was myocarditis. Can be caused by Coxsackie virus. The most dangerous type is called giant cell myocarditis. It was very rare. I had seen 2 cases in my career. One was fatal. But it's in our guidelines. Anyone who develops myocarditis cannot undergo strenuous physical activity. They have to be taken out of sports. It's mandatory because the surge of adrenaline, when there's inflammation in the heart, triggers a cardiac arrest. So you can imagine how reckless it was for the sports teams to mandate vaccines on athletes, provide no provision of safety, and then have them go out on the field.
So why would these federal health officials, when they're discussing putting that warning, that advisory for physicians as they did their kind of weak need warning on myocarditis, what does that tell you? Why would they pull that out?
It was reckless not to provide prudent guidance on reducing the risk of cardiac arrest when a patient has vaccine myocarditis. Whether it's acute myocarditis that we clinically recognize, by the way, 90% are young men, 90% are hospitalized. Tracy Hogan, others at UCSD show that, multiple studies, but there's a larger group of subclinical myocarditis. These are patients with heart palpitations, blood pressure swings, atypical chest pain. Listen, this is water under the bridge. Fortunately, very few people are taking COVID shots anymore, but these patients still have symptoms. A recent report by Koyosmu in Journal of the American College of Cardiology has shown cardiac arrest in people years after the vaccines, and they have found vaccine microscars in the heart.
And we can keep going down this. I did want to go to Mr. Siri, who does a really good job of describing V-Safe, because you actually had to sue. You should have had to sue, by the way, right? First of all, the health agencies who set up this V-Safe, voluntary online report on specifically the COVID-19 injection safety surveillance, right?
Yeah, V-Safe.
10 million people signed up voluntarily. You would think the federal health agencies would make that information just available anyway, but at a minimum, when you FOIA'd it, Freedom of Information Act, you think they would have just handed it over to you, right? They didn't do that, did they? You had to sue them. How long did it take you to actually get that vSafe data? And then why don't you describe what you've got and why they were probably trying to hide it?
Sure, it took over 2 years, and you'd also think with a name like vSafe, it would have been designed to actually assess safety with regards to the COVID-19 vaccine. So vSafe is a program that the CDC rolled out in December of 2020, along with the first rollout of the first COVID-19 vaccines. And as you just pointed out, Senator, the point was to ask people to sign up. 10 million Americans signed up, almost all of them in the first 6 months. This was when there were no mandates. These were folks who were enthusiastic about getting the vaccine. These were the folks who who felt it was their civic duty. In fact, that's part of what they checked of why they signed up for vSafe. And so over the next 2 years, the CDC kept putting out study after study after study, dozens of them, in which it said the COVID vaccine is safe. When you look at those studies, what is it relying upon? One of the primary data sets it's relying upon is the vSafe data, okay? And so on behalf of our client ICANN, we, as you pointed out, submitted a Freedom of Information Act to the CDC, and we said, hey, this data you're collecting in vSafe is almost all de-identified, because most of it's checked the box. Please provide it. The American public pays for it. You're public servants. American public should have access to it, should be able to do what scientific inquiry is supposed to do, which is replication.
By the way, quickly, what did they ask and what didn't they ask on the vSafe?
Yeah,
I mean, talk how grossly inadequate it was.
Yeah. So, I mean, I understand this hearing's about, did our public health agencies do things that were improper? Did they have scienter? Did they purposefully do things improper? And when you look at how vSafe was designed, I think you'll see that. So vSafe had check the box most of what vSafe collected was via check the box options. Then it had some free text field. There were two categories of check the box options. The first category were symptoms. So you could check the box for various symptoms, right? And the
like, maybe give us an example.
Fever, local, little pain.
The standard minor things, right?
Right. And so those symptoms, the vSafe system only asked you for the first 7 days after injection. And as Dr. Shimabukuro even said in an email that we obtained via FOIA, those are the expected reactions. It's what they called almost immunogenicity. It shows the vaccine is working. And so the symptoms that they picked were totally useless for assessing the safety of the COVID-19 vaccines. And in fact, when you look at the studies that the CDC published, people were reporting those symptoms at 40, 50, 60% of them. Yeah, they reported, pain in the arm, of course. But they were viewed as normal to have a little chill, have a little fevers. And so that part of vSafe was totally useless for assessing safety. So that wasn't useful. What was left? The only other thing that was checked the box was if you sought medical care, if you missed school or work, or if you were unable to perform normal daily activities, and if you checked that you you needed medical care, it then asked you, were you hospitalized, emergency room, urgent care, or telehealth? Okay, so that was the data they were collecting. So presumably, vSafe was going to assess safety by looking at people who sought medical care after vaccination, because everything else they collected on check the box was, at least on the symptoms, was not useful. Now, before I go on to tell you what the healthcare seeking data showed, I just want to go back to the symptoms that the CDC chose. One of the things that we obtained was a copy of the very first version of the design documents for creating vSafe. And when you go to the last page of that design document, it's in my 66-page submission. Everything I'm saying is in the 66-page position with citations and support. What you will see is they had a table. It was called Adverse Events of Special Interest, Pre-Specified Medical Conditions. And on that list, it had myocarditis, it had pericarditis, it had all of the issues that we now see and people have reported with regards to COVID-19 vaccine. It was in their design document before they launched vSafe, but not a single one of those conditions ended up as a check the box, or at least the symptoms of those conditions. You could have put in at least chest pain if you didn't want to use the word myocarditis or pericarditis, but they didn't do that. To me, that is the best evidence, one of the best pieces of evidence out there that our federal health authorities knowingly, consciously chose to design this system. It was not to determine safety. It was in order to assure their a priori assumption of safety. At the end of the day, CDC is a government agency. In my experience, they don't conduct themselves based on what folks would call science or medicine. They are a policy organization. They set their policy, and then everything that they do has to conform with that policy, and their policy is safe and effective.
So again, voluntary system, 10 million people signed up.
Yes.
They've tracked all this data, inadequate, check the box information.
Not only inadequate,
and what they should have been just making available online, like quite honestly, like VAERS. I mean, VAERS available. You can see it. Okay.
They should have. And
they should have made that available as well. They didn't, and so you had to sue. When did you sue them?
Sued them. It would have been a few months after the rollout of the COVID-19 vaccine. And
Okay,
it took us a year
early
and a half.
early in 2021.
It took us 2 lawsuits actually, because we in order to make them take contradictory positions, and only so we sued them 2 different ways, and only when they had no choice, they finally released the data after
And
a year and a half.
you first filed a FOIA request.
Yes.
And they should have just boom, they should have handed it over to you.
If
right?
they want to
because
be
they obviously
transparent.
were collecting this data, had to be kind of centralized. Wouldn't have been that big a task, I wouldn't think. To okay, here's what the data shows.
It would have
us. They
taken
should
them
have-
seconds.
They should have, by law, should have just turned it over to you,
They should have.
and they didn't. So you had to go to court, and it took you 2 years.
It took it.
Okay, and then so now drum roll.
Yes.
What did the VSafe data show once you finally extracted it by a lawsuit using the courts?
Yes.
What did they show you about how safe the
Here's what
injection was?
Here's what it showed. In contrast to the dozens of studies that the CDC relied upon to say that COVID-19 vaccines were safe using VSafe data, where they only reported the first week of what people reported after the injection seek medical care, even though they know that injuries from COVID vaccine can happen well after the first week, but they only reported the first week to make the number look low. And even though they designed the system to collect medical seeking behavior for 6 weeks after getting the vaccine and 3 more instances after that, when we got the data, it showed that 7.7% of VSafe users reported needing medical care after the COVID-19 vaccine. And 75% of those reported they were hospitalized, emergency room, or urgent care, and on average, they sought medical care 2 to 3 times each. All of this data is publicly available now, and so if you're asking,
And by the way, and a quarter missed a day of work, which by the way, Thomas Bakura in a video before the emergency use authorization about the safety surveillance system said, we're going to take this so seriously. If somebody loses a day of work, we're going to have a CDC official on the phone following up, checking it out. Was that your experience, Dr. Walskog?
Absolutely not.
Not exactly. Did you want to say anything else about that? I know I've been kind of stomping on you.
No, not at all. No, it's just this. When they designed VSafe, the only data that probably could have assessed safety was medical seeking behavior. So you would hope our federal health agencies had a number. Look at how, how often COVID itself injured people. So you want to make sure the vaccine's safer than that, right? So was it 1 in 200 sought medical care? They pulled the plug? 1 in 100 people reported seeking medical care VSafe, then they'd pull the plug? The data showed 1 in 13 people sought medical care on average 2 to 3 times each. I don't think there was a number, unfortunately, that would have been sufficient for a CDC to pull the plug.
So what we sought for years is their analysis of VAERS, the proportional reporting ratio, which they did release some of those through FOIA to news organizations, that type of thing, not particularly useful. And by the way, they didn't particularly like that statistic anyway, so they did empirical Bayesian analysis. Never got it. Over a year, never got it.
Well, we have
Why?
2 federal lawsuits still going on right now for the EV data.
Okay, now we're starting to get some of it. Okay, and again, I don't want to steal thunder or jump the shark on things that I know about that are being studied, but I think it'll be shocking to people to realize that they definitely had signals in empirical Bayesian that they were not reporting. And it will show, it's kind of complex, but this will be shown.
Well,
okay, so that's what I say, they say, well, you're not proving the case on this myocarditis. No, this is the tip of the iceberg, of the cover-up, of the downplaying, and you have to ask why. Governor, just this story, were you aware of the story of VSafe?
Through the testimony, I should probably be allowed to comment. There's been a lot of comments, and we talk about commenting and so on, because it's true, I'm pretty outnumbered here. Look, the couple things. First of all, VAERS, all right, which has been mentioned a bunch of times. It's not an adjudicated reporting system. It's valuable to get input, which we're grateful for, but it is a flood of experience, and there is no, there's no clear causal connection. No, I see your numbers, but that doesn't.
Did that cause you concern?
No, it didn't. I'll tell you why. Because we do want input, massive input. I'm grateful that there were people putting that in there, but that's why we do science and studies. We don't just do what this is.
I'm going to argue with you here, okay?
Fine.
So here's the problem, because I was going to go down this road. They didn't see safety signals because they didn't want to see them. They had them, they wouldn't report on them. They lied to us. So that's what I'm trying to get at. They lied to us, just like they lied and said, this thing's going to stay in your arm, when they knew it wouldn't, and we know conclusively it does not. They talked about the mRNA. This can just, it's going to go in there, stay in the arm, it's going to dissolve, in hours, a couple days, whatever. But they knew it wasn't mRNA, it was modified RNA, and it stayed in the body, together with the spike protein. And we have studies of that. They're not talking about that as they continue to push this. So again, they've lied to us. So again, you can keep saying that, follow the science. No, the science has been corrupted and the agencies have been corrupted. So we have not been able to believe in them. That's why they have no credibility.
I'm entitled
Go
to
ahead,
answer
Governor.
many of these things. So we certainly disagree on a lot of things, okay? Yes. One of them is that you say corrupted and corruption, and that is possible, okay? But I didn't have that. I'm just sharing with you as a doctor and a governor and a public health officer and who had a great response for our state. We didn't have that experience. We did have a great...
By the way, I have checked other island nations and stuff.
Go ahead, check them.
Be interesting.
We were advising them. They were calling me for advice, and that's why we did safe travels, like the senator bristled at. We did actually find ways to help people know whether or not they had COVID, whether or not they'd spread it, whether or not people were at risk. We did that work, okay? Other people may have been, not doing that work. I don't know if anybody in this room did that work. I did the work, okay? I was out there saving lives either in the ER or as a lieutenant governor. Everyone else is talking about corruption, okay? I was doing the work.
We had doctors that had the courage to treat COVID patients as well. So.
Yeah, and I was a COVID patient also and in isolation for 14 days. And it was the right thing to do at the time, September 11th of the first year, because we didn't know if I would spread it to my children or to my wife or to other people that I cared deeply about or my constituents. So I honored it, unlike others might not have, okay, being in quarantine. So that's a different topic. Now, we've talked about myocarditis a lot, okay? And we are going to differ in our opinions about the data, I'm sure. However, there were about 12 cases from one perspective per million second shots. That's one of the studies and reports. I'm sure other gentlemen at this table are going to dispute that and have disputed that completely. But I will tell you that we saw one heck of a lot more terrible cardiac issues, myocarditis, far more clots for people that ended up in the ICU that we had to treat. We saw cataclysmic numbers when people got bad COVID and ended up at the hospital, but they didn't get bad COVID when they got vaccinated. That is the point. Now, we're walking past,
so again,
we're walking past a lot of those issues.
Okay, can you cite the study that proves that?
Yes, and I'm happy.
So provide them.
Of course, of course we will. And you can get, there's another 24,000 pages of data on both sides of this argument, okay? And everybody knows that the colossal damage to human beings.
Will you provide this committee that study?
Of course we will. And all of the data, nationally and internationally, showed that people had these complications in much larger numbers from severe COVID than they did from vaccinations, much larger numbers. Now, we can have that debate, and we'll get you at plenty of studies, okay? And the studies will be, he's shaking his head, but that's what the vast body of mainstream researchers and mainstream healthcare providers feel. Now, I don't want to disparage my colleagues that are up at this table, okay? But I will tell you that we are going down a rabbit hole to demonize the vaccinations. And maybe someday we will find that there should have been more transparency. Maybe people will find ultimately, that vaccines cause more harm than people were able to report at the time. However, it's my firm belief as a provider of healthcare and a person who had to make a state plan that there is value in providing vaccinations like this. And next time we have a pandemic, It's going to be even more serious if it ever affects children. I will tell you, people are going to clamor for vaccinations if children are terribly affected. And the country, you think it was shut down before, it's going to be shut down 50 times worse. We worked to open the state. That was a misrepresentation by the good senator from Ohio. We worked to open the schools and open the state by just making sure people had a test so that they were negative. It helped us. It helped us. And we didn't force people to get vaccinated if they wanted to travel. And I didn't support mandates, just so you know the truth.
That's fine.
Right. So a lot of this, of course, is tilted very heavily to demonize this vaccination and the process. And I respect if the data comes out and shows that, or someone covered up, I respect that.
So I will say the COVID cartel was tilted very strongly to demonize these people, okay? To vilify them, to offer retribution. So no.
But you just called them a cartel. You don't think that's demonizing somebody?
So there's no doubt this panel is definitely tilted toward one side, but the vast majority of the media and the agencies and everything else are tilted toward the one side, and that's what's so frustrating. The reason we'll have a tough time the next pandemic is because our federal health officials and the media lied to us, and we have proof they lied to us, and we have proof that they went and they used the power of the federal government to have social media companies censor people. Dr. Walskog, I do want to cover this because this is egregious, and people committed suicide because of this. But talk about how Facebook, after our event in Milwaukee, talk about how Facebook repeatedly shut down the support groups for the vaccine injured. That was their only lifeline because they could not get help. They weren't believed. They only had each other. And so they had these Facebook groups, and Facebook shut them down, and people lost contact, and people committed suicide because of it.
Yeah, so this is now earlier in 2021 when there was just a couple of isolated people across the country early on. For example, Breanne Dressen, who's my co-chair at React 19, she was injured during the AstraZeneca trial, so very much in the fall of 2020. And early on after that episode, she started communicating with some other people across the country, and her husband has some connections out at the NIH. That group started communicating with Dr. Nath, who is a neurologist at the NIH, who clearly confirmed that these injuries were vaccine-related. These people started giving each other support, really. What do we do? What do we do? Communicated with Senator Johnson's office. And in the end, they had a press conference in June of 2021 in Milwaukee, and the idea of the press conference, again, don't let me speak for you, Senator, but was just to allow these people to be acknowledged and to communicate their story. Well, not only did the media show up and not cover their story, it turned into a hit piece basically on Senator Johnson, but more importantly, within 3 to 5 days after that press conference, all of those support groups that Breanne Dressen had set up were all shut down. And in retrospect, they found out that, through the White House Communication Office, who was communicating with another contractor who was following her, and they directly through the White House Communication Office shut all those groups down. And you might say, well, it's too bad they can't communicate with each other. No, some of the people were suicidal and subsequently killed themselves. So this resulted in,
and Governor,
this is
again, I've heard you say, that's, and we should never do that, and it's regrettable and all kinds of stuff, but that's what happened. It happened repeatedly. It's still happening.
Look, let me support Dr. Walskog, okay, for a moment. Okay, first, I will be empathetic. It is terrible. And believe me, this is not anything that I would do. But let me just say this.
Peter Marks didn't find it terrible because he's behind it.
Okay. Well, but I do want to say that is terrible, and we should have open communication. However, that is not necessarily what I'm feeling. The love here in the hearing, okay? And mind you, I spent 14 years on your side of the desk, and I spent now 6 years on the other side as an executive. The truth is, it's always somewhere in the middle. People have their biases, and if it's true that the Biden administration, encourage people to not share information. That's bad. But there was another president also that was encouraging the vaccinations. And so we had two presidents, one Republican, one Democrat, in fairness, who they promoted the vaccine. And so all this conversation about not sharing enough of the potential risks and so on, everyone, and I would say this, everyone, including you guys and us and these good people, we're all responsible as a society to do our best to communicate. And when I hear words, just forgive me, when I hear words, you use the word cartel, and I'm not going to defend anyone. I'm saying that word is explosive, okay? And
it was developed out of firsthand experience dealing with them.
Believe me, and I have plenty of words to share about the people that threaten my life. Many, many times, because I was a public health official, not even in favor of the things they were threatening my life over. Many times. Had to send it to our attorney generals. I'll get you copies of that too, Senator, if you'd like, okay? Pretty awful stuff when they threatened my daughter's life. We have also an 18-year-old daughter, sir. And so that is the problem here. Now, I am appreciative of the process you're going through, because we should look at the horrible episode, which is what COVID was, and do better in the future. But if it ends up being skewed to the demise or the suppression ultimately of vaccinations, which is what a large part of society is fighting to do, then we will all lose.
So
and
again,
that's why I'm speaking up.
What we're trying to do is restore integrity to science, which it has been corrupted. Again, you pay for science, you get the result you want. You got Fauci paying for science for 40 years, he's getting the result he wants. So again, I'm begging you, please provide the studies, the citations that prove that the injection actually reduced severity of symptoms, prevented deaths. Give us those studies so we can throw those in the hearing record and compare them to other studies like, for example, the Lassiter study or Lataster study that I did enter.
It will not be difficult, Senator. There's so many.
And again, listen, as I said, I'm well aware of the fact 5. I think I've given you a fair amount of time to respond and stuff, and I've tried to be respectful.
I'm used to talking a lot. It's okay.
We all are. It's an occupational hazard here, and we'll just prove it here, Senator Blumenthal.
Thank you. And I'll have to be quick because I have to actually go to the floor. I've just been at my other committee meeting. And I want to ask you a kind of yes or no question, Governor Green. HHS apparently is making plans to change the way that vaccines are approved, requiring placebo trials for vaccines that have been used previously for decades. In other words, the clinical trials on vaccines already in use will involve placebo trials. I understand a lot of doctors feel that this practice would be unethical. Do you agree?
Yes, that will be unethical.
Thank you.
And it will be unethical because we already have demonstration that people get protection. So it's unethical to give them a placebo and watch kids die of meningitis or diphtheria or polio. That's why it's unethical.
It's not unethical to study. It's not unethical to research. It's not unethical to run trials, but to possibly put people at risk when a particular vaccine has already been proven safe and effective and has been in use for decades, that would be unethical.
Correct, Senator.
Thank you. I want to ask Dr. McCullough, I understand that you are an executive of the wellness company, and that the wellness company has made money from the sale of supplements and other, quote, spike detox products. Is that correct?
I'm the Chief Scientific Officer of the Wellness Company, which is a national company started in 2022. It delivers healthcare. So it's a company of doctors. Also provides nutraceuticals and supplements, fully prescribes drugs across the range, health education materials.
How much money has your company made from the sale of spike detox product.
And the company has innovative products like spike detoxification based on peer-reviewed studies demonstrating the scientific underpinnings for a combined use of
Well,
three over-the-counter nutraceuticals, which are nattokinase, bromelain, and curcumin. You can buy them anywhere on the internet if you want them. So the company, I don't have the company's balance sheet with me, but I can tell you its overall valuation right now is about $50 million with an M. And that pales in comparison to the tens of billions of dollars that the government spent on vaccines that have caused great harm. At the Wellness Company, we are trying to help the country recover, whereas further vaccination is putting the country into a big hole in terms of damaging their health care.
And your
audience, please.
Your company, that company also makes ivermectin? Ivermectin?
The company can prescribe, the doctors can prescribe ivermectin, they can prescribe Paxlovid, molnupiravir, they can prescribe any drug within the pharmacopoeia.
How much have been the profits from the sale of that drug since 2020?
Well, it's prescribed, so whatever pharmacy delivers it, like CVS or Walgreens, they would derive any
I'm
profit.
talking about profits for the company.
It can't, because they prescribe drugs to pharmacies. The pharmacies are the ones that people pay to get the medication.
Do you have a personal share in profits from the wellness company?
Yeah, I receive a set salary. I don't receive any % share of profits, and I have a very minor equity stake in the company. I work there part-time. I'm full-time in practice. I'm also the president of the McCullough Foundation.
But you do share in the revenue and profits.
I receive a set salary.
Let me ask you,
so that's
again,
it's an incorrect assertion. I get a set salary. I do not have any sharing of any revenue that comes in.
Okay, thank you.
Okay?
Has your board certification ever been revoked?
I resigned from the American Board of Internal Medicine November 11th of 2024 due to an ongoing dispute over the term you've used, misinformation, which is a propaganda term. It's a leverage term. So I had a dispute. I resigned from them. Listen, I'm one of the most published people in the American Board of Internal Medicine. They rely on my research for a lot of their board materials.
So you're no longer board certified?
I'm board certified by the National Association of Physicians and Surgeons. There's many different organizations that provide board certification.
Which one did you resign from?
The American Board of Internal Medicine, after 40 years of a perfect clinical track record.
Thank you, Mr. Chairman.
A perfect example of the vilification of people that had a second opinion. By the way, it's always my understanding in medicine that if you had a serious health condition, you go seek a second opinion, because nobody has all the answers. Every human body is different, but that was an unfortunate line of questioning. Mr. Siri, do you want to describe why it's appropriate for HHS Secretary Kennedy to actually do some research on vaccines? I'm quite sure, tell me if I'm wrong here, but when Mr. Kennedy pressed Fauci for the random control blind placebo trials on childhood vaccines, thought, oh yeah, we've done all kinds of them. Couldn't produce one. I know in testimony we've had other officials of the CDC or FDA ask the same question. They just can't come up with them. So can you set the record straight in terms of what studies have actually been done on the vaccines on the childhood schedule?
Absolutely. So in my 66-page submission, I set out every single routine childhood vaccine on the CDC schedule today with sources citing to the FDA underlying clinical trial documents that confirm. So if you dispute this term, you got to argue with the FDA. Not a single routine childhood vaccine on the current schedule, other than the Covaxin licensed for 12 and older, was licensed based on a clinical trial in which the control group received a placebo. And if the control group received another vaccine, that vaccine was also not licensed based on a placebo-controlled trial. That is all set forth in here. It is categorically accurate, a placebo meaning an inert substance.
By the way, do you want to just talk about some of the most egregious examples? One I found, and this is off of a blog, or I mean off of a podcast, but I'm assuming it's true because it hasn't been disputed. Apparently, the approval for the aluminum adjuvant, in vaccines was done off of a trial with 4 rabbits. And
aluminum adjuvant
one of the rabbits died. They killed the other ones after 28 days and found all kinds of aluminum in the body, but they approved it anyway. So good go. Is that true as well?
Aluminum adjuvants are not, they're used to induce autoimmunity in lab animals. They are part of the active ingredients. They're not separately approved as their own standalone product. Injecting a child with just aluminum adjuvant would be entirely unethical because it has no therapeutic value in and of itself, unless you want to treat them like a lab animal.
I'm not suggesting do that. I'm just saying, but that's what it was approved for use in vaccines.
As far as I'm aware, actually, it's never been approved, aluminum adjuvant standing alone.
Oh, okay.
And I'm not aware of any such approval. But to answer your question, why? Why look at the safety of of childhood vaccines? And the answer, I think, is this. We should be looking at all environmental insults because we are in the midst right now of a pandemic. There's been a lot of talk. We got to be ready for the next pandemic. We have a pandemic right now. It's a pandemic of chronic disease amongst our children. Over 50% of kids in America have a chronic disease right now. That's up from under 13% in the early 80s. What's changed? What has caused massive immune dysregulation to occur amongst our children? Why do I say that? Because most of the chronic diseases that we've seen exploding, asthma, you go down the list, have an etiology in being a form of immune dysregulation. Not our, and I've set that forth in my submission as well. So you have an explosion in chronic disease since the early 80s. Most of those chronic diseases are a form of immune dysregulation. What has changed in terms of might be causing the immune systems of our children in mass to go haywire? Well, maybe we should start by ruling out the fact that we have gone from 3 injections on the CDC schedule in 1986, the year that the National Child Vaccine Draft was passed, to currently, if a child gets the full CDC schedule, follows it today, by 1 year of age, gets 29 injections, including in utero, okay? 3 to 29. And every one of those vaccines, as I mentioned earlier, was clinical trialed and licensed by a company knowing they would not be liable for design defect claims. We need to study that,
so maybe
like
you ought to,
everything else.
study that. Okay, I think we've probably gone about as far as we're going to go today. What I am going to do is give each one of you, and we'll end with the governor. You can have the last word. Well, I'll probably have the last word. But give you each, and I really respect it, not much more than a minute. If there's just something non-itchy point you want to make, can you make it in a minute? And we'll start with you, Dr. McCullough.
You've asked for us to cite evidence. 3 papers by Nathaniel Mead, who's in the audience today, a former National Institutes of Health writer, 3 of them that contain nearly 1,000 references, so they're all there in these papers, have concluded that the risks of COVID-19 vaccination far outweigh any theoretical benefits. We've heard countless wishful thoughts from Senator Blumenthal and from Governor Green, Dr. Green, but they're wishful. They wish the vaccines would have saved lives. They wish the vaccines would have reduced severity. I can tell you, because you know this, I was one of the few doctors who was on the real front lines of treating acutely sick patients at home. That's how we reduced risk of death, not via a vaccine. The marathon runner, he passed away because he didn't receive effective early multi-drug treatment. It didn't matter whether he took a vaccine or not. Our CDC knew about thousands of patients fully vaccinated early in 2021 dying of acute COVID-19. It was abundantly obvious the COVID-19 vaccines did not reduce the risk of death. I don't want America to be fooled by this hearing today, thinking that the vaccines save lives, because they didn't.
Dr. Vaughn, please, audience, please. Dr. Vaughn.
So I challenge physicians to really return to the 2 C's of medicine, which is care about the person, the actual human being in front of you, and actually be curious about why they're there and why they seek help, not tell them that it's all in their head and there's nothing you can do. And nothing I have read has said that your problems are problems that I can do anything about. Instead, especially when we look at vaccine injury and long COVID, we're talking about 10 to 15 million people that are suffering, and we have a medical community that doesn't know how to help them. We have to study it, and we have to get back to caring about our patients and being curious about what their ailments are.
By the way, real quick question, because I meant to ask this. You hear long COVID, you hear vaccine injury. You know, kind of my assumption is most doctors look at a vaccine injury, call it long COVID. You know, what do you think the breakdown is? Because long COVID exists, right? I mean, that spike protein's a nasty thing.
And so just again, I think one of the biggest things is, at least in the 4,000 patients I've seen, about 80% of them have been vaccinated, 20% have not. And so long COVID does not equally mean that you have had to be vaccinated. There's plenty of people that didn't get vaccinated that have long COVID. But the problem currently in the way the studies are done is they are not disambiguating that data. And it needs to be collected, and we need to study it.
Okay, Dr. Thorpe.
Thank you. I'm an extremely busy clinician, 45 years, okay? When I just in the past, in my tenure, 4.5 years, while I was working through the pandemic with SSM Health, 4.5 years, I saw 27,500 high-risk pregnant patients. I was extraordinarily busy. I published extensively during that time on the government data, based on Pfizer's data. I gave it to my chain of command. Never once did they treat it as science. Never once did they allow me to present in grand rounds. And after I presented under your last testimony in 2022, I was fired from SSM Health because I brought it to their attention. It was never discussed at a department meeting or at a division meeting or at a grand rounds. That's not science.
That's corruption. Dr. Walskog.
Thank you. I'd just like to review a little bit about some of my frustration with regards to continually hearing how vaccine injury is rare. So just for a second, let's all look at big numbers. There's over 17 billion doses of COVID vaccines given worldwide. The Freeman study shows, and again, this is just for serious adverse events, ones of special interest, 1 in 800. That's 1/8 of 1%. Multiply those two numbers, and you have about 22 million adverse events to COVID shots worldwide. Multiply that by 4.34%, which is about our U.S. population as compared to the rest of the world. That's over 900,000 serious adverse events to COVID shots here in the United States. And I think it's time to recognize these people, to research them, to provide them care, which they are not getting, and to consider getting them, and really getting them fair and just compensation. Thank you.
I think it's well past time. Mr. Siri.
I'm just going to quickly correct the record on a few things I've heard here today, if that's okay. First is that most vaccines, including most childhood vaccines required for school, do not prevent transmission. They're just personal protection, like pertussis vaccine, activated polio vaccine. And I've heard a lot about COVID vaccine. COVID vaccine does not prevent transmission, which makes a lot of what was discussed here today, when you put it in that light, doesn't make much sense. And if it does reduce symptoms, it actually makes you more likely to transmit, because if you don't have as much symptoms and you're still transmitting, you're less likely to stay away from other people. I've also heard people talk about what the FDA's new guidance is. They're no longer going to give COVID vaccines to those who are in low-risk groups. That's not what the FDA said. Read it. What they said was that they're going to require proper clinical trials for those in low-risk groups, as they should. And I don't understand why there was so much talk about being opposed to this new FDA guidance. Why do we oppose gold standard science? Also, in all this discussion about deaths from COVID-19 vaccine, since we're going to rely on clinical trials, let's look at what happened in the clinical trial for the Pfizer COVID-19 vaccine. 21 people died who got the vaccine. 17 died in the placebo group. That's what happened in the clinical trial. And if we're going to then look at all-cause mortality, those match up pretty good, okay? The FDA, when it came to getting 95% effective, remember that at 8 people in the placebo group had symptoms, 162 in the vaccine group had symptoms, putting aside there were another 3,000 that weren't tested that had symptoms. They used that statistical comparison to get their 95% figure. They should have done the same thing for deaths, but they didn't, because it doesn't fit their approach to get this product on the market. And so they let Pfizer explain away all the deaths, even though there were probably almost twice as many deaths of COVID, of cardiac related. Also,
you got to ask yourself, it's been 4 years that they're telling us the COVID vaccine is safe. So if it's safe, why do they still need immunity? Why does the manufacturer of this product still need immunity? All you'd have to do is 2 things to not get sued, just like you do with drugs. 1, make it as safe as technologically possible, and 2, disclose the risks. Then you can't sue for design defect claims, and you can't sue for failure to warn. Why don't they just lift the immunity, let them make it as safe as they can, and disclose the risk? Even drugs given to small populations can exist and make a profit because they do those 2 things. And why, after 40 years of childhood vaccines, can they not lift the immunity for a lot of them? Why? You got to ask yourself that question, because they don't either want to make them safer, because for whatever reason, or they don't want to disclose the real risks.
Okay, Mr. I got to, okay.
I have 3 quick more?
No, I've got to move on.
I got it, okay.
Governor Green.
Okay, thank you for having me, Senator. A couple of things. I feel strongly about this. I feel strongly that vaccines save lives. I also acknowledge people who have different beliefs. I will say that a lot was said about being civil and kind to people who have disputed positions. Just so you know, one of the gentlemen who is on the panel today had their organization send out a hit piece on me back in my own home state. It was a very unusual thing as I came to testify in good faith, talking about my response, but also talking about the things that have nothing to do with COVID, talking about how I am as a governor. So there is an ugliness out there that we all are going to have to navigate, and I want to acknowledge that. I will tell you that I oversaw a public health mission which resulted in a 90% vaccination rate, which is quite extraordinary for this circumstance. And for our state, which was a closed system, we did very well. We had, and I will bring you, probably to your dismay, a truckload of data and paper and information, and it will be compelling. So hopefully that will be considered by those who have different opinions. And I will consider their different opinions. But I will tell you this, I will caution everyone that as we go down the rabbit hole of possibly moving away from vaccinations or vaccination programs, be very careful what you wish for, because as a physician who is still practicing, as a person who has spent many, many years practicing for the public health service, mind you, we will be in dire straits if we walk away from vaccinations and science. And the last thing I will tell you is I sat in, I believe it was this room, or it was a similar room for sure, listening to the Secretary of Health and Human Services prior to his swearing in talk about how he wouldn't even walk away from his professional life and his profits based on the work he's doing. And I'm not trying to demonize him, because as I've shared with you, I believe in some of the things that he supports. But when I hear from colleagues, people who are testifying about immunity, they have interests, and those interests should be walked away from. If anyone's going to try to influence you, walk away from your interests, walk away from your vested positions. Be truth tellers, perhaps. Be part of the public health solution, but do not suggest that you are not compromised as you suggest others are compromised. We should fight for equality, and we should fight for that kind of standard on both sides. That I recognize from the fellow testifiers, but there has been quite a lot of hypocrisy. And because I'm one of 6 and had to face some somewhat, let's just say, caustic moments, I don't want to complain. I just want to say the future of healthcare is going to be for us to come together, not demonize one another. And we can talk further about that privately. Thank you, sir.
Well, I regret caustic moments. I regret any kind of attacks. Don't support that at all. But I also don't like being accused of walking away from science. I mean, we're trying to restore integrity of science. I think it's indisputable it's been corrupted in many cases. So I want everybody at the table, okay? And we'll take a look at our next hearing in terms of how we maybe create a little more balance here. But regardless, I do want to close and conclude that I know, as I said earlier, there's a lot of anticipation for this hearing. You know, I appreciate that. But I also want to caution everybody, this is going to be a slog. This isn't going to be some one hearing or one piece of information or one study that, okay, this side proved they're right or the other side. You know, science isn't like that. To me, the best definition of science is skepticism. Now, skepticism hasn't been allowed That'd be my point, Governor. We haven't been able to ask these questions. Those who do are vilified. Their careers are destroyed. Their licenses are pulled. Their accreditation is gone. Because you do have a cartel. It exists, okay? I think it's undeniable. So, again, we're the little people in this debate and argument. You know, the side, you know, the other side has all the dollars. They've got the media. They've got the bullhorn, all that kind of stuff. These are the little people here. They're being crushed by it. They've been crushed by it. But they've stood tall, and I appreciate that fact. But that being said, I'm not buying, you know, I don't just blindly say, okay, you said that, so that's what it is. I'm asking all of them, all of you, provide the science, be willing to debate. I'm hoping on my next hearing, because we did this in my events, we always invited the federal health officials. Okay, now probably need to get the federal health officials from the Biden administration. They're the ones kind of responsible for a lot of that. Come forward. I'll give them an open forum. I'll give them, you know, equal access. The executives from Pfizer and Moderna, come on forward, defend yourself, okay? Engage in the scientific debate. They haven't been willing to do that in the past. They hid things. You've had to, you know, not only FOIA, but then sue under FOIA to get the information. That's, again, so there's a history here. There's a reality of what's happened. If there's frustration, a little hard feelings, you think you see it bubbling out. But again, put yourself in the shoes of the vaccine injured, who have seen their groups shut down by Facebook, who have got the emails from the families or the final suicide note for one of those people. There are people in this room that have gotten that suicide note. And they're still not acknowledged. They're still being gaslit. They're still being vilified. So that's the reality of the situation. I ran for a third term because nobody was advocating for the vaccine injured. And I apologize for not having, no. I apologize up front for not having a hearing earlier, but it takes time to get this information. And again, we only had a little bit, which allowed, you know, Senator Blumenthal to pick apart the evidence. I didn't say we made the full case. You know, I've got indication we can make a pretty full case over the next at least 2 years during this chairmanship. So that's what I'm dedicated to doing. Stay tuned. There's going to be more to come. God bless all of you. By the way, got to do the record for this hearing will remain open for 15 days until Thursday, June 5th, 2025 at 5 p.m. That's when you submit all these studies. For the submission of statements and questions for the record, this hearing is adjourned.